Good morning and welcome to the fourth day of this very special Gratitude Week, a tribute to health guardians. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, a not-for-profit social impact initiative to promote health for all. We are almost halfway through this extraordinary 60 hours long observance, which was initiated on July 1, the National Doctors' Day. This is our humble way of expressing our appreciation and indebtedness to all those people in the healthcare and allied sector who are working and risking their lives while ensuring that healthcare continues to reach to everyone who needs it despite this ongoing pandemic. In the past 3 days, we had the honor of hosting lawmakers such as Minister of State for Health and Family Welfare, Government of India, Sri Ashwini Kumar Chaubey, and the senior spokesperson of ruling party and MP, Srimati Meenakshi Lekhi, joining the Gratitude Marathon and expressing their solidarity and thankfulness to the nation's health guardians. We also had eminent healthcare leaders and those who are leading our fight against COVID-19 from the front. These esteemed leaders included Dr. Randeep Guleria, the Director of All India Institute of Medical Sciences, New Delhi, Professor Srinath Reddy, President of PHFI, Dr. Harsh Mahajan of Mahajan Imaging, Professor B.N. Gangadhar from Nimhans, Bangalore, Professor Debashish Danda from CMC Vellore, and directors and heads of major public health facilities such as AIIMS in Rishikesh, Bhopal, and Raipur. And apart from them, scores of other important healthcare practitioners joined us during this initiative. Not only this, these past 3 days have also saw a lot of patients, including those who have won the fight against coronavirus, and even school children also joined us to share their experiences, their love and gratitude for our doctors and healthcare workers. As Dr. Guleria said, the situation we are living in comes probably once in a lifetime. The extraordinary dedication and selfless services of millions of health workers this hour of crisis will inspire the generations to come. Therefore, their services should not become lost in oblivion. Let's have a glimpse of what we saw in the first 3 days of Gratitude Week.
आपने विशेष करके जो हेल्थ केयर इकोसिस्टम को इंडिया में जो आपने एक हस्ताक्षर के रूप में ISW ने जो विषय आज का प्रसंग जो है, मुझे बहुत खुशी हो रही है कि डॉक्टरों का जो ये वर्चुअल मीटिंग आज आयोजित आपने किया है, मैं आप सबके प्रति आभार व्यक्त करना चाहूँगा, विशेष करके ISW के प्रति, और आपके प्रति शुभकामना व्यक्त करता हूँ। और जो भी आज के इस कालखंड में हम लोग एक दूसरे से जुड़े हैं, मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूँ। आइए आज हम सब मिलकर के कोविड हारेगा, देश जीतेगा, इसमें कहीं दो मत नहीं।
Doctors accept it as part of their duties, and very often they feel that this is part of what we call an occupational hazard, and patient care is paramount despite the risk that they have. And they would see patients knowing that they are infectious, they can give them the infection and still continue to do that, because what really matters is that if you cure a patient, the smile on a patient is something that is what doctors really yearn for. No one is an island. And this is something that the pandemic has really taught us, whether it be governments, whether it be countries, whether it be public sector, private sector. Everyone has to support each other if we have to fight this battle together.
Why we should also be proud of our profession is that it is a profession which is a service, not a business. And here we use our skills to serve a social purpose. And we deliver competent, committed, and conscientious service, essentially for the welfare of humanity. And that is the ultimate pinnacle of the profession's values. So I think remembering them and celebrating their contributions is a very important element, and I salute you for that idea.
I think uh, not just the medical profession, but a lot of other non-medical people also have to play a role in mitigating this stress-related distress which is there with all these populations. That there have been several lessons that we are going to learn, several reassurances that we have already got, and I'm sure all of us have to convey to the public. Priority is to avoid getting infected rather than having to jump to reach a hospital for not so emergency, a psychiatric or neurological condition. The credit to the Indian population and an ordinary Indian citizen that he or she takes any ruling that is coming from the ministry seriously, and a good chunk of them follow.
There are enough signals for you to save yourself. Mortality is an exception, not a rule. Recovery is the rule and not an exception. This is as on today, 2nd July of 2020. This may not have been true 15 days back. This sentence may not be true after 15 days. After 15 days, we may say 0% mortality. But as on today, yes, this virus mortality with adequate and effective and early treatment, nobody should die. Thank you.
It's the joy of saving lives, the joy of seeing patients when they are getting well, the joy of Ayush.
So here you saw some of the glimpse of past 3 days of Gratitude Week. We are honored to have the leading lights of Indian healthcare with us today to make the fitting kickstart for the 4th day of Gratitude Week. Let me introduce our esteemed guest today, this morning, on the inaugural session of Day 4 of Gratitude Week. We have with us Dr. M.R. Rajgopal, is the chairman of Pallium India and director of Trivandrum Institute of Palliative Sciences. He was one of the founders of the pioneering Pain and Palliative Care Society in Calicut in Kerala, which made palliative care a popular movement in that state, and is now working tirelessly to make this a national movement. We will be joining by Dr. Sudeep Gupta, Director of Advanced Center for Treatment, Research and Education in Cancer at the iconic Tata Memorial Hospital in Mumbai. Dr. Gupta is a professor of medical oncology and has a special interest in breast cancer and gynecological malignancies and early drug development at other areas of research that include cervical cancer, ovarian cancer, multiple myeloma, and lymphoma. We are also honored to have our patron, our mentor, Dr. Sanjeev Kumar. He is the chair of Indian Academy of Public Health and also the member of ISW Council Advisory Board. So welcome Dr. Rajgopal, Dr. Sanjeev Kumar, and we will be soon getting Dr. Sudeep as well. Before we go forward to our today's inspirational and insightful experiences from our esteemed guests, I would also like to inform to our audience today that on the inaugural day of this Gratitude Week, the ISW Council has also proposed setting up of a memorial for all healthcare workers who have made and continue to make their sacrifice and significant contribution in ensuring the health of our society. We are happy to inform you that the Honorable Minister of State for Health, Ashwini Kumar Choube, has agreed to consider it further, while the Member of Parliament, Ms. Meenakshi Lekhi, promised to take it up in the next Parliament session. But that may not be enough. We will need your support as well as your contribution to make this a reality. I would request all our audience to please sign the petition which we are making to the Government of India to set up this gratitude memorial. You can sign this petition on the change.org. The link of that is also provided in our chat box, and you can also find it in our Facebook page. So the fourth day of our discussion is going to focus on the chronic diseases that can be managed only with sustained medical care. In the third and fourth day of our initiative, we have tried to cover the entire human life cycle and to highlight that how we are dependent and actually have to get care from our medical professionals, doctors at every stage of our life, from in the womb of our mother to the end of life. The third day, we saw how we need to work and how our doctors are working to ensure that the healthcare is reaching to every mother, every woman. We also saw that how doctors are passionately working to ensure that we are able to save our children, which in turn help us saving our nation. We also heard about how many non-communicable diseases are crippling our society, and how doctors are ensuring that the care is reaching to each one of those who need it. The fourth day is also going to be on the same. During this pandemic, many patients suffering from chronic diseases could not reach hospital due to lockdown and also suffered due to lack of medicines, sometimes in pharmacies. We have seen cancer patients missing their chemotherapies session, and those who need dialysis feared going to the hospital due to the fear of getting infected. It may not be a reality that the healthcare was not available for them, but many times the surrounding fear prevented them going to hospital. The session which we are going to have on the inaugural part of our gratitude week is about people can go in lockdowns, diseases cannot. So how we can make care and cure available to everyone, and how our doctors and medical professionals ensure that we are managing and tackling this challenge during this pandemic. So I would just welcome again Dr. Sudeep Gupta, who has joined us, and I'll begin our discussion, and we'll go to Dr. Sudeep Gupta first. Dr. Gupta, you are heading an important department of the India's iconic, legendary, and I think center of excellence in the cancer care. Cancer has spread its presence across our society. We are seeing that almost maybe more than 2 million patients we have in our country, and you can correct the numbers as you will be having better numbers. And we are seeing that almost over 1 million patients are diagnosed every year. Maybe the similar number of patients are also dying because of cancer. Dr. Gupta, you have seen this almost 4 months of pandemic lockdowns. What has been the situation related to cancer patients, and how effectively our healthcare system could cater to them so that this disease is not becoming another collateral damage of this pandemic? Dr. Gupta.
So good morning, and first of all, I would like to thank you for inviting me here, and my greetings to Dr. Rajgopal. We had the pleasure of hosting him in Tata Memorial Center last year for an oration. So coming to your question about how has the COVID pandemic impacted the care of cancer patients, like every other sector, the care of cancer patients has also been impacted, and your numbers were absolutely spot on. There are about 1.2 million new cancer cases every year. We see approximately 60,000 new cases at Tata Memorial Center every year. I think the medical fraternity and oncologists from all over India have tried to adapt to the situation as as also the patients. So at Tata Memorial Center, what we have done is that we have continued at about 2/3 of our capacity. A number of patients visit our center from all over India. We have established remote consult centers for those patients. We have tried to connect them with local oncologists when they have not been able to travel to our center. And we have continued to perform both curative as well as emergency surgeries at our hospital. I'm happy to inform you that over a 40-day period from the beginning of lockdown to the end of April, when this data was analyzed, we performed almost 520 surgeries at our hospital. These are all cancer surgeries. And these resulted in all of these patients getting cured of their disease, and the rate of COVID infection was actually very low. We have established some other patient-centric methods, measures like helping them with accommodation, helping them with rations, helping them with other amenities. And I must say that the patients have also risen to the occasion. They have braved a variety of odds to actually travel to their nearest hospital and continue to receive care for their disease, as have their relatives. So the COVID pandemic has impacted. Patients have not been able to travel to their preferred hospitals and to their preferred doctors. But overall, I would say that we have done reasonably well under the circumstances.
Thank you so much, Dr. Gupta. Dr. Rajgopal, you heard Dr. Gupta, and it's wonderful, actually very impressive and encouraging that around 520 cancer surgeries could be performed during this lockdown also, which is a fairly, I think a good number, and gives some assurance that the critical care was reaching to the people who needed it most at that time. Dr. Rajgopal, your area of functioning is very wide, and I was impressed to when I heard from you that how passionately you work in the area of reducing sufferings of people, and palliative care, which is the work which you are doing. To my understanding, which was I'm happy to accept that it was quite limited. I used to consider only it as a end of life care, but what you gave is a very different perspective, that how palliative care is a part of every stage of care and has to be embedded, because more than making it an end of life, it is more empathetic way of delivering care. Dr. Rajgopal, what is your overall experience of this 4 months of lockdowns, pandemic, and you being the champion of equitable care to all? What is your opinion or experience? Were we able to provide equitable care to all those who need it? Or if it was not in that level, how it can be improved further?
Kamal, thank you. And Dr. Sudeep Gupta, thank you for that brilliant beginning. And I will start by paying respect to your institution. Your institution never faltered. From that time of lockdown, you showed an example by continuing to function. Unfortunately, that did not happen across the nation. A lot of institutions closed its door, succumbed to the panic, and just stopped functioning. So, Kamal, we have certainly examples to show, like Tata Memorial Hospital. Unfortunately, we had to make sure that the next time, as the Honorable Minister said it, these things happen again. The next time something strikes us, examples like Tata Memorial Hospital are taken, how they function. And that should be replicated by all healthcare. Healthcare institutions cannot stop functioning. If it doesn't stop functioning on the war front, where it's most needed, the same applies to the country.
Thank you so much. It's quite a brief and I think loaded statement that while institutions like Tata Memorial Hospital could perform and continue to do the work which which they are supposed to do, other institutions could not. But I just want to would like to hear a little more that what is your opinion? Where that equitable care could not reach to the people? What may be the volume or the magnitude of that, if it is there?
Kamal, in 2018, when the world nations got together at the capital of Kazakhstan, Astana, and came out with a declaration, they made some powerful statements. One, healthcare should reach people where they are when they need it. I'm sorry, that did not happen. What we saw, even in Kerala, where things were a lot better than some other states, what we saw was people could not access available services. The hospitals were there, the pharmacies were open, but there was a huge, wide gap between people and these establishments. Part of the reason is physical, the lockdown. Part of it is emotional. The 3 days later after the lockdown, we took that much of time to collect ourselves. We gave a press release. Anybody with serious health issues where you think some support can be given, please contact us. This was in Trivandrum. And we got the calls. There was a 62-year-old man. He needed medications for his diabetes. He needed only to cross the road to get to the pharmacy. But he was in such panic that he couldn't bear to step out of the house. 3 days, medicines were stopped. Can you blame him? You can't always control on your own mind when you are living alone at that age. I mean, just as an example, actually, Kamal, dialysis centers shut down. Many did. Many continued to function, many shut down. And people didn't have money. We came across this auto driver who had already had a transplanted kidney. If he continued without his immunosuppressants for a week, his kidneys would be rejected by the body and the whole family would be destroyed. And he's an auto driver without money. Where would he get the money from? And only because he saw the newspaper and contacted our helpline, I'm sure the whole family would have been wiped out. And this happened across the country quite a lot.
Yes, so we saw those stories, Dr. Rajgopal, and this is definitely heartbreaking when you see that somebody who cannot access some very critical care because the environmental situations are not allowing them. Dr. Sanjeev Kumar, I would like to understand from you. So we saw Dr. Gupta saying that the institution could perform, and which is being appreciated by everyone, and Dr. Rajgopal also highlighted that. But Dr. Rajgopal is also highlighting that there were, I think, massive number of people who could not get that care, and he's bringing in some really palpable example also for that. What do you think? This gratitude week, we are doing this in thankfulness for our doctors, medical practitioners, workers, and all those who are involved in that. And they are the face of healthcare. When these kind of failure, which Dr. Rajgopal is identifying, is it a systematic failure, or it is the failure of those caregivers who normally get those brickbats of not delivery of these critical services? I think Dr. Kumar, you are on mute. Dr. Kumar.
Can you hear me now?
Yes, Doctor.
Okay. Thanks, Kamal. And I appreciate the wonderful introduction given by both Dr. Rajagopal and Dr. Gupta. what happens when you a crisis in health is the cracks in the health care delivery system get widened and they get noticed. When you talk of non-communicable diseases, and some of which were referred to by both Dr. Gupta and Dr. Rajgopal, we probably don't know all the diabetics, cancer patients, asthma patients, chronic obstructive pulmonary disease patients in the community. Of those whom we know, a large proportion don't have access to healthcare. Those who have access to healthcare don't have compliance, and these get widened further, and it gets noticed that, oh, these people non-communicable diseases, these are morbidities, and they are at a higher risk of death. So there are two ways in which it gets impacted. One is the direct impact, and second is the indirect impact. From the direct impact, we know that if everyone is susceptible to infection, but those who are 60 plus, those who have comorbid conditions, cancers, diabetes, hypertension, cardiovascular diseases, asthma, lung diseases, and also those who are smokers, they are at higher risk of having a complication and of dying. This is the direct impact. We know every day it is in the newspaper. Second is the indirect impact. Outpatients were closed. I stay in the neighborhood of All India Institute of Medical Sciences where I studied. OPDs were closed with the lockdown for weeks. Where will a person who needs a checkup for high blood pressure go? OPD attendance in private hospital in Delhi came down by about 40% to 50%. Half of them stopped going to OPD. The planned surgeries were postponed for both reasons. One is the patient didn't want to go to hospital because there was so much of scare, and second is all the resources in the hospital were diverted. So we need to, yes, in normal situation, make sure that non-communicable diseases receive adequate attention, and there is a special attention given to them because they are at higher risk of dying from COVID infection. There needs to be special attention given to those with non-communicable diseases during such outbreaks. It did not happen. Every resource was diverted to COVID, and gradually, when a lot of noise was made, they were brought back into the system. I'm very happy to hear from Dr. Rajgopal and from Dr. Gupta that they made sure that these services are available even during this COVID outbreak.
Thank you so much, Dr. Sanjeev. Dr. Gupta, you are heading important aspect of an institution which gets patients from across the country, not only the Maharashtra or the western or the let's say central part of the India, but maybe I think all across. When this the diagnosis of cancer, or the people who have already been diagnosed of cancer and they are in the middle of their treatment processes or the chemotherapy cycles and all that which they need to come, or maybe staying there, we hear those stories that how much influx of patients come to Tata Memorial Hospital. During the lockdown, all that got disrupted. What is your estimation or opinion that how many people you would not have been able to provide that care which your institution always stood for providing that care, and we might have lost many lives in sufferings and in trauma, that despite knowing that the treatment can come or they can get that treatment, they cannot reach to that just because the movement has been blocked.
So, thank you very much for asking that question, and let me thank Dr. Rajgopal for his compliments to our institution, and we continue to derive inspiration from Dr. Rajgopal and his work. So, you are absolutely correct that about 2/3 of our patients come from outside Maharashtra and 1/3 from Maharashtra. And if that is about 60,000 new patients every year, then you can divide that. Two-thirds of 60,000 is about 35,000, and if you divide that by one-third of a year, that is about maybe about 15,000. So that is a back of the hand calculation as to how many patients might have been unable to reach us. But let me say a couple of things. The first is that gradually the healthcare infrastructure in India is improving in many parts of India. So I'm not claiming that we have become developed overnight, but in many parts of India, for example, in Assam, in some of the other northeastern states, even in places like Bihar, Uttar Pradesh, and elsewhere, the healthcare infrastructure is slowly improving. And Tata Memorial Center has created what is called the National Cancer Grid. And this is a network of close to about 200 institutions from all over India who are connected to each other, who talk to each other, who deliver care by some common standards that are agreed upon. And we have a large number of our alumni and other individuals with whom we are able to connect our patients. So what we did very early on in the lockdown was to establish, both in Tata Memorial Hospital and ACTREC, is what we call the remote consult centers. And we provided, call center like facility where patients could call in. And because we have a robust electronic medical record, we have all the records, when the patient calls us with their case number. And we are able to suggest to them that if they were coming for a routine follow-up and they were in remission, then they could postpone, they could meet with their local oncologist. If they were already undergoing chemotherapy, then based on the response to the already received chemotherapy, we suggested whether they could continue under the care of their local doctors. Having said all of that, a situation like COVID and an unprecedented situation like COVID would have adversely impacted the care of many thousands of patients who would have come to Tata Memorial Center otherwise. And here, I would like to say that our society continues to have social inequalities. People who can pay for their care can afford to get reasonable quality care in many parts of India. But our public health system needs to be strengthened. And one lesson from this pandemic, if we have to derive it, is to strengthen the primary, the secondary, as well as the tertiary healthcare system. And I think Kerala is a very shining example of how within India we have a system whereby at least the public health emergencies can be brought under control and some semblance of normality can continue to be maintained. And this is not only now, we have to compliment Kerala because they also brought the previous Nipah outbreak under control. And I think there are many lessons from Kerala and from some other institutions and states, but we definitely need a strengthening of the public health infrastructure because that is what the majority of our population depends on. And we can't just think about the 5% of our population who's able to afford any kind of care.
Thank you so much, Dr. Gupta, and giving this very, honest assessment of that how many people might have not been able to get that care. But this is also very encouraging to hear that your national cancer grade could have ensured that some kind of care is reaching to the people where they were. Dr. Rajgopal, since I started, I'm not a doctor and I'm not a healthcare professional. But since I started writing on healthcare as a journalist or during my time as a healthcare communicator, I have always been hearing that Kerala is a shining example. And it's been almost now, I think, 15 to 16 years of hearing that Kerala is a shining example of be it a public healthcare system or maybe, education system. We saw that, as Dr. Gupta said, that Nipah virus combat, which they did very well, and the same health minister was on the front line fighting that. But so what does stop other states? And it's been 10, 15 years we are talking about the same good role model lying in our own country. What does stop other states to just replicate it? Or at least learn from that and do something, because we will keep talking about that we should learn, but I don't see we are learning. Or is it there that even Kerala health system also need to improve on, and that may not be as perfect as it is looking from far? Dr. Gupta, Rajgopal, sorry.
Thank you, Kamal. For one thing, by no means would anybody in Kerala claim that we are anywhere near perfect. We are a shining example only because we are doing better than others. Let us be frank. It is nowhere near where it should be. Having said that, you yourself have pointed out most of the major positives. You mentioned education, which is closely related with public health. Unless people are educated, it's difficult to get health across to them, because having it available in the health center is by no means enough. Secondly, you mentioned the leadership. We are all very, very proud of our health minister, Shailaja teacher, who, uh, who was absolutely marvelous. And the leadership found the support. They established advisory committees for various purposes, and the move was both scientific and pragmatic. But in the background of all this, there is another strong point. That's the community's involvement. This is almost invisible. The ASHA workers are such a prominent part of the whole thing. In every panchayat, the ASHA worker is phenomenal. In Kerala, I mean, in many parts of the country, but in Kerala, that's a very strong factor in getting healthcare across to people. But it is also involvement of the community in other matters. Like for more than, it's 27 years now since the voluntary activity started in palliative care in Kerala. Would you believe that there are more than 450 non-governmental organizations in the field of palliative care in Kerala? That, I mean, all of them are not formal registered organizations, but what it means is, if there are suffering people in my neighborhood, the local community takes responsibility to get some support to them. You mentioned access to healthcare. How many elders are living alone? Even in my tiny state of Kerala, would you believe, by 2015 estimate, there were more than 170,000 elders living alone. That doesn't include somebody living with a home nurse. Totally alone. And where would these elders get support? What our volunteers do is to move across to them. Make sure that they get care where they are. Not universal, this does reach everybody, but at least 40% of the needy get care in their homes with the support of the system. And another major positive is that Kerala established a state palliative care policy. Again, this is novel for the whole of the developing world. Every single primary health center, that's more than around 950 of them, has one nurse with training in palliative care, working only in palliative care. She visits every bedbound patient in that panchayat at least once a month. If a catheter needs to be changed, it is done there, and with some support from the doctor in the health center. So there are these factors in the background which to a large extent helped us to cope.
Good. That's quite inspiring. That there is a very well led, local and grassroots system available, especially which is functional. I think as you said, the system may be available in many other places, but the functionality and efficacy might have been an issue. Dr. Sanjeev, you have been seeing healthcare systems in India, outside India, across the globe. and have been also advising and helping other states to think and upgrade their healthcare systems. What does it that stops them from replicating something like Kerala, which is there shining for long and does not take much to just replicate the same model? I think we are part of the same country. We can exchange our ideas. We can, the. So is it the lack of ideas or skills, or it is the lack of will?
I don't think we lack ideas or we lack expertise. And if you look around the world, you have many Indians in leading international organization, name it WHO, UNICEF, or doctors providing healthcare in UK or US. So that's not. I think there is will, especially the political will. They make announcement in every budget of increasing number of medical colleges, and last few years, every government every year is trying to open more aims. By just giving name, you don't have a quality institution. So there is more of political compulsion in doing what they want to do than the real impact. And very important point Dr. Raj Gopal raised is lack of investment in primary health care. In countries, we heard about Kerala, how well they have done. They were reluctant to take on accredited social health activist scheme, but when they took it, they ran with it and empowered her, and she has become a very important link between community and healthcare system. She makes sure that people who need it, they get to the health facilities and get health care. The staff at sub-centers and primary healthcare center, I'll just give you a figure for UP, for example. They needed about 22,000 auxiliary nurse with midwives. They had about 18,000 of them. What prevents them from recruiting ANMs? You don't have to open new medical colleges. All the schools are ANM training schools are run by the government. They can increase the training if there is lack, but there is no lack of trained ANM. They can recruit them. Kerala, for example, recruited 276 doctors in one day on 13th of May, if I remember correctly. Why can't they recruit auxiliary nurse midwife? There were 2,000 positions of the level 2 which ANMs get promoted. 2,000 of those positions were vacant. This is only a departmental order they can issue. So lack of investment in primary healthcare emerges as a major difference between Kerala and other states. So I hope in the next budget we will hear more about opening more ANM training school, more male worker training school, more position for health assistant, male and female, who are supervisors for auxiliary nurse midwife. And to repeat what Dr. Rajagopal said, we need to provide health care to the people where they are and when they need it. Now the COVID epidemic also has reached rural areas. If your primary healthcare system is weak, we will have catastrophe in the making. Thank you.
Thank you so much, Dr. Kumar. So I think this story continues, and let's hope that this pandemic would be an enough jolt on to I think shake up all our government institutions and policymakers to not only announce more but also walk the talk when it comes to ramping up the healthcare system. I'll come back to the essence of our program. The essence of our program is that whatever it is, there are millions of healthcare workers, be it in Kerala or in any other state or in Delhi or in Mumbai, who are struggling, striving to provide healthcare in whatever manner it can happen. And at least that is the only silver lining we have as of now. Dr. Gupta, in your institution, where a huge number of healthcare workers are there providing care, and since you have done so many of surgeries, that means there a majority of that system was working. How has been the experience during this pandemic? What kind of fear, what kind of risks, what kind of challenges you and your teams, your people had to face while ensuring that the care keep going to the people? And how has been the overall support system from the society, from the government, and from your own patients in making that happen?
So again, thank you for that question. And like everyone else, healthcare workers are also human beings, and they are subject to the same fears and anxieties as the rest of the society. So, like everyone else, our employees, our healthcare workers, our administrative staff uh, have felt anxiety and some amount of fear during the pandemic. And it is natural because, you are not only worried about yourself, but also your family members, etc., and others. So, what has helped in our case is two things. One is that very early on during the lockdown and during the epidemic, we established standard operating procedures whereby we ensured that if somebody was to get exposed to this infection, it would not be a large number of people at one go. And I think many other organizations also implemented that eventually, but we were amongst the first to do it. So we did not land into a situation where, like many other hospitals, the entire hospital was shut down. Number two, there was an open channel of communication from the leadership to all the employees of the hospital, including doctors, nurses, other healthcare workers, as well as administrative staff. And it is not only the it is not only the actual healthcare workers who deliver health, but everybody should realize that the accountant who collects cash from the patients, and the person who cleans the ward, there are several other people who are all cogs in the wheel and who collaborate to deliver healthcare, and it is their anxieties and their fears that we have to allay. We also very early on in the epidemic established our hospital not only for care of cancer patients but also cancer patients with COVID infection and our own staff members with COVID infection. So, we have very advanced facilities. We are able to take care of emergencies. We are able to take care of very sick patients. We have top class intensive care facilities. We have knowledgeable individuals who are up to date with the evidence as it evolves. And once our employees and our healthcare workers realize that should they get COVID infection and become sick, they will be taken care of with state of the science treatment that is available anywhere in the world. I think their anxieties and fears were allayed, and then we were able to continue to function almost at full capacity. But given the constraints of the epidemic, we had to perform about 2/3 of our capacity, and that was mainly because patients from the other states could not reach us. So the idea is to collaborate with our staff members, to have an open line of communication, to care for them, to let them know that we will be there for them should anything happen. I will just take 30 more seconds. At ACTREC, which I head, there are about 6 infrastructure projects that are ongoing, and these are large buildings. And we had 500 construction workers in the middle of our campus during the peak of lockdown. And all of these individuals were, of course, they were struggling with anxiety about their family members. They were wanting to go back to their states. We ensured that they were also cared for during this epidemic, and we regularly communicated with them. I held open sessions with them, and from my own experience, if you are honest and if you answer most of the questions to your ability, I think systems can continue to function. It is only when you hope for secrecy and some diktats from the top that the system breaks down.
Thank you so much, Doctor. That's wonderful that not only the each and every person working on the system, but also those who are, putting something very important, creating that infrastructure, they were also very well taken care of in your institution. Dr. Raj Gopal, where do you see this, the same question for you also, that what the anxiety, challenges, and risks you saw when the people, whether providing palliative care under your guidance, under your institution, or across in the healthcare system of Kerala, or any other system which you have been monitoring. What is your opinion? And were there any gap because of the fear and challenges that healthcare could not reach, or these people rose above that and ensure that the care who need it is reaching?
Kamal, in the opening that you gave, you showed Dr. Srinath Reddy for about 10 seconds. And he said something. Healthcare should not be a business, it should be a service. So long as the leadership of any healthcare institution believes that, they would believe that the healthcare system's duty, this is, I am quoting ICMR, the healthcare provider's duty is to mitigate suffering. It is to mitigate suffering. It is to cure sometimes, to relieve often, and to comfort always. And there exist no exceptions to this rule. So long as the healthcare system goes by this principle, things will work to people's advantage. They will get the best care that is possible under the circumstances. We cannot give here in Trivandrum the same care that will be available in Memorial Sloan Kettering Institute in USA. That's not expected. Realistically, the optimal care, what we can afford to give, accessible to the common man, that's what we should be achieving for. Kamal, this COVID brought up all these issues where there was good leadership, like in Tata Memorial Hospital. The system continued, and I didn't know this. I didn't know, Dr. Sudeep, that you had taken care of those construction workers. I fold my hands to your institution. And we saw that to a large extent in Kerala. Migrant workers are called guest workers. Community kitchens were set up, and the state took responsibility to, when it was possible, eventually, not only to house them till then, but them back safe. So it's a lot about leadership, but fundamentally, it's about accepting the duty of care. And Kamal, if I may go one step further and take 2 more minutes, where does this take us back? I mean, okay, in maybe at least by June 2021, we should be rid of this virus. Hopefully with enough new vaccines and all, this would be something in the past. Will we go back to where we were? Where in a situation where 98% of the people with cancer did not get even basic relief, where a family had to go to the High Court of Andhra Pradesh pleading for permission to kill their only child because they could not bear to see the child suffering. While at the same time, that family had gone into an enormous debt. For a villager with no money, being 16 lakhs in debt is not a small thing. Will they ever survive? And the worst infliction of suffering, that child, after 3.5 years of pain, I can show the picture if you have a minute. That child, after 3.5 years of pain, died alone in an intensive care unit, snatched away from the family, not even being able to hold this appropriate care. These are 3 major ills of the system. 1, a disease-focused care which does not take into consideration pain and other suffering. 2, catastrophic health expenditure. Do you know that 55 million Indians are pushed below poverty line in India in 1 year? 55 million, 5.5 crores, more than 4% of our population in 1 year. And inappropriate end-of-life care. Will we go back to the same thing? COVID has demonstrated the impact forcibly. You mentioned the cracks earlier. The cracks are demonstrated clearly. Will we glue them up and proceed with a better system? Or will we forget all this and go back to the horror stories that we were living with?
I believe that there would be an improvement for sure, that this pandemic should lead to a certain kind of radical changes about people's perception towards health, towards healthcare, and I also believe that this pandemic will also make people expect their political leaderships also to put health first before anything else. Dr. Sanjeev Kumar, we are about to end this session. So one closing remark from you, and then we will go forward to our next session, which Dr. Sanjeev is moderating, and we will be joined by the next set of esteemed
Yeah, no,
speakers.
I will echo what Dr. Raja Gopal said. We have to invest in the system, move away from disease-focused approach to comprehensive healthcare approach, giving more attention to preventive and promotive care, and looking after the need of all patients, not just for disease, but as he mentioned, the psychosocial aspects and end of life care. COVID has been a terrible example how those who died in isolation, and then how their bodies were treated when they were taken for cremation and burial. We need to take care of some of these aspects. This has a serious impact on on psychosocial aspects of the people, not just those who suffer, but the whole family and the whole society. Thank you.
Thank you so much, Dr. Kumar. Since this week is also about paying our reverence and our gratitude for the health workers who are on the line of duty, and also those who fall while providing this very critical care for our society. I'll go to Dr. Gupta, and Dr. Gupta, this is just a remembrance for those. Do you know any of the healthcare professional from your hospital, from your contact, or your in your knowledge, who lost his life while providing care or fighting for COVID-19 during this pandemic? I would like to, you can remember them, you can give tell about their story, a brief in couple of lines, so that our audience will also get to know, because we don't know that how many people have lost their life in the healthcare system. We don't have any clear statistics, and more than statistics, these are all the human being who lost their life while trying to save others.
So, by the grace of God, at Tata Memorial Center, we have had some of our colleagues and employees who have become infected, but everybody has been fine and taken care of. And I pray to God that it continues that way. You are right that a number of healthcare workers have lost their lives, but along with healthcare workers, we would also like to remember the police personnel. You know, police are always at the long end of the stick, and we fail to recognize their contribution. During our functioning, we could not have functioned if our supply chains were disrupted. And we are grateful to the Mumbai police and to the Navi Mumbai police. They went out of their way to make sure that our vehicles and our transport was uninterrupted, and we received everything that we wanted to receive, including medications and other supplies. I would just like to remember my teacher from AIMS, Dr. J.N. Pandey. I did my MBBS from AIMS as well as MD Medicine and DM, and he was my professor of internal medicine when I trained there, and he was one of the finest clinicians, one of the greatest clinicians, one of the most intelligent individuals that I have ever met. And unfortunately, he lost his life to COVID a couple of months ago. He was currently working at the Sitaram Bhartiya Hospital. His students are spread all over the world, and all of us deeply remember him, and we are very sad that we lost him to a disease like COVID. So my condolences to his family, and if any one of them are listening to this, then scores and hundreds of his students will continue to remember him for a long, long, long time.
Thank you so much, Dr. Gupta. Dr. Rajgopal, uh, you know any of those warriors who lost their life for whom you want to pay a tribute?
Uh, per- from those personally known to me, none has, and the mortality rate in Kerala has continued to be low. But now that you ask me, I would pay my respect. I wouldn't name the person. A doctor who got COVID and survived and then went back to work. I mention her because even before she got COVID, she was shunned by everybody in that housing colony. She got nasty looks, abusive language, and she was called selfish. Can you believe that? She was called selfish because she went out and brought danger to them. And when she recovered and came back and she insisted on going back to work, they continued to be nasty to her. Meetings were held even with the social distancing, uh, impeaching her. And unfortunately, we beat all those pants and things and clap from balconies. But on the ground, some horrendous things happen. I'll pay respect to all those people who, despite all the risk, continue to remember that they are healthcare providers and remember that they cannot afford to stay home and be safe. They cannot afford that.
Thank you so much, Dr. Rajgopal. And it's a really an inspiring story that despite all this social stigmatization and yourself getting infected, going back to the work means a lot. Uh, Thank you so much for mentioning this. I think a wonderful person who is doing her duty to the best of possible with the best of human values. Dr. Sanjeev, would you like to mention somebody?
Uh, no, I immediately think of my colleague in the UN. He was involved in work in across the world, and unfortunately passed away recently. So there are many of them. I wouldn't like to go into one, but each one of them needs attention, and it is a reminder that we have to do a lot more in making sure such people who are providing care at the risk of their life, putting their families into danger, they need utmost care. All preventive facilities should be made available to them. They are overworked. We need to make sure. And if there are any vacancies in the system, like Kerala did in one day recruited 276 doctors, rest of the states must follow that example. Make sure that they are protected and they are not overworked. Whatever they have to do, they must provide that. Thank you.
Thank you so much, Dr. Kumar. There are some school children, as I told you in the beginning also, that this gratitude week is about bringing everyone on board and making them be part of this awareness, this drive that uh, healthcare workers are really doing their best bit uh, during this time and always. And we need to be grateful towards them. I'll request my team to uh, bring in line the school children who want to pay their tribute uh, in their own way.
Sure. Thank you so much, sir. I would request Ridwan Jindal from St. Columbus School to join us. Ridwan, can you switch on your camera, please?
I, Ridwan Jindal of St. Columbus School, New Delhi, is here to thank our coronavirus that are our doctors, nurses, and all the other medical staff. For me, it's all our superheroes, not wearing capes but wearing masks below their eyes. Dear doctors, when I count my blessings, I count you twice. Thank you for saving the entire community at the cost of your own life. I strongly believe that you are the almighty avatar to fight against the Ravan of Corona. With your victory, we all will be victorious. I just want to say, be strong because things will get better. Your service to patients is saving countless lives and making thousands of differences. Thank you for being our nation's guiding light in the face of this adversity. In the end, I just want to say, today it may be stormy, but remember, it never rains forever. Thank you.
Thank you, Ridwan. Can we have Jayden Norona to? Thank you.
Good afternoon, everyone. My name is Jaden Narona. I am 6 years old.
New Delhi, Single.
I am from New Delhi and I study in St. Columbus School. And now I am going to say a prayer for all the doctors and nurses.
Lovely.
Dear God, when the times were dark and the virus spread, they stood their ground and the fight back they led.
Louder.
We all sat at home knowing not what to do, but they went to work to fight this virus that was new. So many of us fell sick, so many of us died, but through all the sadness and uncertainty, their grit and determination survived. We feared for our loved ones and all whom we called dear, but they left their loved ones at home to hold our sick family members near. So many of us got well and happily went home, but some of them died caring for us and we never took a moment to mourn. So here we are standing and saluting the services they provide. These doctors and nurses, they are your angels in human disguise. So protect them and bless them, God, and their families too. For this prayer might be too small to say thank you. Amen.
I mean, thank you so much. So this was the way our next generation is paying tribute to our doctors who are working at the front line and at any stage of healthcare system to provide health and critical care support to the humanity, to the society. With this, I would like to close our session today. I'll thank Dr. Sudeep Gupta, Dr. Rajgopal, Dr. Sanjeev Kumar for their wonderful insight. And what I could make out of it, that while this pandemic has disrupted our life, almost all aspect of it, there are institutions, there are healthcare workers who are going out, ensuring that the care is being provided. And it was heartening to hear that in institutions like Tata Memorial Cancer Hospital in Mumbai, not only all healthcare workers as affiliate members of staff, but even the construction worker were well taken care of. Thank you so much, Dr. Gupta, for bringing that to our knowledge. And with this, I'll request all our audience that please do be part of our campaign and our request to the government to set up a memorial for healthcare workers who are doing their best at this time of crisis and serving the people, and also those who have been unfortunate and have lost their life. But I do trust and believe that they are the people who will be remembered all always by our society, and by this kind of gratitude memorial, we will also be able to highlight to the people, and people will be remembering that health comes first, and we all need to do our best towards the health. With this, I would request my team to play an anthem which we have created to show our gratitude to our healthcare workers, millions of them who are not only working in India, but a lot of Indian healthcare workers are providing care globally, and healthcare workers across the globe who are doing their best during this time of pandemic. Uh, let's play that anthem, and post that I would hand it over to Dr. Sanjeev Kumar to take the discussion forward with our next set of esteemed panelists, and we will continue this gratitude week. And thank you so much, our audience, for joining. Please continue with us, and you will get to hear so many inspiring stories of how healthcare workers are ensuring that we are well taken care of as much as possible. Thank you.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
Artist, Asian Research and Training Institute of Skill Transfer, based out of Bengaluru, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect. Welcome to the IHW Council Gratitude Week on occasion of Doctors' Day. The team from Bengaluru, Team Artist, which expands as Asian Research and Training Institute for Skill Transfer, brings to you the ABCDE Health Quiz. A for anemia, B for building contraceptive choices, C for cancer cervix, kill it before it kills you, D for diabetes, don't allow India to become the diabetic capital, and E for essential and emergency services. Answer the quiz questions and be eligible for being declared as the health and well-being champion for the day. We wish you all the best from Team Artist, Bengaluru.
Be the health and well-being champion of the day by answering the ABCDE health quiz organized by Artists. Question for the day on C, cancer of the cervix, reaching every girl, every woman. We march towards building Bharat. What is the most common cause of cervical cancer? A. Human papilloma virus, that is HPV. B. Radiation exposure. C. Pollution. D. Using intravenous drugs. Answer now to be eligible to be declared as Health and Wellbeing Champion for the day.
Thank you. We have all three experts, Dr. Kumar Prabhash, Dr. Biplab Das, Dr. Yash Jhaveri. Himani, anyone else?
Hi, I'm here, Kumar Prabhash.
All is here, sir.
Hi, hi. Good, good. Thanks for joining. I was looking at your CV. Three of you represent the best in your field, not just in India, but internationally. So we are on day 4, second session of Gratitude Week, in which we are paying a tribute to our health guardian, and all three of you are health guardians. The theme for our session is managing non communicable diseases. As we live in a world where lifestyle kills more than infection, and maybe briefly you can talk about what motivated you to become doctor. If it is okay with you, we can start with Dr. Kumar Prabhash, then we can move on to Dr. Biplab Das, and then Dr. Yash Jhaveri. Is that sequence okay with you?
Thank you.
All right.
Thank you,
So
sir. Good afternoon to everyone.
yeah, good afternoon. So before I request Dr. Kumar Prabhas to give his perspective of non-communicable diseases and what COVID has taught us more about non-communicable diseases. Dr. Prabhas is a professor of medical oncology at the world-renowned Tata Memorial Center. He has more than 2 decades of experience. He is president and convener of Indian Cooperative Oncology Network. He has more than 100 of scientific publications in various journals. He has been involved as principal investigators and co-principal investigator in more than 80 projects. He is proactive in creating awareness about lung cancer in the public, and he has successfully conceptualized lung cancer consortium for Asia, for whole of Asia. I will not go into more detail, Dr. Das, because that will take a lot of time. Your credentials are very, very, very strong. So give us your perspective on how do you look at NCDs and how COVID has exposed some of the weaknesses, the way we were dealing with NCDs in our country, and then maybe come back to why you chose to become a doctor, and then why did you choose this field. Over to you, Dr. Prabhash.
So starting with the COVID and NCD, and primarily what I'll do is I'll be focusing on cancer because that's what I practice, primarily. So COVID has had a huge disruption in the cancer care because whole focus has shifted from all other parts of the treatment to COVID. And what we have observed, especially in cancer patients, uh, in a big number of cancer patients, the window of opportunity to treat them and able to cure them, in many times it is smaller. And if we are not able to provide the treatment during these time to these patients, they in big number they become non-curable. Second part, what we observe, and this is one of our work which was done by our hospital part. You will be seeing many of these coming up. Are we able to deliver it? There has been a fear that if you have this COVID era, will be able to deliver the treatment without having those morbidity and mortality to the patient. Slowly, as we have been able to deliver more treatment, it appears it is possible to do these to the patients. And if we don't do it, it is good to look for the mortality which has happened with COVID. And if we do estimate that what kind of mortality can happen if you are not able to deliver these treatment to the patient. Then we'll realize that these needs to go hand in hand. If you don't take care of these non-communicable disease, especially again I'll say I have experience of cancer patients, then we may lose many more patients with these disease as compared to COVID. That doesn't mean I'm undermining any way that COVID has to be a priority, but we should not lose focus on other non-communicable disease in this setting.
Thank you, Dr. Prabhash. That's a very good introduction. And you highlighted that COVID has had a huge disruptive impact on care of non-communicable diseases, especially cancer. And the window of opportunity we had for treating these cases was reduced. And very rightly pointed out that care of non-communicable diseases need to go hand in hand with the way we address the new problem. Many times when we get into such panel discussion, we overlook the achievements made in health in India. Yes, we talk of the cracks and we talk of how those cracks have been increased during COVID. But I just want to remind you of a few figures that health has been receiving a lot more attention in India for last about 15-20 years. 2005, we had one of the largest missions in the world called National Rural Health Mission, which was expanded to urban area and was called National Health Mission. If you look at the data, between 1990 and today, the life expectancy of an average Indian has increased substantially. You look at under 5 mortality rate. In 1990, if you look at the absolute number, 3.3 million, 33 लाख बच्चे हर साल मरते थे. That number has come down to 1 million. If you convert them into absolute number every day, you are saving about 6,000 child lives a day. Substantial progress. You look at maternal mortality ratio, it has been reduced from 560 in 1990 to 137 in the recent years. So we have made substantial progress, but tragedies like COVID highlight the cracks we have, the weaknesses we have in the health system. So, and when you have COVID-like problem, the existing health problems don't go away. They are always there, and that's what Dr. Prabhash has highlighted. So I'll come back to you, Dr. Prabhash, with more questions. We have Dr. Biplav Das, who is a renowned neurointervention radiologist who studied in the best institution across India, and currently he heads Fortis Memorial Research Institute in National Capital Region. He has expertise in stroke treatment, brain aneurysm treatment, carotid artery disease, epilepsy, Parkinsonism, and is providing the best state-of-the-art care available anywhere in the world. And he is a pioneer in stroke telecare, and this telecare becomes even more important in current scenario like COVID. We can provide care to the people who can't get to the top facilities where neurointervention radiology is provided. With that, over to you, Dr. Biplav Das. What is your perspective on how COVID has increased the cracks we had in the system for providing care to non-communicable diseases, and your specialty, and why you chose to become a doctor? Because this week we are expressing our gratitude to all people like you and others who are in the forefront of the war against COVID-19. Over to you, Dr. Biplav Das.
So good afternoon, sir. Thanks for your kind introductions, and it's really a great pleasure to be part of with you and Himaniji as well. And so just for slight additions in that, I'm basically a neurologist actually. So I'm a neurologist and I'm doing neurointervention. So looking after, and my prime field of interest is definitely stroke, and in addition to other neurological disorders. So as Dr. Pravesh has already mentioned the current scenario, and you also rightly said that COVID is something which has come without prior notice. It is everybody is all of a sudden unprepared, and the whole world. I mean, like the pandemic is like catastrophic effect is happening, so that we can see, no doubt. But over the months, we need to realize that, as we say, that non-communicable disease, that is NCD. So whatever we talk, so we need to understand that the non-communicable disease burden, like which is there, and the impact because of COVID-like scenario has been magnificent. I mean, it's a very significant, I would say, in a single term. Because if you talk about non-communicable disease, just to give you an idea, I mean, like how is the magnitude of the problem of non-communicable disease. So non-communicable disease for a public, I mean, like which is not transmitted by, it's not by infectious disease, but this is something where which is being either sometimes inherited from genetically, some environmental factors, your behavioral activities, and all these things predisposes to non-communicable diseases. And it's such a significant. I'll just give you an idea. I mean, like this is in data from World Health Organizations, and if I'm not wrong, 2015 or something, 2019. So out of all populations, all deaths, all mortality around the world, up to 65 to 70% mortality is because of non-communicable disease. So you can imagine the magnitude of the disease burden, magnitude of mortality or death that is being caused by non-communicable diseases. And it's approximately like around 41 to 45 millions of people lose their life in a single year. And if you talk about India, it's something like around 5.2 or 5.8 millions per year. And that's not the data of 2020. This is data of 2 to 3 years back. So this is saying, so I just want to say that, there are so many non-communicable diseases which is treatable, which is preventable, and that's need urgent care in current scenario also. There is no doubt we have to fight COVID as a team, as a together, and government and everybody is doing their best. There's no doubt about that. But at the same time, we need to take care of some of the very important thing of non-communicable disease. Say, for example, somebody is having suffering from heart attack or stroke. These are very important emergency condition where the patient needs to be taken care immediately. This is time is very crucial here. That's why you have a golden time and window period you have, and patients need to be taken care within that window period. Otherwise, these patients have either mortality, or you can have a significant disability in whole their life. So that's how we need to discuss. We need to balance out in current scenario like COVID or down the line in somewhere how to act professionally, how to act in a better way, because COVID has actually exposed to the gaps as Sir was also mentioning, the cracks between the system which we need to develop over the time. We need to have an integrated approach. That's the deficit which we have. I mean, I think so. That's something which we need to take care.
Thank you. Thank you, Dr. Das. And you highlighted the global burden of disease. Globally, 65 to 70% of total deaths per year take place because of these conditions. And you rightly pointed out these conditions are preventable, treatable, may not be curable, but you get very close to having a normal life. And you highlighted that many of these conditions, when they occur, for example, heart attack, we call it myocardial infarction, or stroke, you are an expert in that. You get to a hospital in time, they can treat you so that those clots which are blocking the blood supply to part of the brain or part of the heart, they can be dissolved, and you will be back to normal life without any damage to your brain or the heart. And I will maybe further emphasize the point you mentioned about number of deaths in India. In India, about you take a crude death rate of 7 per thousand, you have about 1 crore or 10 million deaths every year. And what do they die of? They die of, if you put all communicable disease, all infections, perinatal, maternal, child causes together, they are total only 27.5 lakhs out of 1 crore. You look at non-communicable diseases, 57 lakh.
Yes, that's where it is.
Almost double. You know, we are giving focus on infections and
Yes,
maternal child
absolutely
health.
agree, sir.
We are closing our eye to double the deaths which take place because of this. Among that, cardiovascular diseases alone account for same number of deaths as communicable diseases, maternal child health and nutritional diseases, which is about 26 lakh.
Right,
Then you
sir.
have diabetes, which is 2%, the cancer 7%, chronic obstructive pulmonary disease, which is 13 lakh, and other non-communicable diseases. So very well highlighted by you, Dr. Das, that these diseases are causing lot more deaths. But when you look at sicknesses, once a person gets infected, he is treated for a week and he becomes all right. But with NCDs, these are either with you for the rest of your life. So when you look at sickness in the community, these will be not double. These will be many more times more common than. And then these are not watertight compartments. A person with any of these conditions, COVID has shown us, is more likely to have severe disease and is more likely to die. So this COVID has again highlighted the importance of why we should be giving more attention to non-communicable disease, COVID or no COVID.
Yeah.
Because these people will then fill up all your hospital. You will not be able to provide care to those without COVID for NCDs or for other conditions. So very important points you have highlighted. Well, I'll come back to you, Dr. Das, for more input. Let me move on to Dr. Yash Jhaveri. And when I was looking at his CV, he is one of the brightest we have, though probably the youngest in the group. So I will call him youngest and probably the brightest in the group. He has been a gold medalist throughout. He won a gold medal in MBBS at Stanley, then in MD anesthesia at Jawaharlal Nehru Medical College, Aligarh, again won a gold medal, and he has been specializing in critical care medicine, Sir Gangaram Hospital. He is an expert in infection control, for which he studied at Johns Hopkins University, and he has designed and conducted many courses on intensive care, and some of these courses have been recognized internationally. So I will not go into more details, Dr. Jhaveri. Over to you to give your perspective of how do you look at NCDs with or without COVID, and some insight into what you are doing and what motivated you to become a doctor and a specialist in critical care. Over to you, Dr. Jhaveri.
Thank you, sir. I will answer the questions into two parts, sir. First, what is my take on NCD as of today? And then how COVID has influenced the NCD and the faults which have come after COVID has been in place now. Sir, the modern medicine has its roots in 19th century. The roots which developed for modern medicine were mostly for infectious diseases, mostly the bacterial infections, viral, fungal, and other etiology was lesser known. And that was the base of modern medicine. With advent of anesthesia, then surgeries happened, the damage because of accidents got cured. What we generally do, we get sick, we attend a medical doctor who prescribes some medicine or performs surgery, which essentially cure our illness. But non-communicable disease do not follow this fixed pattern. There is much more to it. The etiology of non-communicable disease is not like infectious disease. There is not a single etiology. It is generally multifactorial. It is dynamic. Various factors play around while we diagnose non-communicable diseases. Where we miss non-communicable diseases, we miss the modifications in lifestyle, we miss on education of our patients, we probably miss to provide a holistic approach of education and improvement in the lifestyle, as well as other correctable modifiable factors which can probably cure non-communicable disease or prevent non-communicable disease. Now the world is plagued by a tsunami of chronic age-associated non-communicable disease. Many age-related changes like diseases, we often think it is part of the aging process, but they are not part of aging process. They also are not inevitable, but because of our lifestyle, those things, those diseases, those non-communicable diseases have been thought to be part and parcel of aging. So we often miss on these exogenous triggers, the environmental factor, the pollution, the eating habit, the sleeping habit, which are the major causes of non-communicable disease. Same, in the same go, we understand there are multiple physiological processes which awfully go wrong while these non-communicable diseases get severe. So we fail on multiple steps till the non-communicable disease presents to us, especially if they present with the acute presentation. We have failed at multiple levels. We have failed at preventive stage, we have failed at diagnostic, and even at curative stage. So what we are doing in India, we have a huge burden of non-communicable diseases. We are capital for most of the non-communicable diseases, diabetes, hypertension, cancer incidence is rising every day. And almost 65 to 70% of our mortality is because of non-communicable diseases. And the incidence of non-communicable diseases increasing every day. Not only non-communicable diseases has its own morbidity and mortality, it also adds to morbidity and mortality of communicable and infectious diseases. Like a patient who develops pneumonia and he's in ICU if he's hypertensive, diabetic, obese, the outcomes are bad compared to a patient who is non-hypertensive, non-obese. So non-communicable disease is a big window of opportunity which has been somehow missed, and we have been not been able to target the root causes of the etiology of non-communicable disease. We needed lifestyle changes, lifestyle medicine, and we needed an advisor for the patient who can probably teach them, be a buddy, and make them aware. The concept of family physician, which was there, the family doctor, had some of the virtues of this advisor of medicine, but in modern medicine, somehow the preventive and the advisory role of doctor is disappearing. It has not been lost, but it is disappearing. Now coming down to COVID, how COVID has affected non-communicable diseases. Most of the patients, yes sir, yes sir. Most of the patients with COVID who have been admitted to ICU have many comorbidities, diabetes, hypertension, obesity being the major one, CKD. The illness was much more severe in patients who have these comorbidities. The outcome was bad in patients who had these comorbidities. The incidence of CAD, hypertension, stress-related disorders, sleep disorders, psychiatric disorders have increased in last few months. The incidence of suicides has increased in last few months. The availability of healthcare providers and the fear and anxiety which they have in dealing with masses has probably hampered the care which has been provided to our population because of COVID. In the beginning, there was a lot of disarray in the provision of healthcare, but now as time has passed down, most of us are geared better to provide care for non-communicable diseases. How has it affected intensive care? Intensive care, the presentation of most of the patients, almost 50 to 60% of the patients will have hypoxia or respiratory failure at some point of the illness. And same is the presentation with COVID. So many of the ICUs initially were very, very scared to take patients, and the patients were going from pillar to post on and getting bed in any of the ICUs. April onwards, most of the ICUs have divided themselves into suspect and confirmed cases, and they have dedicated units for non-suspect and non-COVID. So we are trying to cope up with the COVID stress. COVID is an opportunity to understand non-communicable as well as communicable diseases. Probably we were underestimating, most of us, like acute care physicians, we never paid much attention to non-communicable diseases. But now, in light of COVID, we have some better understanding of non-communicable diseases also. So this is my take about COVID and non-communicable diseases, sir.
Thank you so much, Dr. Javeri. And you rightly described the tsunami of NCDs, which causing huge burden of disease. And I like one statement you made: aging is inevitable; it will come with as you become senior in life. But NCDs are not inevitable. We can take action so that we can. I'll come back to you with some more questions. Let me go back to Dr. Kumar Prabhash. Dr. Prabhash, your institution where you are heading a department is playing a very important role in strengthening cancer care across the country, providing technical support, capacity building to various institutions at peripheral level. So, what do you feel the role? First is you can tell us what your institution is doing, and then you can tell us that what more can be done to improve the capacity of dealing with NCDs at institution level across the country. Over to you, Dr. Prabhash.
Hi,
Yeah.
sorry. I'll put into context. One is
Yes.
in the COVID context, and other one is in general.
Yeah.
What we are doing to increase the capacity to deal with this disease has been we have been one of those key institution training people. So if you go across the country, you will find once we estimated that almost 50% of the manpower is trained from TMH. Uh, but now a lot of institution has picked up, so it is nice to see that. But you will find people from TMH, across the country who has got trained. Apart from that, TMH, which was a stand-alone institution in the past, has been now mandated by government to open more institution. And what you see that in Mumbai, we have to open one more institution which is running now and up and running very well. In fact, the director of that institute was in the previous panel. And apart from that, we have opened up institution in Varanasi, which is around the 600 odd bedded hospital, which is now up and functioning. Uh, Apart from that, we have opened a hospital in Sangrur, which is up and functioning. And there are mandates to open in Vizag, which is again up and functioning, not completely, but up and functioning for most of the care. Two more places, one in Mulanpur, that is near Chandigarh, another one is Muzaffarpur, which is approved. So let's see in future how we are able to open it and able to provide those services. But I'll say the first part was more important, that you train people and they go to the society and they provide services in multiple part of the country. Second part is the COVID situation and how we have coped up. I'll say request everyone in the audience to read the two papers which came from our director, one in NEGM, other one is in IJC, the detailing of how we went about it. And that time, I think it was very important from our leadership to show the way. And it was very nicely done that we had multiple ways of functioning. One, we started, we anticipated early, so our intervention started in March. We started having screening in the gate for all patients, seeing that can we screen them and find out them as early as possible. Second, we opened a fever clinic so that all the patients go to correct place if they are identified here. Third, we started calling all our appointments and telling them that and trying to have the appointment getting deferred if was not really required, trying to get in touch with the local people whom we know or we got trained from TMS to request them to meet them locally so they don't have to visit us immediately. Fourth, at the manpower level, we try to have people coming in sequentially, not all of them coming together, so that our attendance becomes limited, so that people don't they are not crowded in the hospital. Then we in the hospital also we ensured that safety practices are implemented, having the mask, having those gloves, having hand wash or sanitizer being available, having training of all those manpower which is being there. And that's the reason that I can say that these things have been very useful. And as on date, there are very few people, as far as the medical practitioner are concerned, which has turned out to be positive. We do have many people in the healthcare provider which has turned out to be positive, but medical practitioner in our hospital, there are very few which has turned out to be positive. So this is overall view how we have tried to deliver the treatment in during these times. In fact, we didn't stop the treatment. During these times, we have ensured the patient coming to the hospital, they are taken care of with all the capacity we had. So we are compiling the care provided. The surgical data is just now out, which we provided the care to our patients during these times. Other data we are compiling and which will be coming shortly. So we ensured that the healthcare provider, they are taken care of, patients they are taken care of, and also we try to see that the patient, if possible, in the local place, they are taken care of during these times.
Thank you so much, Dr. Prabhash. And my last question maybe to Dr. Das. You mentioned that we need to focus more on prevention and then treatment of non-communicable diseases. Can you briefly tell us what a common person can do to prevent and treat non-communicable diseases? Over to you, Dr. Das.
Right, sir. Yes. So as I said, you also mentioned the same thing. If you talk about non-communicable diseases, this is primarily caused by non-infectious things, right? Which is because of your habit, the way you carry yourself, like the way in current scenario in urban and semi-urban, you can see that nobody is actually doing any physical activity. And environmental factors, stress. I would like to say air pollution, especially. And these are the factors which are significantly contributing to the genetic factors, because genetic factors you cannot really change as such. Somebody is having inherited some predisposing conditions which can predispose you to either heart disease or hypertension or diabetes. That is a different issue. So there are some factors which is preventable. So we need to take care of this preventable, and if you take care of this one, there can be significant change. The way the statistical change and the outcome we can have. So doing so, we need to have the first thing we need to have is a comprehensive, intensive awareness program. So if we talk about awareness program, because if you say, for example, I'm more interested into stroke and neurological disorders. So if you talk about stroke things, and it is very strange, just to share with you, out of, say, for example, 100 patients who are having a stroke, hardly 4 to 5%, even not the 5%, patient reach hospital within the golden time. So within the window time. So you can imagine, so there is so much of scope left behind. So we need to do so much of work to reach to the people, that we have to do really good work and let them know that, yeah, this is a stroke. I'm highlighting why about stroke or heart attack, because here among the non-communicable diseases, here something which is emergency conditions. Other non-communicable diseases is something like which is gradually. Usually we think that non-communicable disease is something which progresses slowly over the years, and then that develops. But for this MI or cardiac thing or cardiovascular or cerebrovascular things, it is not like that. It is very acute presentations, and you have to take care very urgently, because time is brain there. So doing so, I would like to say that public awareness is very, very crucial. For making public awareness, you can take help of the social platforms. There are so many other ways, and government is also involved for the same. In doing so, either maybe a little way is we are trying to develop a stroke awareness network or a stroke campaign. That's we are comprehensively trying to make, and one of these things is like stroke telecare mobile applications. So just to give you an idea, I mean, a stroke telecare mobile application, if you type in your Android or iPhone, you can download it free, which is free to download. So this is an initiative or attempt which is being made where we are trying to connect with people or a stroke ready centers at a very remote area. Say for example, a very hilly remote area somewhere in Assam or somewhere in Himachal, so that somebody sitting here in an expert who is sitting in a metro or somewhere some other place can give an advice there itself. And the thrombolysis, we talk about thrombolysis because patients who are reaching hospitals, they need to be thrombolized within that golden time. So we are trying a way so that the thrombolysis can be started there, because these people cannot travel so long time to a metro or some other hospitals where thrombolysis can be initiated, and that's how they miss the main time. So this is an initiative for connecting the different peripheral centers so that we can start this benefit. We can offer this benefit to a person who is staying in a very remote area. That's number one. At the same time, I'm again stressing that we need to work really hard to take this message and awareness program. What is a stroke? How to recognize a stroke? Because people don't recognize a stroke, and then that's why they don't reach hospital. If you compare stroke versus heart attack, there is vast difference between the awareness. It's probably because of social media, or our Bollywood is more towards heart attack, and anything which is they want to show emergency, they will show heart attack, not paralysis. The scenario is changing. At the same time, other thing I would like to highlight is in heart attack, the persons have severe chest pain. Severe. It's like a severe chest pains. They simply can't ignore it, and that's how they have to reach hospitals. Okay, but whereas if it is a small stroke or minor stroke, they simply say, well, it might be because of sleep. I mean, some problem has occurred, so that's why the weakness has happened. So that's how they ignore the thing, and the time gets delayed, and the person lost the golden hour of life, I would say. And as you said, sir, I mean, Sanjeev sir, you have at the start you have mentioned somebody's having infection, somebody's having non-communicable disease, especially emergency condition. The impact I would like to compare. Somebody's having, say, for infection, they recover. So you cannot compare the number of disease there, because infection, the person are absolutely fine after, say, for example, a week. Whereas somebody's having stroke or heart attack, somebody's having stroke, he or she not treated properly, he will be or she will be bed bound, wheelchair bound for whole life. So that, can you imagine? I mean, that's such a catastrophic things can happen, and we need to take account of that things while analyzing all these things. So that's my message. I would say. I mean, like, so it's a high time that we need to address the non-communicable diseases, because if you look carefully, the number of disease which is being contributed for the non-communicable is quite high. The burden which is being given because of these things is very, very high. So that's how. This is my message, actually.
Thank you so much, Dr. Yash Javeri. I know you are hard pressed for time. Are you still there?
Yes, sir. I am here, sir. Yes, sir.
Okay. Briefly about, you mentioned about the impact on mental health. Briefly tell us a message for a common person, what they should do in COVID times to take care of their mental health.
Basically, first thing is we have to think apart from COVID. We have to take all the precautions for COVID, but COVID should not overshadow our thought process. This is happening. The amount of information which has been driven into common public is also huge. And the discussions about death and devastation is happening in front of children that will impact the kids. The discussion is happening in front of laymen, and they are also affected. We have some understanding that COVID does not mean death, but most of the lay people think otherwise. So this message has to be driven. That is lot more to COVID than only death, and most of them will come out unscathed. Second important thing, we have to increase the awareness and accessibility to psychological intervention people, clinical psychologists, psychiatrists, and they should have awareness. There should be school psychology programs. There should be programs which are targeting society. We have to capture early signs and intervene early. And the awareness about psychiatric problems and the danger signs should be caught up early. We as colleagues also should be able to identify that this person could be tilting towards a dangerous side. where he needs a psychiatric intervention. This will be my suggestion, sir.
Thank you so much. I know Dr. Kumar Prabhash, Dr. Biplab Das, Yash Jhaveri, you have a treasure of knowledge and experience, and we can continue to learn from you, but we have constraint of time. So with that, let me conclude. We talked about the burden of diseases, non-communicable diseases. We looked at the figure are already taking away more than double the number of people who die of infections, maternal child health, nutrition related disorder. And as we are talking, this is increasing by the day. If you look at the data over 10 years, diarrheas came down by 26%, infections by 20% as cause of death, tuberculosis by 25%, and neonatal and birth related conditions by 43%. This is what has happened. 2005 to 2016, they have declined. But on the other side, ischemic heart disease went up by 53%. Chronic obstructive pulmonary disease increased by 23%. Cerebral vascular disease is increased by 25%. And road injuries, we didn't talk about it, though they can be put with non-communicable diseases. They went up by 25% in 10 years, and they are increasing even today. Every day they're going up. So they need non-communicable diseases, need a lot more attention. And Dr. Kumar Prabhash very rightly pointed out quality of care. The Tata Group as a whole and Tata Memorial Hospital is globally known as providing best quality, affordable health care. And I compliment you and your team for trying to replicate it across the country through institutions where you are directly supporting, but also building capacity of others. Dr. Das, you very rightly pointed out we don't need to worry about non-communicable diseases if we look at what can we do to prevent them. And even if, God forbid, if you have any of those conditions like myocardial infarction or stroke, you reach a health facility in time, you can have a reversible recovery and you will be absolutely normal after that. And we need to have more awareness so that people come forward to take treatment early. Dr. Jhaveri, again, thanks for us to telling about we have a tsunami of NCDs hitting us. And repeat, aging is inevitable. We all will grow old by age, but NCDs are not if we take proper care in taking preventive measures and timely care. And in a time like COVID, we need to take care that people don't get unnecessarily worried and scared about COVID. Mortality is very, very rare in COVID. If you look at population who has been tested, it'll probably be like any of the seasonal flus. You know, the serosurveillance study done by ICMR, it is less than 1 in 1,000. Yes. But if you look at the cases reported and deaths, even there it is about 3% of those who are reported as COVID cases. So we need to take care of that. Thanks again for sharing your expertise and sparing valuable time to talk to us and to talk to the people who need to know and learn a lot more from your expertise. Thank you so much.
Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you all.
अपना सुकून भूलकर वो सबकी जान बचाते हैं, भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं.
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ, ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ਫੀਲਡ ડ્યુટી ਤੇ હંમેશા અવેલેબલ હો.
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं।
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
દિલ સે આપકા શુક્રિયા.
દિલો ધન્યવાદ. God bless you. Thank you.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much doctors for being there.
And I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
Hi, my name is Padamjit Shelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
Artist, Asian Research and Training Institute of Skill Transfer, based out of Bengaluru, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect. Welcome to the IHW Council Gratitude Week on occasion of Doctors' Day. The team from Bengaluru, Team Artists, which expands as Asian Research and Training Institute for Skill Transfer, brings to you the ABCDE Health Quiz. A for anemia, B for building contraceptive choices, C for cancer cervix, kill it before it kills you, D for diabetes, don't allow India to become the diabetic capital, and E for essential and emergency services. Answer the quiz questions and be eligible for being declared as the health and well-being champion for the day. We wish you all the best from Team Artist Bengaluru.
Be the health and well-being champion of the day by answering the ABCDE health quiz organized by artists. Question for the day on C. Cancer of the cervix, reaching every girl, every woman. We march towards building Bharat. What is the most common cause of cervical cancer? A. Human papilloma virus, that is HPV. B. Radiation exposure. C. Pollution. D. Using intravenous drugs. Answer now to be eligible to be declared as Health and Wellbeing Champion for the day.
From class 3C. This song is dedicated to all the doctors and other health workers. We just want to say thank you for all the things you have done, the sacrifices you have made, creating such a difference. And we know our God sees each and every one of you. May He bless your heart forevermore. We just want to say thank you for all the things you have done, the sacrifices you have made, creating such a difference. And we know our God sees each and every one of you. May He bless your heart forevermore. Ho ho ho! We just want to say thank you. Ho ho ho! With our whole hearts we bless you.
Good morning everyone, I'm Annasami from class 2C and today I want to recite a poem on a wonderful doctors who are our seniors. To earn the title doctor is an honor. It is true, fruition of life achieved by just a few. It's a journey that has brought you to this time and to this place where you can make a difference with each challenge that you face. The knowledge in and of itself is just a part thing that makes you special. Your kind and gentle heart, and when a doctor cares as much sincerely you do, the world becomes a better place, no doubt, because of. Thank you.
My name is Siddharth Suri. I am from class 3C of St. Columbus School. Gratitude to doctors and nurses. You are something special. In fact, you are the heroes to the core. With your efforts, we will make it through this war. You convert this virus through day and through night. Thank you for keeping your compassion alive. We are so grateful and proud. All we want to say it out loud. The world says, Thank you for your service, the lives you are saving. Thanks for all storms you braving. The nurses and the doctors, we are stand behind you strong. This fight is long, but from your courage and bravery, we say thank you for your service from core of our heart. Thank you.
My name is Hutel Das. I am for St. Columbus School 20 class. I can't even go to school. This is the new rule. No friends, not even a hug. Capable of a strange bug. But my mom told me, hey, the doctor, you see, the Rona say, the Rona. Just toilet it, all will be well. Doctors and nurses work so hard, day and night. From their family, they stay apart. And how they there and how they rest. Because the sick ones take care. You are healthy, you are wise. Someone, somewhere has paid a price. So remember to do silent prayer for people who have shown such care. Thank you. We love you. Dear God, when the times were dark and the power spread, they stood their ground and the fight back they led. We all sat at home, knowing not what to do, but they went to work to fight this virus that was new. So many of us fell sick, so many of us died, but through all the sadness and uncertainty, their grit and determination survived. We feared for our loved ones and all whom we called dear, but they left their loved ones at home to hold our sick family members near. So many of us got well and happily went home, but some of them died caring for us and we never took a moment to mourn. So here we are standing and saluting the services they provide. These doctors and nurses, they are your angels in human disguise. So protect them and bless them, God, and their families too. For this prayer might be too small to say thank you. Amen.
Hi, my name is Padamji Chelawat and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
अपना सुकून भूलकर वो सबकी जान बचाते हैं। भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं।
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ફિલ્ડ ડ્યુટી ਤੇ હંમેશા અવેલેબલ હો.
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं.
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
દિલ સે આપકા શુક્રિયા.
દિલો ધન્યવાદ. ગોડ બ્લેસ યુ. થેન્ક યુ.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much, doctors, for being there.
And I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
Artist, Asian Research and Training Institute of Skill Transfer based out of Bengaluru, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect. Welcome to the IHW Council Gratitude Week on occasion of Doctors' Day. The team from Bengaluru, Team Artist, which expands as Asian Research and Training Institute for Skill Transfer, brings to you the ABCDE Health Quiz. A for anemia, B for building contraceptive choices, C for cancer cervix, kill it before it kills you, D for diabetes, don't allow India to become the diabetic capital, and E for essential and emergency services. Answer the quiz questions and be eligible for being declared as the health and well-being champion for the day. We wish you all the best from Team Artist Bengaluru.
Be the health and well-being champion of the day by answering the ABCDE health quiz organized by Artist. Question for the day on C, cancer of the cervix, reaching every girl, every woman. We march towards building Bharat. What is the most common cause of cervical cancer? A, human papilloma virus, that is HPV. B, radiation exposure. C, pollution. D, using intravenous drugs. Answer now to be eligible to be declared as health and well-being champion for the day.
Good morning everyone, I am Anna Sanghi from class 2C and today I want to recite a poem on a wonderful doctors who are seniors. So the title doctor is an honor. It is true, fruition of life only achieved by just a few. It's a journey that has brought you to this time and to this place where you can make a difference with each challenge that you face. The knowledge in and of itself is just a part thing that makes you special. So kind and gentle heart, and when a doctor cares as much sincerely you do, the world becomes a better place, no doubt, because of. Thank you.
My name is Siddharth Suri. I am from class 3C of St. Columbus School. Gratitude to doctors and nurses. You are something special. In fact, you are the heroes to the core. With your efforts, we will make it through this war. You convert this virus through day and through night. Thank you for keeping your compassion alive. We are so grateful and proud. All we want to say it out loud. The world says, thank you for your service, the lives you are saving. Thanks for all storms you braving. The nurses and the doctors, we are stand behind you strong. This fight is long, but from your courage and bravery, we say thank you for your service from core of our heart. Thank you.
My name is Hudail Das. I am for a St. Columbus School 20 class. I can't even go to school. This is the new rule. No friends, not even a hug. Be careful of a strange bug. But my mom told me, hey, the doctor, you see, the Rona say, the Rona. Just toilet it, all will be well. Doctors and nurses work so hard, day and night. From their family, they stay apart. And how they there and how they rest. Because the sick ones take care. You are healthy, you are wise. Someone, somewhere has paid a price. To remember to do silent prayer to people who have shown such care. Thank you. We love you. Dear God, when the times were dark and the power spread, they stood their ground and the fight back they led. We all sat at home, knowing not what to do, but they went to work to fight this virus that was new. So many of us fell sick, so many of us died, but through all the sadness and uncertainty, their grit and determination survived. We feared for our loved ones and all whom we called dear, but they left their loved ones at home to hold our sick family members near. So many of us got well and happily went home, but some of them died caring for us and we never took a moment to mourn. So here we are standing and saluting the services they provide. These doctors and nurses, they are your angels in human disguise. So protect them and bless them, God, and their families too. For this prayer might be too small to say thank you. Amen.
Hi, my name is Padamji Chelawat and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पाँव पे डॉक्टर्स नर्सेस मेडिकल स्टाफ आपका शुक्रिया आपका शुक्रिया यू आर द रियल हीरोज आपका शुक्रिया थैंक यू
अपना सुकून भूलकर वो सबकी जान बचाते हैं। भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं।
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ਫੀਲਡ ਡਿਊਟੀ ਤੇ હંમેશા અવેલેબલ હો
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं.
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
દિલ સે આપકા શુક્રિયા.
દિલો ધન્યવાદ. ગોડ બ્લેસ યુ. થેન્ક યુ.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much, doctors, for being there.
And I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
Artist, Asian Research and Training Institute of Skill Transfer, based out of Bengaluru, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect. Welcome to the IHW Council Gratitude Week on occasion of Doctors' Day. The team from Bengaluru, Team Artist, which expands as Asian Research and Training Institute for Skill Transfer, brings to you the ABCDE Health Quiz. A for anemia, B for building contraceptive choices, C for cancer cervix, kill it before it kills you, D for diabetes, don't allow India to become the diabetic capital, and E for essential and emergency services. Answer the quiz questions and be eligible for being declared as the health and well-being champion for the day. We wish you all the best from Team Artist Bengaluru.
Be the health and well-being champion of the day by answering the ABCDE health quiz organized by Artists. Question for the day on C, cancer of the cervix, reaching every girl, every woman. We march towards building Bharat. What is the most common cause of cervical cancer? A, human papilloma virus, that is HPV. B, radiation exposure. C, pollution. D, using intravenous drugs. Answer now to be eligible to be declared as health and well-being champion for the day.
माँ हमें जन्म देती है तो कई बार डॉक्टर हमें पुनर्जन्म देता है।
संकट की इस घड़ी में अस्पतालों में इस समय सफेद कपड़ों में दिख रहे डॉक्टर नर्स ईश्वर का ही रूप है। अपने जीवन को खतरों में डाल करके ये लोग हमारा जीवन बचा रहे हैं। डॉक्टर जिंदगी बचाते हैं और हम उनका ऋण कभी नहीं उतार सकते। ये हम सबका दायित्व है कि जो देश की सेवा करते हैं, जो देश के लिए खुद को खपाते हैं, उनका सार्वजनिक सम्मान हर पल होते रहना चाहिए।
Dear God, when the times were dark and the virus spread, they stood their ground and the fight back they led. We all sat at home, knowing not what to do, but they went to work to fight this virus that was new. So many of us fell sick, so many of us died, but through all the sadness and uncertainty, their grit and determination survived. We feared for our loved ones and all whom we called dear, but they left their loved ones at home to hold our sick family members near. So many of us got well and happily went home, but some of them died caring for us and we never took a moment to mourn. So here we are standing and saluting the services they provide. These doctors and nurses, they are your angels in human disguise. So protect them and bless them, God, and their families too. For this prayer might be too small to say thank you. Amen.
I am Harshit Lohia from class 3C. This song is dedicated to all the doctors and other health workers. We just want to say thank you for all the things you have done, the sacrifices you have made, creating such a difference. And we know our God sees each and every one of you. May He bless your heart forevermore. We just want to say thank you for all the things you have done, the sacrifices you have made, creating such a difference. And we know our God sees each and every one of you. bless your heart forevermore. Ho ho ho, we just want to say thank you. Ho ho ho, with our whole hearts we bless you.
माँ हमें जन्म देती है तो कई बार डॉक्टर हमें पुनर्जन्म देता है।
संकट की इस घड़ी में अस्पतालों में इस समय सफेद कपड़ों में दिख रहे डॉक्टर नर्स ईश्वर का ही रूप है। अपने जीवन को खतरों में डाल करके ये लोग हमारा जीवन बचा रहे हैं। डॉक्टर जिंदगी बचाते हैं और हम उनका ऋण कभी नहीं उतार सकते। ये हम सबका दायित्व है कि जो देश की सेवा करते हैं, जो देश के लिए खुद को खपाते हैं, उनका सार्वजनिक सम्मान हर पल होते रहना चाहिए।
Hi, my name is Padamjit Shelawat and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है। काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ आपका शुक्रिया, आपका शुक्रिया। शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे, सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव पे, डॉक्टर्स नर्सेस मेडिकल स्टाफ आपका शुक्रिया, आपका शुक्रिया, यू आर द रियल हीरोज, आपका शुक्रिया। थैंक यू।
अपना सुकून भूलकर वो सबकी जान बचाते हैं, भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं।
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ਫੀਲਡ ਡਿਊਟੀ ਤੇ હંમેશા અવેલેબલ હો.
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं.
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
દિલ સે આપકા શુક્રિયા.
દિલો ધન્યવાદ. God bless you. Thank you.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much, doctors, for being there.
And I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
Artist, Asian Research and Training Institute of Skill Transfer, based out of Bengaluru, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect. Welcome to the IHW Council Gratitude Week on occasion of Doctors' Day. The team from Bengaluru, Team Artists, which expands as Asian Research and Training Institute for Skill Transfer, brings to you the ABCDE Health Quiz. A for anemia, B for building contraceptive choices, C for cancer cervix, kill it before it kills you, D for diabetes, don't allow India to become the diabetic capital, and E for essential and emergency services. Answer the quiz questions and be eligible for being declared as the health and well-being champion for the day. We wish you all the best from Team Artist Bengaluru.
Be the health and well-being champion of the day by answering the ABCDE health quiz organized by artists. Question for the day on C. Cancer of the cervix. Reaching every girl, every woman. We march towards building Bharat. What is the most common cause of cervical cancer? A. Human papilloma virus, that is HPV. B. Radiation exposure. C. Pollution. D. Using intravenous drugs. Answer now to be eligible to be declared as Health and Wellbeing Champion for the day.
माँ हमें जन्म देती है तो कई बार डॉक्टर हमें पुनर्जन्म देता है।
संकट की इस घड़ी में अस्पतालों में इस समय सफेद कपड़ों में दिख रहे डॉक्टर नर्स ईश्वर का ही रूप है। अपने जीवन को खतरों में डाल करके ये लोग हमारा जीवन बचा रहे हैं। डॉक्टर जिंदगी बचाते हैं और हम उनका ऋण कभी नहीं उतार सकते। ये हम सबका दायित्व है कि जो देश की सेवा करते हैं, जो देश के लिए खुद को खपाते हैं, उनका सार्वजनिक सम्मान हर पल होते रहना चाहिए।
From class 3C. This song is dedicated to all the doctors and other health workers. We just want to say thank you for all the things you have done, the sacrifices you have made, creating such a difference. And we know our God sees each and every one of you. May He bless your heart forevermore. We just want to say thank you for all the things you have done, the sacrifices you have made, creating such a difference. And we know our God sees each and every one of you. May He bless your heart forevermore. Ho, ho, ho. We just want to say thank you. Ho, ho, ho. With our whole hearts we bless you.
Good morning everyone, I'm Anna Sangi from class 2C and today I want to recite a poem on a wonderful doctors who are serious. So the title doctor is an honor, it is true, fruition of life achieved by just a few. It's a journey that has brought you to this time and to this place where you can make a difference with each challenge that you face. The knowledge in and of itself is just a part thing that makes it special. Your kind and gentle heart, and when a doctor cares as much sincerely you do, the world becomes a better place, no doubt, because of. Thank you.
My name is Siddharth Suri. I am from class 3C of St. Columbus School. Gratitude to doctors and nurses. You are something special. In fact, you are the heroes to the core. With your efforts, we will make it through this war. You convert this virus through day and through night. Thank you for keeping your compassion alive. We are so grateful and proud. All we want to say it out loud. The world says, thank you for your service, the lives you are saving. Thanks for all storms you braving. The nurses and the doctors, we are stand behind you strong. This fight is long, but from your courage and bravery, we say thank you for your service from core of our heart. Thank you.
My name is Hudal Das. I am for St. Columbus School 20 class. I can't even go to school. This is the new rule. No friends, not even a hug. These cables of a strange word. But my mom told me, hey, the doctor, you see, Corona say, the Rona. Just toilet it, all will be well. Doctors and nurses work so hard, day and night. From their family, they stay apart. And how they rest and how they rest. Because the sick ones take care. You are healthy, you are wise. Someone, somewhere has paid a price. To remember to do silent prayer where people who had shown such care. Thank you. We love you. Dear God, when the times were dark and the virus spread, they stood their ground and the fight back they led. We all sat at home, knowing not what to do, but they went to work to fight this virus that was new. So many of us fell sick. So many of us died, but through all the sadness and uncertainty, their grit and determination survived. We feared for our loved ones and all whom we called dear, but they left their loved ones at home to hold our sick family members near. So many of us got well and happily went home, but some of them died caring for us, and we never took a moment to mourn. So here we are standing and saluting the services they provide. These doctors and nurses, they are your angels in human disguise. So protect them and bless them, God, and their families too. For this prayer might be too small to say thank you. Amen.
माँ हमें जन्म देती है तो कई बार डॉक्टर हमें पुनर्जन्म देता है।
संकट की इस घड़ी में अस्पतालों में इस समय सफेद कपड़ों में दिख रहे डॉक्टर नर्स ईश्वर का ही रूप है। अपने जीवन को खतरों में डाल करके ये लोग हमारा जीवन बचा रहे हैं। डॉक्टर जिंदगी बचाते हैं और हम उनका ऋण कभी नहीं उतार सकते। ये हम सबका दायित्व है कि जो देश की सेवा करते हैं, जो देश के लिए खुद को खपाते हैं, उनका सार्वजनिक सम्मान हर पल होते रहना चाहिए।
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है। काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी। डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया। आपका शुक्रिया शब्दों में शायद न कह पाएंगे शब्दों में शायद न कह पाएंगे आपके ऋणी सदा खुद को पाएंगे सांस खुद की भी थी दांव पर डगमगाए नहीं पर तेरे पांव पे डॉक्टर्स नर्सेस मेडिकल स्टाफ आपका शुक्रिया आपका शुक्रिया यू आर द रियल हीरोज आपका शुक्रिया थैंक यू
Welcome to another session of fourth day of this special gratitude week, a tribute to health guardians. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, a not-for-profit social impact initiative to promote health for all. We are almost halfway through this extraordinary 60-hour long observance, which was initiated on July 1, the National Doctors' Day. This is our humble way of expressing our appreciation and indebtedness for all those people in the healthcare and allied sectors who are working and risking their lives while ensuring that healthcare continues to reach to everyone who needs despite this pandemic. In the past 3 days, we have had the honor of hosting lawmakers such as Minister of State for Health and Family Welfare, Government of India, Sri Ashwini Kumar Chaube, and other senior lawmakers, prominent health leaders joining this gratitude marathon and expressing their solidarity and thankfulness to nation's health guardians. Not only this, these past 3 days also saw a lot of patients, including those who have won the fight against coronavirus, and even school children who also joined us to share their experiences, love, gratitude for our doctors. The session which we are going to start now is about how we are keeping our 1 billion hearts beating. This is about the stories of those doctors who spend long days in cath labs and hospitals ensuring that a proper medical intervention is reaching to anyone suffering from heart-related diseases. Heart diseases affects a sizable number of people in India and is among the biggest killer, as estimated 54.5 million people in India are affected by cardiovascular diseases. And 1 in 4 deaths in India now happens because of CVDs. According to reports, heart attacks kill one person every 33 seconds in this country. As much as 52% of all cardiovascular deaths in India occur before the age of 70, and the average onset age has also reduced dramatically in comparison to the global standards. Therefore, managing heart diseases becomes more important for the health of an individual and of this nation. We also know that cardiology is one of the most difficult specialty, not only because it deals with an organ that can be seen through diagnostic images, but also because the widespread prevalence of the disease ensures they have the longest day every day in hospitals. What makes a doctor a good cardiologist? What does it mean to be in the emergency? We will discuss these various aspects of being a cardiologist with some of the most renowned names in the field. So let me welcome our esteemed panel this afternoon, talking about how this nation is going to ensure that our billion plus hearts keep beating. We have Padma Bhushan awardee Dr. T.S. Clare. He is the chairman of PSRI Heart Institute in New Delhi and heads the electrophysiology program there. Many of these advanced treatment methods of heart disease have been introduced in India by Dr. Clare. He was instrumental in establishing cardiology and electrophysiology department at various centers in India that brought quality medical care to people outside the metropolitan cities. We also have Dr. P.P. Mohanan. He is the president-elect of Cardiological Society of India and is the director and head of cardiology at Westfort High Tech Hospital in Kerala. He has received the Distinguished Service Award in 2008 from the then President of India, Dr. APJ Abdul Kalam. We also are going to be joined by Dr. Sudeep Khasa. He is a senior consultant with the Department of Interventional Cardiology as Uzala Cygnus Hospital, an organization which is providing critical health care in the underserved and unserved areas of northern India. So let me begin our discussion today by, and would like to go to Dr. T.S. Clare, I believe most senior among us today. Dr. Clare, as you see that for past few decades, heart problem in India have increased manifold, and I believe around 3 million lives are being lost annually because of this disease now. And you can correct the number. I'm not the doctor and expert of this area, so may be wrong on the numbers. The regions cited range from lifestyle changes to genetic, propensity The general threshold of disease onset in India has also become almost a decade lower. What we are missing on this and what we are doing wrong that we are becoming, we are having such a big burden of cardiovascular disease on our populations? Dr. Claire.
Kamal, first of all, thank you very much for inviting me to this, rather I would say, very fascinating session. I'll thank also Nikki Gupta, who was insistent that I should join this program. And I think it's the right time perhaps to talk about something away from COVID. I think people are tired of listening to COVID day in and day night. Now, coming to the heart disease in India, there is no doubt what you said very rightly, that India is capital of heart disease practically now in the world. We have more than 1 billion people in this country, and if you see the quantum of disease, it's massive. If you take the heart diseases in general, or the most important disease in our country, there are two basically. One is the hypertension and hypertensive heart disease. Another is coronary artery disease. Coronary artery disease is the disease where you develop blockage in the vessels, the heart or brain or kidney. It's a generalized vascular disease. Any bed, vascular bed can be involved. But one of the most important bed is the heart itself, where the two coronary arteries supply the heart muscle, and when you develop blockage in that, then people get either angina, or they get heart attack, or they die suddenly because of that problem. Now, it has been estimated by various studies in India that roughly 8 to 9% people, adult population in metropolitan cities has coronary artery disease, which is a huge number. If you go to the rural population, even the rural population has around 4 to 5% incidence of coronary artery disease. Coming to hypertension, is a very, very big killer in the whole world. In fact, roughly 25% of the adult population in the world has hypertension. When we say hypertension, that anybody's blood pressure more than 130/80 is hypertension. And the incidence in females is a little bit less, something like 23-22%. Males is around 27%, but overall it is 25%. But the fascinating thing is that if you take the people more than 60 years of age, roughly 60% people have hypertension. That is very, very disturbing. Now, if you take people more than 65 years of age, almost 65% of the men and 75% of the females have hypertension. This is amazing and surprising that elderly females have hypertension even more than men. Though up to the menstrual age, up to 50, 60, their chances of hypertension are less. But when they cross 65, then the hypertension is much more. Now, hypertension indirectly causes coronary artery disease. It causes direct damage to the heart, which is called as hypertensive heart disease. People develop heart failure. There is another new entity, we call it diastolic heart failure. Now, diastolic heart failure is where the pumping capacity of the heart is normal, but still patient develops heart failure. They have breathing difficulty, they have swelling over the feet, they have, inability to work. So this is a big new animal on the horizon, which is called as diastolic heart failure, or heart failure with preserved ejection fraction. That means the pumping capacity is normal, but primarily here it is the relaxation property of the heart which is at fault. And the bad thing is that hypertension is the most important cause of development of arrhythmias in the heart, particularly atrial fibrillation. See, a long-standing hypertension, the upper the chambers of the heart, the atria, they start enlarging because the pressure increases. They start enlarging, and then they develop atrial fibrillation, which has a lot of implications, health implications. Not only that it produces irregular heart palpitations, it increases the chance of heart failure. It also increases morbidity and mortality. The longevity of the people with AF is less as compared to people without AF. So we have no doubt that the hypertension, coronary artery disease is a major problem in this country. There's another bad news. Bad news is that Indians develop heart disease and heart attacks almost 10 years younger as compared to Western civilization. Another bad news, that when they develop, let's say, first time heart attack, myocardial infarction, जिसको हम कहते हैं, the chances of mortality are more in Indians as compared to Western civilization. Thirdly, when you do their angiography, they are more likely to have more disease, triple vessel disease, as compared to Western civilization. Another bad news, our 30% of the people or 33% of the people who come to me or any good cardiology center, roughly 1/3 of the patients have diabetes. And this addition of diabetes and hypertension is the worst combination. These people develop disease which is called diffuse coronary artery disease. Diffuse means जगह जगह पे ब्लॉकेज है. अगर जगह जगह पे ब्लॉकेज हैं, if we have multiple blockages in the same artery, now these arteries are neither fit for bypass surgery nor they are fit for angioplasty. So these patients are very, very big challenge in India, and I've seen a lot of these disease in Bangladesh also. Diffuse disease, you don't know what to do about these patients. You continue medicine, they continue to suffer, and that's another bad news in India. Now, if I have to come to my own assessment, I came from UK in '89, and I've seen the scenario in India with heart disease for last 30 years. Why we are at a disadvantage of developing heart disease? Initially, we thought that in India we don't have heart disease. We have tuberculosis, we have malaria, we have dengue. But the reality is that the chances of heart disease in India are 3 times more than people in America. Like I told you that the coronary artery disease, the incidence is around 8 to 9% in India. In adult population, in US, it's around 3%, 2.5%. Not only that, there are multiple studies available that Indians living in UK and Indians living in USA, they have 3 times chance of developing heart disease as compared to the local population. So this is a very well documented data. It's not a guesswork. It is very well documented data. Now, why God has been so unkind to us, I really don't know. But I think fundamentally what has happened, in my opinion, that in last 20-25 years, there has been a massive change of lifestyle of people. People have stopped working physically. People have started eating more. People have started eating more junk food. Availability of food is more. Now, even if you go back 30 years back, for example, I'm from Punjab. It was very rare to see anybody smoking in Punjab 30 years back or 35 years back. But gradually, even the Sikh community, which I belong to, many of them, they smoke. Females have started smoking in big cities as well as in smaller towns. So the incidence of smoking has increased. We have stopped working. We have more stress because everybody wants to earn money in one day. They don't want to wait for the second day. They want a big Mercedes car right away. They don't have patience. The younger generation has no patience. Now we have multinational companies. Multinational company means people working there, they have targets. Their lifestyle is horrible. Believe me, horrible. They go on roaming from one city to another with a laptop. They have no khane ka time nahi. They have no proper exercise. So they will take junk food. They increase the weight. they will develop diabetes. And I've seen many of these young educated boys, IITs and, IT technology people, at the age of 30 years, they have a myocardial infarction. So if I have to say that the major thing what has happened is change of lifestyle. That has increased our weight. We have a massive problem of obesity. Now the maximum number of obese people in the world is in China, number one. Number two is India, by the way. No, sorry. Number one is America, number two is China, number three is India. Total number of obese people. And because of that, there is a lot of incidence of diabetes, particularly maturity onset diabetes. It was very rare to find when I was studying in PGH Chandigarh, to have a diabetic person who is 30 or 35 years of age. It's not very common. It's very common to have a heart attack at 25 or 30 years of age, which was unheard of 20 years back. So obesity, hypertension, poor lifestyle, lack of exercise, and stress are the main fundamental reason that which has led to this very bad scenario and epidemic of our country. In simple words, if somebody asks me that how to prevent heart disease, you know what I tell them? That please follow the lifestyle of your grandfather.
Sir, I'll come for the prevention later.
And if you follow that advice, what your grandfather used to do, you will be okay.
Thank you so much. You actually very well described the situation of, how and why we are seeing a lot of, spurt in the cardiovascular problems in the country. I would like to go to Dr. P.P. Mohanan. And Dr. Mohanan, Dr. Claire comes from the the North India, and he said that he comes from Punjab, and we at North India are known to have some bad lifestyle maybe, and also the eating habits are very, very different. I want to understand from you that these points which Dr. Claire highlighted, that even in US the Indian population has higher risk of developing cardiovascular diseases. We here are predisposed. Are we genetically predisposed to have higher chances of getting into higher cardiovascular problems, or it is primarily man-made factors like lifestyle or smoking or obesity, which Dr. Claire has highlighted? Sir, your voice is not.
Say that don't blame the genes, don't blame the nature, blame your nurture. See, as you said rightly, India harbors 20% of the world population, but we have 60% of the world's heart disease patient population. So we have a huge population, mainly because of the preponderance of risk factors. I'm not saying genetics has no role. Genetics definitely will have a role. Dr. Clare has extensively dealt with the preponderance of risk factors amongst Indians, whether it is an Asian Indian or Indians migrated to the other parts of the world. So there could be an element of genetics involved. I'm not negating that, but fundamentally, it is the preponderance. For example, in South, there is not much of a South-West, North differences in the incidence of coronary artery disease. When we did the prevalence of risk factors study, prevalence of coronary artery disease, fortunately, Kerala Cardiological Society has been in the forefront of gathering information on the prevalences and of risk factors, and also on the acute heart attacks. And what we found was astounding. As he said, about 30% prevalence of hypertension, about 18 or 16 to 18% prevalence of diabetes. Even the prevalence of coronary artery disease in the urban area was something to the tune of 11 to 12%, not 7 or 8, as earlier mentioned. Unfortunately, in Kerala, there is no urban-rural difference. It's all urban. So you have a high prevalence. So the important thing, apart from saying that we have high hypertensive, diabetic, obesity population, the World Heart Federation and the other data give you a very pitiable result of control of these diseases. Now, only 15% of our hypertensive in India are controlled to the target blood pressure goal. Not to speak of control of diabetes or cholesterol disorder. So fundamentally, the problem lies with the excessive risk factors, not controlling the risk factors. So these two are possibly the most important reasons why we have a preponderance of the disease, and it is very much the time for us to think about. You were mentioning earlier about we will come to the prevention later, so we will come to the prevention later.
Thank you so much, Dr. Mohanan. So you are saying that it is more of our own nurturing, or the way we are, choosing to live, that is leading to the increasing incidence of this disease. And but sometimes I also feel that all those factors which we counted are also equally prevalent in Western society. And I think our whole lifestyle is getting more and more westernized, what Dr. Claire said. So it's still why we have more chances of developing cardiovascular disease. Let me take maybe Dr. Sandeep Khasa is with us. So
Kamal, I'll just say one of the greatest epidemiologists, cardiologists, or the preventive cardiologists in the country, not in the country, in the world, Professor Salim Yusuf, he is basically from Kerala. He said, you strip a person of his risk factor, then an Indian is equal to Caucasian. So it is the risk factors which makes you vulnerable.
Okay. Yes, doctor. So, Dr. Sandeep, what's your take on this? You heard Dr. Mohanan and Dr. Claire, highlighting these aspects. Why do we have more diseases? Do you have any more perspective on it, sir?
Thank you very much, Kamal, for inviting me over here. I am a junior cardiologist as compared to Dr. Claire and Mohanan. They are my esteemed seniors. And they have rightfully said, in India, we have a very high incidence of cardiovascular disease. The major factor is our lifestyle, what they have highlighted. Most important thing, lack of sleep. People now doesn't take good sleep. Then lack of exercise. Thirdly, the diet we eat. Now it contains lots of fats, and they are usually saturated fats which we eat from outside. People don't use good oils when you are taking food from outside. My generation, as compared to Sir's generation, we are eating at least 3-4 meals in a week from outside, which we don't know how it is cooked. And it contains lots of fats, which is basically causing this diabetes, hypertension to come early in our life. And rightly said by our sirs, our lifestyle is the main cause why we are seeing such a surge in cardiovascular disease in our country. I have moved from Gurgaon to a smaller district 2 years back to work in my own district. I was having an impression over there that it is basically it is urban disease. But now in the rural areas, I see people coming of age of 20s and 30s having MIs, and they are visiting us regularly. The main cause is our diet has increased, but the exercise which we used to do in our fields, now nobody does it. All things are mechanized. They does everything on tractors and all these things, and they are not doing exercises. But the diet which our forefathers take, they are taking same. In addition to that, we are also having fast foods. And secondly, another thing is our forefathers used to take a good amount of sleep. Now the sleep has reduced tremendously in youths. They are spending more time on these WhatsApp and all these things. Now you have got Netflix and so many things. They have their times on them rather getting a good sleep and a good exercise, which is basically leading to increase in all these diabetes, hypertension, and cardiovascular diseases.
Okay, Dr. Sandeep, thank you so much for bringing that perspective also, that how, which Dr. Claire also highlighted, that this is not only about the urban, disease anymore. It is equally, and you are, kind of giving a testimony of that as you are practicing there. This particular gratitude week which we are doing is also about understanding the lives of our doctors. And while we go on emergencies, and when we have these diseases, which may be many times something infects us as COVID-19, which is not your choice to get, but it is also something which we develop ourselves, like cardiovascular diseases, which you are all attributing to the lifestyle. Dr. Mohanan, I think Dr. Claire has gone to the surgery again. Dr. Mohanan, you people have to, as a cardiologist, you have to spend a lot of time in the emergency rooms. And also, as I said, and what we hear and what I have seen also, you have extended days to, since the burden of the disease is too much, that I think you people have a lot of time in the cath labs. What has been the isn't it a little bit of stressing for cardiologists also to work so long? And do you sometimes regret to be a cardiologist? You could have been some other specialist rather than being a cardiologist.
I will not say that. I think I will always consider it as a privilege to be trusted with something as important as your heart. And I always say, arms to God, that I have been entrusted with job. So it is true that cardiologist job is a 24/7 job, but that is that is the good part of it. The interventional cardiology, at least, as even though I'm not as senior as Klebel, I did my cardiology training in mid-80s. And that was a time when the interventional cardiology was, coming in a big way. But then of late, you could see here that it has expanded so well. The brave new world that has considerably reduced the problems for our patient. At the same time, as you said, they increase the work stress for the cardiologist. But then that is you are trained for. We are trained for taking care of our patient. And as you said, the burnout, which every time the Western media, we don't dwell on the burnout of doctors very well, but then that also we are seeing in India. Now we see young cardiologists, because of the work stress, now giving it to. But then there are remedies for that. I'm sure Dr. Clark can spread some light on that.
Dr. Claire, my question was, we are seeing that you people spend a lot of hours on cath labs and emergency rooms, and does it also add to the stress in your life, which is, you said that the stress of work, long hours, multinationals, pressure, targets. You also have a target, I believe, to cure as many people as possible, or to make sure that every time you operate on, you get the right outcome. Does it also plays a role in the heart health of a Dil Ka doctor?
Yeah, am I audible, Kamal?
Yes, sir.
Okay. So first of all, I want to reiterate what Dr. Mohanan said. See, in my opinion, it is the biggest blessing of life from God if anybody becomes doctor. I will tell you the reasons. And if you become cardiologist, it is the biggest blessing from God. Why? Why it's a blessing to be doctor? If I take it this way, that if God has considered me capable and worthy of taking care of human beings, my fellow human beings, He has already considered me higher than others. He could have made me mochi, He could have made me a butler, He could have made me anything in the life. Now there are people who earn money by cutting, grass and cutting cows and serving meat, but God has made me a doctor. That we know you are better than others. You look after your human beings. Now, Jindagi mein, what is there the best thing in the human body? Nothing better than heart. The poetry has been written. Your lot of grants, lot of books, lot of shairi, lot of these ghazals have been written about heart. And if you are a doctor of heart, what else you want in life? And I tell always my patients, I say I put a catheter and I go directly into the left ventricle of the patient. No wife, no husband can go into the heart of any of their spouse, but I can go. And many times I ask them, well, I can see some girlfriends in your heart. Should I tell your wife or not? So I think it's a great privilege. Now coming to the stress associated with the profession, there is no doubt that in medicine is one of the very, very stressful professions for almost any doctor. Why it's stressful? First of all, many long years of studies, hard studies, lot of exams, then long duties as residents, as fellows. We have worked 36 hours non-stop in our PGI days. Then when you become doctor, then it's a responsibility which is almost like a 24/7, so then when you are a interventional cardiologist, what Mohanan said is that, for example, you are a physician, you write some medicine, go home, and patient dies. Patient will be upset, or the relation will be upset, but they are less likely to blame. But here, if you do a procedure on a patient, कहिए हम तो बहुत ठीक ठाक थे, ये तो आपने एंजियोप्लास्टी करी है, and that's why our patient has gone. So any patient, believe me, Kamal, any patient who comes on my table for any procedure, any patient can die. I understand that. And let me tell you, the people of this country have no idea that how much stress a doctor goes through. They only know one thing: the doctor is charging so much of money, doctor is fleecing us, doctor is doing surgery when it is not needed. There's nothing, I don't hear good things about doctors in this country now. And believe me, that many times I feel like quitting the profession and going to my village to do agriculture. That may be better. Because educated society, I tell you, educated people in Delhi, parties, anywhere you go, they just criticize the medical profession. And now we have become barriers all of a sudden. Even Modi Sahib is clapping 5 minutes for us. And now they are celebrating 1 week. But after 1 week, they'll again think the doctors are thieves. They break the walls of the hospital if the patient dies. So there is a lot wrong in this society. But that doesn't deter me to remain a doctor, to do my best in my life. Now coming to the stress of being a doctor or an interventional cardiologist. Stress is a individual perspective of life. Anybody's individual perspective of life. I have practically no stress being a doctor, being an interventional cardiologist. I do my procedures, I do with a peace of mind. And I'm not scared that a patient will die or a complication will occur, because I know some complication will occur, some patient will die. After all, I'm a human being, I'm not a god. And if a patient tells me that he wants 100% result, I said, you go to God, don't come to me. Sorry, I can't give you 100% result. India में problem ये है, Kamal, that the patients have no capability to listen to truth. They are not willing to listen to truth. They are not willing to listen to complications. They only want good things. And that is why doctors have to tell lies in this country. Because they are not willing to listen. If I tell them there is a 1% chance of death, they'll run away. ये कैसे हो सकता है? ये कैसे हो सकता है? फलाना हो सकता है, धमका हो सकता है. So there's a lot to be done by the way of education of people in this country. And there's another thing which people of this country don't realize, by the way, that in India, Indian doctors are one of the best in the world. This is clearly proven because I have worked in Middle East, I have worked in UK, I have worked in USA. Everywhere Indian doctors are preferred. But the same doctors in India are being criticized by Indians, because they don't understand their capability. The best doctors now in India, in the US are Indians. In fact, there is a study published by published study, I think by John Hopkins or by the Harvard, that they did a study that the patients treated by Indian doctors had less chances of dying as compared to other doctors. It is a documented, well-written publication, which Indians don't understand. Another thing Indians don't understand is that they are getting the best medicine at the level of the Western standard medicine with 1/3 or 1/4 or 1/5 of cost. No sensible doctor, even a simple doctor will charge less than $100 for a consultation in anywhere in the world. India doctors are available for 200, 300, 400 rupees, and that also are being criticized. So there's a lot to be done by way of health education, lot to be done to tell people that what we do, our standards are. Okay, I don't recommend. I'm very against those doctors who do wrong things. There are some people who will do wrong things, but then every doctor, at least to my best of my knowledge, majority of the doctors are conscientious. They try to do best for their patient. They want to save the patient. They don't want to loot the patient, as is the perception in the society. So that perception we need to change. I think IMA has been very unsuccessful to take our case to the public, to the government of the country, that please understand the value of doctors of your country. Thank you very much.
Thank you so much, Dr. Claire. And you have highlighted most of the points which revolves around it. And this gratitude week which we are observing is not from the government of India. It is our initiative that we thought that there is a need of filling this ever widening trust deficit and gap between the doctor and patient, and we need to educate our patients that.
Kamal, before you continue, I want to tell you one thing more. Now, listen, I have said it many times. It has come in times of India. The people who do wrong things in department, in any sector, there should be accountability. Now, one of the biggest problems is that there is no auditing in India in a medical profession. Anybody can do any procedure, but there has to be auditing. And people who are guilty, they should be punished, so that at least good people should not get a bad name.
Yes, that is important. So, but as you highlighted, that majority of doctor, and I think each one of the doctor do try that they get best outcome for their patients. The costing and then the charges, and those may be the different thing, but at least nobody wants to get a bad outcome of the procedures or the healthcare which they do. Dr. Mohanan, I know Dr. Claire, and I can understand that how he has always been jovial, cheerful, and hardly you can see the state. I think he's in between of the surgeries also and going. But is it the same for you? You are also able to take those decisions, those stressful decisions on the cath lab, where you are going to operate, not operate, what patients want, what is the family expectation, and especially when the patient is in early life, early stage of their life, the pressure and expectations even further build up. What is your story on that?
I think we should understand that healthcare is a team sport. Now we have that is the success and sometimes the failure of that. And if you have a good team, then you are trying to now beat the burnout and the problems. Now these are things. This is a world over phenomena. The trust deficit that we were mentioning is something which have been seen prevalent. It is a little more excess in our country. But as Dr. Claire was saying, it will be a very bad day for me if I do a mistake that hurts my patient. Now, people have to realize that. That will be one of the most disappointing time of my day. So everybody has a responsibility and to observe. And one of the major problem has been our communications with the patients and relatives are also at fault. I will not completely absolve the doctors of the so-called. We have also a role, because many a time one of the problems in medical curriculum education is that you're not taught. You're not taught to how to convey a bad news to your patient or your patient's attendant. But the things are changing, times are changing, and we have now, at least now, I'm sure, Dr. Clay earlier was saying, it should be a wonderful time when we have a medical auditing, and that is definitely something which I look forward to.
Yes, Dr. Mohan.
Okay, so basically you have the burnout. You have very many dissipating ways. You can, because I remember now I was in the medical college for about 10 years. Then in a private sector where we started doing the intervention. Then we have a team, and then the gradually you feel a little bit of your burnout. The best way to beat is go into something else. Like we do a lot of research these days. We have one of the largest publications these days. So it is always possible to combine academic research, teaching, have a good team, have your juniors, mentor them. These definitely will find a way to mitigate the problem of burnout. I'm sure about it.
I will agree with Dr. Mohanan. See, I tell you, I think the only way to have a better quality of doctor's life and to prevent burnout is that we should not work as individuals. We should work as teams. So if you have a team, for example, then you are not supposed to work 24 into 7. That is nonsense. Nobody can work 24 into 7. Actually, if you work 24 into 7, you are doing disservice to the patients. Why? Because your mind cannot be capable to work like that. So you have to give proper rest to your mind. In fact, there should be law that no doctor should work for more than particular number of hours. Then somebody next should take over. In my team, for example, we have very clear policy that one person will be on duty after 5 p.m. He will take all the calls. People are not supposed to disturb everybody. So group practice, working as a team is the only solution. Not only it will give you better quality of life, it gives you better negotiation with the private hospital, the administration. If 7 cardiologists of a hospital say that we want this rate, this revenue from you, and if you don't agree, we are all going, they'll fall on your feet. What they do is that they divide the doctors. They divide one doctor against the other. The doctors should understand one thing, that the victory is in unity, working together, working as we, not working as me. We should kill the word me in our life.
Thank you, Dr. Claire, to bring about that aspect also. But I like this idea that there should be a predefined work hour. As you see that a pilot can fly only for a certain hours and will have to take a certain hours of rest. I think that is where and I believe, and I always use this imagery, that the problem of trust deficit between the patient and doctor is the similar situation when a passenger sitting in a plane and thinking all the time that the pilot is not trained enough and he may crash. Now this is the a mental trauma will develop, that even if you land safely on your destination, your mind is going to be in mess. So I think that is where we need to make sure that the healing process is not impacting because of this distrust, because of the many other things which come in between, and that's where we are trying to highlight with this.
Kamal, listen. Actually, to be honest with you, because I worked in the Western civilization, there are two major differences between Western civilization and India. One is that in India, everywhere in life, there is a lack of trust. We have no trust in our builder. We have no trust in the shopkeeper. We go to a sari shop. We want to confirm from 2 other shops whether he's looting or he's giving the right price. If we have to buy a house, we have to ask 10 people, our contractor, because we don't believe him. But that's a reality. Why this phenomena has developed? Because there are people who are thieves in this country and they get away without being punished. Okay, human mind is same everywhere. Americans are not more honest than us, but there are systems, there are laws and regulations. In India, that application of law is missing always, because if a contractor fleeces you money, then you can't get the money back. Whatever you do, you can go to the court for 20 years, nobody will listen to you. So lack of trust is in general life's every field there is lack of trust. Similar is the problem with the medicine. So medicine cannot be, see, the doctors cannot be angels when everybody else is a dacoit or a thief. We are also part of the same society. You know, the builder will come and he will start abusing the doctor that they are thieves, but he doesn't admit himself that how bigger thief he is than the doctor. So that is one difference, lack of trust. The second thing which I find in India is time. You know, whatever you say, their certainty is very little. For example, if I tell, okay, I will come at 7 p.m. or you come to me at 7 p.m., it doesn't mean that he will come at 7 p.m. It may be 8, it may be 9, it may be 10. So there's a lack of respect for time.
Responsibility.
In India. So everything is uncertain. Hoga ja nahi hoga, inshallah, hoga ja nahi hoga. So that is the type of life we live in India.
Then it's absolutely right, even though it's painful to accept that. But then the people's trust has come down, mainly because of that, but also partly, as I was earlier mentioning, also because of our training program also have to change. We have to give more importance to the communication, more importance to clinical examination. See, unfortunately, because of the technological improvement, which is absolutely important, the technological importance should not take away the ritual of clinical examination. See, what happens these days is many of the time, the clinical examination is namke vaste. But the power of touch, of healing, no, cardiologist or any doctor doesn't cure. We heal, but we can definitely heal. And people should understand that. And as Dr. Claire said, it is something which we have to work also very hard to bring back that trust which we have been having years ago.
Dr. Claire, you're going to the surgery room again?
No, see, I have some cases lined up actually, but I am willing to answer any question you have.
So just hold on for 5 more minutes. Maybe we are going to end it shortly. But let me just take in your younger colleague, Dr. Sandeep, also to understand that you are a veteran. Dr. Mohanan is a veteran. Dr. Sandeep, how do you manage this? The stress of, as Dr. Claire also said, that many times the patient is not ready to listen to that truth. And so how do you manage, and you are working in an environment, I think you will work primarily at the Haryana, area where the maybe, apparent tolerance may be even lesser. How do you manage there?
So basically, I explain everything to the patient. And secondly, I am living in my hometown. So I have got social interaction with the people even beforehand. I know many people over here who came to here for treatment with me. So it's basically the bond I got with them and the explanations I give them. Until unless my patient becomes ready, I don't do an intervention. Until unless he understands what I'm going to do and how it's going to affect him. That is the most important thing. And as Sir has said, it's very difficult to build a trust with your patient nowadays. Actually, I belongs to a very younger generation. I just practiced for last 5 years, and from right now, right from starting of my career, I have seen this thing only: trust deficit between patient and doctors. Maybe 15-20 years back, the condition was much better, but nowadays to develop a trust between you and your patient becomes very difficult. But being in a place where I live, I have lived there for 20 years beforehand, before going for my studies. So many people knows me. That helps me to make a bond between them. When I was living in Gurgaon, it becomes difficult to develop a trust because people are coming from different cities, and it's a first meeting a doctor gets with his or her patient, and it becomes very difficult for patient to understand that while doing an intervention in an acute MI setting, he or she may die. And India people are not able to understand those things. Basically, we need education at the ground level. People should be taught what basically treatment options are, and they should be told about different the mortalities associated with the treatment, as well as what is best for them. This what
Thank
I
you
feel.
so much, doctor. I think you are better adapt to the new environment as you are working. You say that your experience itself, is most of that time you have seen that the building trust is a difficulty. Dr. Claire, I'll come back to coming back to you, and we will have a quick round of two questions. One is, we are living in a COVID-19 pandemic time, and we saw in the last 40-45 days, or almost not 45, so sorry, now it's almost becoming 4 months, and that initial 50 days almost were having a situation where healthcare was broadly disrupted. What we believe and what we have seen, that you can put people in lockdown, but diseases cannot be put in lockdown. You can't stop heart attacks, you can't stop strokes. uh, what has been your experience in, and how have you been able to manage to provide healthcare to your patients during the time of emergency in the last those 4 months or 3.5 months of this COVID-19?
I think this is a very, very important, relevant question. In fact, Kamal, this COVID-19 has been a very, very new challenge in life to all of us in the whole world. And it has taught us many lessons. In medicine, particularly, what I realize is that we have underutilized the power of information technology, IT, and we have underutilized the telemedicine in this country. So what we have done actually during this episode is that we have shifted more and more to telemedicine, giving consultation, opinions on the phone, on video call, and the hospital has a application where consultation can be done on the telemedicine. But also I have realized that there are many patients who had severe heart problems. They didn't come to the hospital and they lost life because there's a lot of fear in the minds of people that if they go to hospital, they'll get corona. So we need to educate people also that everybody coming to hospital doesn't mean that you are going to get corona. If you have to take proper precautions, and in fact, one patient came with the battery depleted totally. He was getting episodes of unconsciousness, and he was calling 15-20 days back, and I told him that please come, we need to check your pacemaker. He didn't listen to me. Ultimately came with a complete heart block, and we had to do his replacement in an emergency situation. Now, I know some patient who didn't come, they had a heart attack and at home. So it is both ways, we need more education to people, particularly as far as the heart is concerned. You cannot wait in many times. So there is no point sitting at home and getting fear from corona, because in fact the mortality of corona is very low. It is less than 1%, according to me, because there are a lot of positive patients, there are a lot of asymptomatic patients, but the chance of dying from other diseases is much more than from the corona. So that fear is totally, kind of realistic, and we need to tell people, and some kind of campaign by the government should be done that wherever they need treatment, they should not be scared of, they should go to the hospital.
Thank you so much, Dr. Claire, that to highlighting that despite the fear, that the care is very much available at all hospitals, and all the doctors are trying to make sure that within these challenges of and limitations and of COVID-19, the care does not stop. Dr. P.P. Mohanan, I would also like to understand from you. We saw that the number of cases went down, which are reported in emergency, wards. And what was the reason? Was it, many people attributed to, better life, less stress, cleaner air, better food at home, no outgoing, no parties, no accident, no stress, no commuting, stress. Was that the reason, or the heart diseases continue to happen at the same pace? The only thing changed that people did not turn up to the hospital because of the fear of COVID-19.
No, that's a very important point you have brought in, because world over this has happened. We have three or four published data available about the disappearing heart attacks. No? Suddenly you see your ICUs are vacant, no heart attacks, no heart failures. And that was true. They study from the New York 9 hospitals and the Spanish study and the study from the Lombardy, which are all area where the COVID attacks were very, very high. And all of them understood that people have heart attacks, they refuse to come to the hospital, and they have, because the out of hospital cardiac arrest has been high. And one of the fear was that we are going to see all complicated heart attacks because people are remaining in their home with these symptoms. That is one aspect of it. In India, we don't have a true statistics, but at least the National Health Mission data showed that people visiting hospitals have at least 30 to 35% reduction in that. And right now, the Cardiological Society is on a mission to find out what is the percentage of patients who are now admitted in the with acute coronary syndrome during this time, and that we are just trying to compare. One of the attributes could be, apart from patient not refusing to come to the hospital, the decrease in the environmental pollution. Sitting in Delhi, you know that one of the most polluted places in our country, that has been incriminated as an important cause of vascular inflammation. So reduced pollution and stress, work stress, and all this could be. We don't know exactly, but then one of the important reason is people are refusing to come to the hospital with heart attacks, and we are going to see a more dangerous situation in the coming months.
That may be the collateral damage of COVID-19, which may come later to us.
True.
Thank you so much, Dr. Mohanan. Dr. Sandeep, would you like to make your final remark on that about what can be the probable reason, or what is your message for your patients?
Sir, on a lighter note, our cases increased at least 2 times in these times, because most of the people from here used to go to Delhi. So because of fever of COVID, they never went there. But originally, the cases has decreased, and the main causes are, first is people's refusal. They don't want to go to hospital for symptoms. They want to stay at home because of their fear. Secondly, the people are less stressed. They are at their home. They are not stressed from their jobs, and we got cleaner air, as said by sir. It's lots of pollution in and around Delhi. All NCR have highest pollutions, and we got cleaner air just because of these lockdowns. And thirdly, they were doing more exercises. People become more health conscious in these times because of lockdown. They were doing exercises at their home, and they were having their proper diets. So that has also decreased the incidences. And maybe the people who has not visited hospital may came with complications later on, and then can increase burden on us. Yeah.
Thank you so much, Dr. Sandeep. So here we are coming to the end of our session, and I would like to inform all of you and our audience also that this gratitude week, which we started from July 1 on National Doctors Day, will continue till July 7. We are on the 4th day of our observance and our gratitude for doctors. And in the today's session, you heard that how we have become the capital for the world when it comes to cardiovascular diseases or heart diseases, and we have a very, very high number of mortality associated with that, much more higher than what we see in this pandemic also. So what is the takeaway from here is that we as a nation need to take care of it's a wide-ranging war against multiple diseases. We don't have only one enemy, which is COVID-19. We have enemies which are killing our population, our people, every day and in millions of numbers. So, and we lose those many lives every year. And this is the time that we pay our reverence, we pay our respect to our doctors, who are the first and last line of defense for any such disease, any such onslaught of disabilities which can come to us. So thank you so much, Dr. Claire, Dr. P.P. Mohanan, Dr. Sandeep Khaza, to connect with us today on this gratitude week. I would also like to request my viewers and also to all of you that along with this gratitude week, we are running a campaign to request the government of India to set up a gratitude memorial for health guardians, health workers in our country. Like the soldiers, they are dealing with this pandemic, the war which has been caused by this pandemic. But at the same time, as I said, they are always on the forefront of fighting with diseases. So we as a nation should have something to remember that health comes first. Kindly sign the petition for requesting this from the government of India, and the link is available on the chat box of this live, or you can go to our Facebook page as well. Thank you so much. The next session will be some spotlight session. We have some very prominent doctors joining us who will talk about some another aspects of NCDs and the diseases which are taking big toll on our society and on our lives. Before that, I request my team to play the anthem song which has been especially created by ISW Council to pay the respect of all health workers who are working during this time of pandemic, beyond that and before that. Thank you so much. Goodbye. And I hand it over to my fellow in ISW Council, to Vivekanand Misra, to take this session forward. Thank you so much.
Thank you, Kamalji.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
वर्चुअल मीटिंग आज आयोजित आपने किया है, मैं आप सबके प्रति आभार व्यक्त करना चाहूंगा, विशेष करके ISW के प्रति.
Whether it be governments, whether it be countries, whether it be public sector, private sector, everyone has to support each other if we have to fight this battle together.
Why we should also be proud of our profession is that it is a profession which is a service, not a business.
Priority is to avoid getting infected rather than having to jump to reach a hospital for not so emergency, a psychiatric or neurological condition.
This virus mortality with adequate and effective and early treatment Nobody should die.
So when you find joy in these things rather than just the money, I think medicine is a profession that will work very well for you.
Our doctors and nurses, they work tirelessly and never deny care. We salute them all and thank to them. They are our heroes and shine like a gem.
While our soldiers are fighting a battle on the outer frontiers, and our doctors, so auxiliary staff, nurses, technicians, Safai Karamcharis, they are battling a different kind of war within the country.
The right tribute will be prepared for the next war, because this war will come every 30 years to the 30% level and every 100 years to 100% level. If are we prepared for next war? Are we prepared for next pandemic? That will be the major issue.
First of all, I think I need to take this opportunity to thank the godlike creatures on this earth called doctors. So yeah, real thanks to you guys, because I think you've been the one who've changed our life and helped us lead a very normal life.
We have to show more of gratitude to our fellow doctors, to our colleagues, to the society, and the reciprocation has to be 100%.
आशाएं खिले दिल की उम्मीदें हंसे दिल की अब मुश्किल नहीं कुछ भी नहीं कुछ भी याद करेगी दुनिया तेरा मेरा अफसाना
Gratitude Week for Health Guardians. This spotlight session is to highlight well-known faces in their domains and understand their life behind the scenes. Guests today are special as they belong to two of the biggest hospitals in the country. Their domains are different, but they require an efficient mix of patience and quick thinking. In the session, we will listen to the experts on two interesting topics. First one will be on chasing golden hours 24/7, and second on alleviating pain and suffering with care and communication. In the first discussion, our focus will be on how stroke specialists are dealing with stroke patients daily, even during COVID times. On one hand, for a patient, his or her golden hour of 4 hours 30 minutes matters a lot. If a patient reaches at a stroke treating center within that time, a lot of damage can be controlled. And on another side, single stroke specialist has to handle multiple such golden hours of several other patients in order to save them from a stroke attack throughout his day. With this, I would like to introduce first speaker of the session, Dr. Jairaj Pandian, Principal and Professor of Neurology, Christian Medical College, Ludhiana, and Vice President of its World Stroke Organization, who would be sharing his experience on chasing golden hours 24/7. We will have another interesting discussion on alleviating pain and suffering with care and communication, where we will discuss how pain management and palliative care has been playing a pivotal role while undergoing chemotherapy during cancer treatment. With this, let me introduce the second speaker of the session as well, Dr. Sushma Bhatnagar, Professor and Head, Department of Oncoanesthesia, Pain and Palliative Care at AIIMS, who would be sharing her experience on how care and empathic communication can help patients sail through the tough and depressing chemotherapy. So let me begin the session. And my first question would be for Dr. Pandian to know, Dr. Pandian, with shrinking golden hours, chances of reviving a stroke patient can become more challenging. How do you handle this difficult situation to save patients' life?
Yeah, thank you, Mr. Mishra. And it's very important. I just listened to the previous session where cardiovascular diseases, there's been a sudden decline in the number of cases coming to the hospital. So similar trend we observed maybe the first 2 weeks, at least in this region. However, globally, there has been a reduction in number of stroke patients reaching the hospital. There are a few reasons. One is the minor strokes, or what we call transient ischemic attacks. They would think, why should I take the risk of going to the hospital where there are a lot of COVID patients when I have only very minor symptoms? So that is one of the reasons why people were not accessing the care quickly, which they are supposed to do. And the other reasons are probably people's stress level that becomes suddenly low, and also air pollution is one of the biggest factor, and people are able to rest and relax, and so many other social reasons that has really helped maybe some reduction in the numbers of stroke patients. But it was only for 2-3 weeks, I would say, maximum 2 weeks. We could see that decline. But after that, what we saw was a different spectrum. Patients who had a previous stroke, a first stroke, then because of the lockdown, they could not get their medication. Then they were very scared to go out and get the medicine. And some of them had stopped medicine and came with very high blood pressure and bleeding in the brain, what we call intracerebral hemorrhage. So there was a sudden spurt of intracerebral hemorrhage, even in Delhi region also, the experience from AIMS, and also in this region. So whether it is related to COVID or not, it's an ongoing debate that in the neurology community and the stroke community we are looking at this. But one of the main reasons was probably, they were stopping the medications that they were taking earlier, or somebody with the high BP, high blood pressure, and high blood sugar, cholesterol, they stop medication, and then they have a risk of getting stroke. So this is one in terms of the pattern of stroke patients reaching the hospital. But now the last 4 to 6 weeks, the number of patients almost same like what we had, particularly in our hospital, the pre-COVID. And the only thing that really happened in the hospital setup was, and also across the country, is screening these patients. So we know that the golden hour for giving intravenous thrombolytic treatment or clot busting drug is 4.5 hours.
True.
And for stent retriever treatment, it can be up to 24 hours. So overall, if you take that first 24 hours is a golden period, but 70-80% of the benefit people will get if they reach within 4.5 hours. So you need to reorganize the hospital health system. So what happens is, in the emergency department, there is a quick screening of all patients who come in. First is the use of questionnaire. It is across the country. All the hospitals use a questionnaire and see whether they have any, irrespective of any disease, they will look at whether they have any symptoms of COVID or any recent travel. So as a result, what happens? There is some delay. Suppose a stroke patient reaches on time, and then there is at least 30 minutes, 40 minutes delay that is happening because there are so many patients in the emergency. You need to triage them and then screen them, and then so once they screen and say, okay, this is not probably a COVID patient, and if it is a stroke symptom, the stroke code is activated. Once the stroke code is activated, the patient goes to a non-COVID emergency, so probably we have lost about 30-40 minutes in the golden hour because of the screening process that we have initiated. And that is one major change across the country. If you look at AIMS, all the patients coming to emergency are screened for COVID with antigen test. Only if it is negative, no further things happen. If they have a stroke and they have COVID positive, and then dedicated COVID CT scan, which is available, they do scan and then send them to a COVID designated area. So stroke patients No, if they are COVID negative in the beginning in the screening, and they go to the non-COVID emergency, and all the treatment begins there. So there is already a minimum of 30 minutes delay is there. Is somebody who comes within that golden period. And then you need to have a separate pathway where you take these patients, because it is it is a screening test, but you have not done any throat swab or any blood the antigen test. So still you need to treat all people as suspects. So you need to have a separate pathway. You need to take them to the scan. So the prime period of about the initial evaluation we lose, and once the stroke code is activated, then all the things follow. So that initial days we were able to miss a lot of patients who came within the window period, and then there was a lot of delay. But with constant education, even in the COVID screening area, we tell them if it is looks like stroke, quickly screen them, and then send them to the non-COVID area. And there also we have trained the emergency department staff, the doctors, nurses. Once the stroke code is activated, immediately they are mobilized. And in the scan, and then we take a decision. And in the stroke unit or neuro ICU, again, people have to take precautions. So the doctors, nurses, they need to take precautions. Sometimes patients are unconscious. And so one thing we try to do is, when the CT scan of the brain is done, a CT scan of the chest is done simultaneously. In a patient we suspect whether it could be. So early you can pick up early changes in the lungs with the same, you do the brain CT and the chest CT. So that will that helps us to pick up stroke the COVID patients early. But it doesn't happen always. So we have to be very vigilant. And recently we had one of the stroke patients, first he had a stroke at chest infection, became well, went home, and then deteriorated, came back because he had a stroke. They quickly screened, they said this is not a COVID patient. So we have to admit, and he was in frank septicemia, that is infection, chest infection, infection in the blood. He improved, but the chest lesion was not disappearing. The new lesions were coming. So we asked the medicine department, what should we do? Can it be COVID? So they came and saw, we did the throat swab. It turned to be COVID positive. So we have to quarantine so many nurses and a few physiotherapists and few doctors we have to quarantine, and immediately you have to be shifted to the COVID area. So it is a real issue, major issue. Even if you screen early, and then you treat them for stroke, you have to be on a constant vigil. The patient may develop COVID even within the hospital. So these are some of the challenges. One, there was a reduction in number, which has improved, I would say. There was a system change within the hospital. Every hospital had to reorganize the screening system and the emergency healthcare system. And then the nurses, the doctors, the technicians, all have to be trained. So it was a big effort together to treat these patients.
So I would really appreciate Dr. Pandian and all specialists who has been treating stroke in the era where we don't have awareness among the people. So coming to my second question of the session, do you think there is enough awareness about golden hours among general public? How do you feel that layman person can come to know about someone is suffering about some stroke attacks, right? So there are two different perspective to it. One, we are still living in very less awareness. We cannot differentiate between heart attack and stroke attack. Awareness, if we talk about awareness level of normal people, it is pretty less. And coming to the second situation where we are facing COVID-19 situation, people don't want to come out of their home, go to hospital for small symptoms. Sometimes the symptom mixes with their normal symptoms of heartburn and something like that. So how do you tackle the situation? How are you making people aware about golden hour generally before COVID-19 times and now after COVID-19, how people are taking this, how seriously people are understanding this?
Yeah, pre-COVID, yes, the general public largely are not aware of stroke warning symptoms and signs. The main reason behind is that it's very easy to recognize heart attack. Okay, you can educate them. If you have chest pain and you have sweating and the pain radiates to the arm, left arm, then you are most likely you're going to have a heart attack related problem. But on the other hand, because of the stroke, which presents in multiple ways, even if you raise awareness, it is very difficult for people to recognize whether they have stroke symptom or not. So many efforts have been taken from Indian Stroke Association and also World Stroke Organization. We have done multiple campaigns, but it was not a very concerted effort. Through World Stroke Organization, we have a World Stroke campaign, which every year, October 29th, is celebrated as World Stroke Day. Globally, the stroke awareness is, many activities take place and awareness improves. The what we call stroke champions across the country, wherever we are placed, a neurologist or physician, we constantly do public awareness campaign, either in media or in the social media or in the press media, multiple campaigns or focused education programs, or a stroke support group. Through them, people do a lot of educational activities. Compared to previous years, definitely there has been improvement in awareness. If I take Ludhiana, I know that because of the multiple awareness campaigns that we have done in the past, people are aware, okay, if I have a symptom of stroke, I need to get one drug. They know, ek tika lagana हमने, ये 4.5 घंटे के अंदर. So there is some awareness, but it is not enough. For a population like India, number one, we don't have so many stroke centers in the country. Most of the centers are located in the cities and in smaller towns. We are trying to educate people, physicians, number one, and so it's a long process. So even in the pre-COVID time, it was a big challenge. Post-COVID, again, I would say we have done in a small way, like do not stay at home. If you have a stroke, please reach the hospital on time. Globally, World Stroke Organization has done this, and also many regional country organizations have taken this step. Recently, we have just initiated one program where don't stay at home campaign. If you have a stroke, don't stay at home. So that probably should be launched next week. It's from the doctor's side that it's going to come in the social media and also in the press media. So these are the measures that we are taking. Even in Ludhiana itself, I have done at least 2 or 3 press releases. Why you need to take care of your risk factors like hypertension, diabetes, and if you have any of these symptoms of stroke, you don't stay at home, come to the hospital on time.
So while we are talking about making people aware about stroke attacks or golden hours, I will not leave this chance for my viewers to know what are the common symptoms of a stroke attack.
Yeah, so the common symptoms are a sudden weakness in one side of the body. That will include face, arm, and leg. And the second one is sudden numbness in one half of the body. What they call sunn ho jata hai. Sudden numbness. And then sometimes if they have a weakness in the right side, they can have trouble speaking. So there are 3 types of difficulty people can have. One is they can't speak, but they can understand. The second is they can speak, but they can't understand. So that means, if you ask a question to them, they will say something else, but they're able to express. And sometimes you have both the things that will be lost. So you ask them, they won't be able to understand, they won't be able to speak. So these are the common symptoms. And the face suddenly deviates like this. If one side is paralyzed, the other side pulls, and sudden loss of consciousness, sudden giddiness, vomiting, imbalance. So these are the common stroke warning symptoms and signs.
Coming on the stroke attack, post the stroke attack, now patient comes to hospital. So to know, in this bigger population, we have something called stroke treating center. What are those stroke treating center? What is the specialty? What composes those stroke treating centers? is first question, followed by how many stroke treating centers we have in the country and what is the way to go?
Yeah. So the stroke there are many terms people use. Stroke ready hospitals, stroke treatment centers. What I would say is stroke ready hospitals, which applies to India. But if you take US, they have a comprehensive stroke center and a primary stroke center. There are two things they have. So if you take stroke ready hospitals, the hospital should have a CT scanner. The hospital should have a dedicated neurologist or a physician who's trained in managing stroke. Hospital should have a stroke unit, a dedicated area where they can keep stroke patients, 6 beds or 3 beds, whatever it may be. And they should have dedicated team of nurses, physiotherapists to manage these patients. Some basic facilities like a monitor or 1 or 2 ventilators to take care of very sick patients. And the thrombolytic therapy, like what we call intravenous injection, TPA, that drug should be available. And for a higher center, bigger center where we can, if you have a facility for a DSA lab to do brain angiogram and pull out the clot using a stent retriever. So that is the next level. And if you have that level of facility, you need to have a neurosurgery department. Some of the strokes you need to do surgery. So I would say if there is a CT scanner or a physician or a neurologist who's ready to treat stroke patients at a dedicated stroke unit with nurses and physios, that is sufficient to say that this is a stroke ready hospital. And in terms of number of stroke ready hospitals in this country, I would say based on, we have one initiative called Angels Initiative, where stroke ready hospitals are enrolled in a national database, or it's a global database, where people enroll their hospitals and they follow standard key performance indicators. So there are close to 400 stroke ready hospitals in this country. And there are many outside this network. Maybe I would say close to 500 stroke ready hospitals in our country. For a population of 1.3 billion, it is very, very less.
So miles to go in this, and this poses my next question to you, that what measures do you feel Indian healthcare system can take to better handle the stroke cases and save more lives?
Yeah, I would say one is, even though the healthcare system in India is largely private, but very large proportion of patients go to government hospitals because they can't afford, and so we need to really strengthen the government hospital system. So we have started this initiative of through Indian Stroke Association and many of our neurologists who are interested in stroke. We have developed stroke care programs in district government hospitals in the state of Punjab, Himachal Pradesh, Uttar Pradesh, and a few states in Northeast India and in southern part of India. So it is growing. So this is from a personal initiative. Now it's not from a top-down approach, but more and more state governments, we are able to approach the NCD nodal officer and the DHS, and when they show interest, we try to develop through the local champion, and so it is growing, I would say. This is from the government side, but in private setup, it is just catching up. I would say, people know the potential of this particular treatment and the benefit that patients can receive. So there are a lot of private hospitals, they are catching up in developing a stroke program. But our strength of our country would be if every state, or at district hospital level, if we create a stroke unit, that is the best model for our country where we can improve the stroke care.
So thank you, Dr. Pandian, for this wonderful insights which you have given on stroke care and stroke pathways. I'm sure this would help people to be more aware about the stroke attacks, and people will take timely action which can save millions of lives. Thanks a lot, Dr. Pandian, for throwing those insights.
Yeah, thank you.
Moving on to the next session with Dr. Sushma Bhatnagar, who is Professor and Head of Department of Onco-Anesthesia, Pain and Palliative Care, All India Institute of Medical Sciences. So, Dr. Sushma, what is the palliative care? To know the first, what is the term palliative care defines itself, and how does it help cancer patient in their treatment?
So palliative care is basically a care. Palliate means giving a relief to a patient whom we have considered that patient is cannot be cured, or a patient giving a total care to the patient when cure is possible. But for example, a lady has come with carcinoma breast. We know that treatment is possible, surgery can be done, and she can be cured, but she has got a lot of anxiety, a lot of worry. So taking care of all those anxiety with good communication is palliative care in early stage. Palliative care in the treatment stage, when treatment is going on, there are a lot of side effects, lot of anxiety about the treatment part, because there are the side effects of the treatment, and there are so many questions inside that whether it will be cured or not. So taking care of that part by good communication, taking care of those, all the basically total care in the treatment part. And when the end stage comes, that time not leaving the patient deserted, rather there is something we can do for those patients also in terms of taking care of their symptoms. Because ultimately, even if a patient is in towards the advanced stage or in the end of life stage, that time also there are many things which doctor and nurses can do. And all these things, taking care of all those symptoms, taking care of all those anxiety of the patient, is palliative care. And it is not only finishes that taking care of the patient, but it also extends to the family members, because whenever a patient is suffering, the whole family is suffering. If a patient is in pain and cannot sleep whole night, whole family is awake and they cannot sleep whole night. So taking care of family members' anxiety, how they can take care, again good communication. What they want to know, what is happening to my patient, what exactly the situation, what is the stage of my patient's disease, my loved one disease, and what is the realistic hope possible. Because taking, asking them or telling them that you will be all right, don't worry, it does not work, because they are also understanding that my patient is going down day by day, it is the health condition is deteriorating. So it is better to give the realistic hope of the treatment, that what is happening, or realistic hope of the disease. Giving exact prognostication is always not possible, but always giving realistic hope is possible. Always taking care of symptoms, it is possible that patient should be pain free, patient should not be restless, patient should be symptom free. This is what palliative care is. Palliative care is somehow in the medical science, it does not only finishes over here. Even the after death, that is called bereavement care. This is also when a patient has gone, the loved one has gone. There are so many things initially, especially in the 6 months of initial period. The relatives keep thinking, I wish I would have done this. I wish I would have done this. Whether I have done something wrong which has taken him early. This is all they keep on thinking, and there is sometimes grief is so bad it becomes a complicated grief. But good communication, proper counseling, giving realistic hope and honest opinion makes this also very very easy and tolerable and simple. So this is what palliative care, right from the diagnosis to treatment, end of life, and then bereavement, taking care of the patient throughout the illness by giving good symptom management, by giving good counseling, and by taking care of all physical symptoms which patient is suffering from.
Thank you, Dr. Sushma. And now I would like to, request my team to plug in the presentation of Dr. Sushma before we move ahead on the next question. So, team, can you please plug in the presentation of Dr. Sushma?
So I will finish my presentation early, so then whatever questions you have out of presentation, you can ask.
Yes, true.
Ma'am, you can share the presentation. I've given you the access.
Okay. So where it is? I can't see Mani. Mani, I can't see the. This is our shared screen. Okay. can't see. Mani, I can't see the presentation.
This is your desktop window. You need to first open the presentation. Yes, click on that.
Otherwise, you can ask me other question. I can answer your questions.
Sure.
Like, okay.
So moving,
yeah.
yes. So moving on the second question of the discussion, palliative care requires a constant communication with the patient and their families to keep them motivated in their fight against cancer. In this situation, where face-to-face communication is difficult, how do you manage to keep the patients positive and motivated? What do you think about evolving role of palliative cares in times of COVID?
So these are two questions. First is how to keep a patient motivated in any of the disease, and then how to take care of patient in the COVID situation.
True.
So first question I will answer first. So for example, if a patient is suffering from any chronic debilitating condition, it can be cancer, it can be chronic heart disease, it can be chronic lung disease, or it can be chronic kidney disease, whichever is possible, whichever is in this case, how to keep a patient positive. So whenever there is something wrong happens in anybody's life, especially in terms of patient's life, there is always something we can do for the patient. Patients are very, very brave. They understand that something has happened which is not very good for them in their life. They just want to know that what best can be done. So as soon as you explain them the what best can be done in terms of pain management, in terms of symptom management, in terms of their finance management, in terms of their taking care of their all the worries and all. So once you will take care of that, then I think they become very positive. And second positive thing which patient always like, that their doctor and their nurses, they don't, because we should not say that okay, ghar chale jao, we cannot do anything. This nobody likes. Patient is going to go home. Only thing they want to be very, very affirmative that my doctor is with me. We should not desert our patient. That is what patient wants to live. Even if you are dying, or even if you are at the end of life, we are not going to desert you. We are going to take care of you in whichever circumstances you are. We will take care of you even at till end of the life. This is what patient wants to hear from a doctor. Now in COVID situation, we think that COVID 90% patients are asymptomatic or mildly symptomatic. But what I have seen after looking after the patients at National Cancer Institute, Jhajjar, that even a patient who is having mild symptom and moderate symptoms, we need treatment. But even a mild patient, they are very sick. You know what the sickness is? Three things they are bothered about. They are bothered about loneliness because they are alone. They are bothered about isolation because nobody wants to go in front in their room. And even if a doctor and nurses are coming, they are coming with PPEs. So they feel guilty. Something has happened on me. That's why the people are not coming to me. So fear, isolation, and third thing is, which very, very troublesome for the patient, is stigma. Stigma means they are suffering with highly contagious disease. This is the biggest stigma in their own mind. So this stigma, a healthcare professional can remove. Even the society can help in this, because I have seen my patients, those who are going home, they are calling me back and they are saying that their employer is not ready to take them back, because they still feel that even if they are negative, COVID negative, they are still afraid of keeping them. People told me that when I go to take the vegetables outside, when I am buying the vegetables, nobody comes near to me and everybody goes away from me. So a patient of COVID, nobody wants to talk to them, nobody wants to go to them. So this is such a big stigma. So these three things we have to take care, again by educating society, again by good communication, having empathy. Nobody wants sympathy, they want empathy. And by also explaining to the patient that this is not something which is your fault, because patient start thinking what I have done, I must have done something wrong in my past, That's why this has happened. Even the cancer patient many a times ask me that why this has happened. I have never taken any cigarette. I have never taken alcohol. Why this has happened? Similarly, COVID patient starts thinking why this has happened to me. So these are spiritual questions. These are spiritual pain which patients are suffering, and we have to explain in a very empathetic way. This is what a healthcare professional, whether it is doctor or a nurse, they can do and make a difference in patient's life.
Mhm. So we have certainly seen patients suffering from hepatitis or other viral diseases. People generally keep a distance from patients who are suffering from viral diseases, and we can certainly understand the pain of a patient who has gone with COVID-19 infection and has came out of that as a winner. So to my viewers, I would like to request that we are going through this pandemic, but we need to be empathetic with the patients, keep the precautions ready, keep the guidelines, follow the guidelines, but yes, feel the pain of the patient or a winner who has come out of the COVID-19 infection as well. Coming to since we had a talk about COVID-19 era where we are seeing a lot of telemedicine into picture now, and I'm sure this must be evolving at your field as well. So this brings to my third question of the session: what do you see is the role of telemedicine or consultation through the telephonic mode in palliative care? How effective it can be, and where do we stand as a, if we talk about overall health ecosystem and palliative care through telemedicine?
Oh, it's a fantastic question. Actually, since the lockdown, uh, we have we have seen thousands of patients through telemedicine. But we have analyzed 600 of our patients, those we have seen through WhatsApp calls. So I want to tell you three things in this. First thing, that in All India Institute of Medical Sciences, cancer pain management, we never stopped. We were doing cancer pain management through telephonic calls. We were doing cancer pain management through WhatsApp calls, and we were calling our patient physically if they want to procure medication which are not available in the market. So we were continuing to seeing this because cancer pain will not we cannot give excuse to cancer pain that because pandemic and patient can suffer. They need medication. If patient is having pain is constant and he needs medication. So we have done cancer pain management through telemedicine. Second thing, which very important, which we have done through telemedicine or through telephonic call, is end of life care at home. Most of the time when a patient is dying, otherwise it is a human nature and it's a reflex that we run to the hospital. But if we will explain to the patients and their relatives that end is near, it may come any day, and this is the way we have to manage at home, whether in terms of pain, and if the patient is breathless or patient is having fluid in the abdomen, this is the way you have to manage at home. I'm telling you, the relatives or a wife or a husband of the patient, they become doctor and a nurse for the patient, and they learn everything and they learn very correctly. So we have to make them understand that this is the way you have to give medication. And we have given even an end of life consultation through telephonically, and I'm telling you that again, I am a very patient centric person, and patients are very brave. They understand, they realize that this is the way I have to manage. They don't want to run to the hospital because in these days, because of COVID, patients are not coming, but otherwise also we explain to our patient that it is not because you, me, and everyone in the world, if somebody asks us that where do you want to die, we always will say that I want to die with my loved ones. But most of the time, 99% of the time, we are dying in ICU or in the hospital or in the nursing homes or in some hospice or somewhere away from our relatives. So nobody wants to die like this. So through telemedicine, we have also provided end of life consultation. So we have provided symptom management, we have provided end of life consultation, and we have not deprived a single patient, those who was in our follow up, to give our treatment plan or our management plan whether it is through telemedicine or whether it is through physical consultation.
So where once we are talking about your consultation on palliative care, so you are certainly giving your time to patient, consulting them either through phone or WhatsApp or physically if it is possible. I believe there is lot of role of family members to it as well. Once your consultation is done, family members has to take forward those consultation with the patients. So what is exact role do you see of family members in the cancer care for any patient?
Family meetings and family members are the most important part. Basically, whenever there is I think it's not the cancer, it is always any disease. We
True.
should make a team. We should make a team. And this team should consist of a doctor, patient, and family member minimum. And then multidisciplinary team, nurses, and if patient is admitted, then rehabilitation person and all. But the minimum people, those who are required in a team is doctor, doctor, patients, and family members. Most of the time you must have seen that we have realized that a patient comes and husband comes and say that please don't tell my wife, she will not be able to tolerate it. So we says that yes, we will not tell today, but we should tell them. So we should make a team, because otherwise if you will not tell them the truth to your wife, then you will talk to your mother or your father about the disease and in the separate room, and the wife will have something, she will feel that there is something conspiracy going on, and this is called conspiracy of silence. Patient will not be very happy, patient will not be comfortable, and she will keep thinking that something is happening. So it is always better that family member should be their team part. We should explain about the disease, we should explain the status of the disease, we should explain what is the realistic treatment possible for the patient. Then only I think we can succeed and we can have a true, total and holistic care of the patient. Till the time we will not take the family members in the confidence or as a team member, then nobody will be, because otherwise it is always a doctor governed treatment. It is not just not possible. We should make a team, and family members are the integral part of any team when it comes to the cancer pain management and otherwise also.
So we had, we had covered various aspects of, palliative care, how palliative care is contributing in the life of patient, and it is probably, alleviating pain and, distressing patient and allowing him or motivating him to undergo the therapy. So while going through this journey, you must have felt there must be some misconception about palliative care. So what are those common misconceptions about palliative care?
Very important question you are asking. So the biggest misconception about palliative care is people think that palliative care is end of life care. It is not correct. Palliative care is not end of life care, that when patient is dying you just send to the patient to the palliative care. This makes it very difficult for the patient as well as for the treating physician. So at AIMS, what we have done, I will give an example so that you will have a very good idea that how palliative care can start from the beginning. So at AIMS, as soon as a patient, for example, a cancer patient, breast patient, she has got a metastatic bone disease. The oncologist starts sending this patient to palliative care clinic. Our pain clinic, they start sending. So it is not that patient is not going to be treated by oncologist. They are going to treat patient through the chemotherapy or radiotherapy. But even a palliative care physician, the patient is start seeing. We start explaining about the disease. If patient has got pain, we start treating pain. If patient has got myalgia or weakness, we start taking care of that. And patient start believing that this doctor is also part of my treatment. So as the disease will progress, the oncology treatment will reduce and the palliative care team will take the lead. So, but patient will not feel that somebody has dumped me, because as soon as you will tell palliative care, patient start thinking that, oh, they have sent me to the palliative care, this means I am going to die. So this concept will not come. They know from long time, since last 5 years, this doctor is also part of my disease, and they start believing that now the role of chemotherapy is less. That's why the palliative care team is looking after me more. And till the end, both the physician, they keep meeting to the patient, and patient start believing that two doctors are looking after me. So this is the way it is called continuum of care. So the misconception that palliative care should be provided only at end of life, we should remove this misconception. If there is we need palliative care in continuum of care, and there are good robust evidence all over the world. Now there are good literature. This says that early integration of palliative care improves quality of life, and sometimes when quality of life is more, it has certain advantage in terms of quantity of life, because quantity is important. Everybody, we know that we want to survive for 60, 70, 80, 90, 100 years, but nobody wants to survive at the cost of quality of life.
True.
You must have seen that our ancestor or my dadi or my nani, they used to say, Bhagwan mujhko chalte firte utha lena, because everybody wants that they should live till the time they can do their own activity. They are not dependent on others. They are not bedridden, and the children, they are leaving their job and they are looking after. No parents like. So quantity of life is important, but not at the cost of quality of life. Palliative care also explain this, and it helps in the treatment plan of oncologists as well as physicians, that how we can improve quality of life of a patient when quantity, we know that it is already compromised and patient is not going to survive for a long time.
And while we see a lot of specialities in the medical sciences, we know that what is motivating someone to become a gynecologist or an oncologist. But I would like to know from my expert that what has motivated you to become a palliative care expert?
So actually, Vikanand, I am basically an anesthesiologist. When I joined cancer hospital, I used to sit in the pain clinic, because anesthesiologist by default, because you are an anesthetist, you are automatically a pain physician. We used to take care of pain patients. And when we started seeing pain patients in cancer hospital, what I have realized that there are multiple problems patients are suffering with beside cancer pain. And simultaneously, that time in India, palliative care was developing slowly, and it was taking some shape. So I started taking active interest. I started joining various courses, and the Professor Dr. Robert Toycross from Sobel House, Oxford, he was my teacher. I did my basic course, my advanced course in palliative care with him. Then I visited him. I started learning palliative care through books, by attending international conferences, and meanwhile the India was also developing. And then in 2009 we did the annual conference of palliative care in AIMS, New Delhi. And that time I think everybody was sensitized. And then simultaneously I was rotating my resident doctors also in palliative care clinic. They started developing, and you must be surprised to know that 70% of my resident doctors, those who have come from as an anesthetist, they have chosen their career as pure palliative care physician. So they are working all over the country, and they are palliative medicine physician all over the country. And then we simultaneously, Medical Council of India has also recognized that time MD in palliative medicine. So we started trying that we should start MD palliative medicine. We worked very hard, and in 2013 we started MD palliative medicine program in AIMS. So we have now initially there was hesitation amongst the youngsters that whether we should take palliative medicine or not, but now it has become a very interesting branch. People are joining, residents, those who are working with us, they are finding it very interesting, giving comfort care to the patient, giving symptomatic management to the patient, good communication they are learning. And we give a lot of importance to communication, because communication at every level, at the time of diagnosis, throughout the treatment, and when patient is dying, everywhere patient has a role And one more thing which is very important, which we have learned, and I teach my resident doctors, that medical science is not only diagnosis and treatment. There is something else also, because when diagnosis and treatment everybody is doing, but when we cannot treating patient their symptoms, and when patient is dying, this is also medical science. We should learn how we can provide dignified end to the patient, rather than just like a coward person put patients on ventilator and just run away. This is not like this. So always, if you know that putting patients on ventilator and in ICU is not going to help, explain to the patient and relatives, give symptom management, and try to either in the hospital or at home try to send patient at home. This is all. And by doing all these things, pain management, symptom management, end of life care, and then I started working all over country. We have started teaching many institutes now, almost 70 institute in one of the program, that is Cancer Treatment Center program. We have already started palliative medicine program. I am also working through Indian Association of Palliative Care, because I am president, that there should be uniform teaching curriculum all over the country. So all MDs, we have started IAPC Academy. So in that academy, all students and young palliative care physicians, those who wants to already working in palliative care, they should have a good academic knowledge and recent advances. This is what we are doing in these days. Plus, I have also worked with opioid availability in the country, because it is not available throughout the country. I have to tell many things, but I know time is less. But so this is also how to use opioid judiciously, because in developed country there is always an opioid epidemic is going on, and people think that opioids are bad, but they are essential medication in certain group of patients. So how to use it judiciously, we teach our resident doctors, we teach our nurses, that when a patient is on opioid, what is their responsibility when patient is admitted in the ward and patient is on opioid. So how to use it judiciously also, it is one of our fundamental training program which we give to the residents and nurses.
This brings to the end of the session now, and I'm really thankful to you, Dr. Sushma. The way you are taking care of society, we really feel proud of you and your department. You guys are really extending miles and reducing the suffering of patients. Thanks a lot for this, all you have been doing. Now, in the Gratitude Week, we already have, been dedicating our time, and we have been acknowledging, doctors and personalities like you, where we have literally tried to know that what all goes behind the scene. And apart from this, now I would ask my team to play the Gratitude Anthem, which is really, heartfelt dedication and gratitude towards the doctors.
Hi, my name is Padamjit Shelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया.
माँ हमें जन्म देती है तो कई बार डॉक्टर हमें पुनर्जन्म देता है।
संकट की इस घड़ी में अस्पतालों में इस समय सफेद कपड़ों में दिख रहे डॉक्टर नर्स ईश्वर का ही रूप है। अपने जीवन को खतरों में डाल करके ये लोग हमारा जीवन बचा रहे हैं। डॉक्टर जिंदगी बचाते हैं और हम उनका ऋण कभी नहीं उतार सकते। ये हम सबका दायित्व है कि जो देश की सेवा करते हैं, जो देश के लिए खुद को खपाते हैं, उनका सार्वजनिक सम्मान हर पल होते रहना चाहिए।
Artist, Asian Research and Training Institute of Skill Transfer, based out of Bengaluru, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect. Welcome to the IHW Council Gratitude Week on occasion of Doctors' Day. The team from Bengaluru, Team Artists, which expands as Asian Research and Training Institute for Skill Transfer, brings to you the ABCDE Health Quiz. A for anemia, B for building contraceptive choices, C for cancer cervix, kill it before it kills you, D for diabetes, don't allow India to become the diabetic capital, and E for essential and emergency services. Answer the quiz questions and be eligible for being declared as the health and well-being champion for the day. We wish you all the best from Team Artist Bengaluru.
Be the health and well-being champion of the day by answering the ABCDE health quiz organized by Artists. Question for the day on C, cancer of the cervix, reaching every girl, every woman. We march towards building Bharat. What is the most common cause of cervical cancer? A, human papilloma virus, that is HPV. B, radiation exposure. C, pollution. D, using intravenous drugs. Answer now to be eligible to be declared as Health and Wellbeing Champion for the day.
Vivek, for handing me over the session. And I hope you enjoyed the session. And we had amazing day today, another 4th day of Gratitude Week. And we are receiving a lot of positive response. We are receiving amazing response from the audience, from the healthcare fraternity, doctors, healthcare workers. Everyone is so thrilled about this. They're touched. And similarly, we are touched about it because spending time designing this for the sector, for people who are actually doing amazing work, memorable work, which created a lot of warmth among people, is amazing. What we can see in the countries come together and paying their tribute, a lot of well wishes. We are surprised to see kind of response we got from schools, kids, a lot of youngsters, a lot of artists who are willing to play, entertain us, do a lot of things for doctors and healthcare workers. This is just a small opportunity what we have created for people, and doctors and healthcare fraternity to accept the good wishes from people. So today, this is our entertainment section where kids and people, they enjoy a lot of things, and we are very excited to see that Jassi is here with us today. Aditya Jassi. Jassi has been amazingly performing for a very long time. I'm not saying he's veteran, but he's very young, but his experience, his songs have been touching a lot of people, and he's been working a lot. He was, one of the contestants in a sub TV program, and there were other channel also he performed. He was working very closely with Euphoria, and later also he joined a couple of more bands. And I think must be having a lot of fan following, Aditya. And you've been.
Hi, Rajiv. First off, I just want to say that I'm really, really thankful to IHW for having me over. I think this has been. I've always wanted to do something for the health workers and the health guardians. I think this time has sort of made us realize the importance of the medic staff, and honestly, we are as safe as we are because of them. So I'm really thankful, and I'm really glad that I could get to be a part of this. As far as the fan following is concerned, I have absolutely no idea. I just put my head down and work on my music, and that's just about it. If it's good, some people like it, some people don't. I'm fine with it.
I mean, perfectly, and every artist has his fan following, and we all are looking forward for a performance now. The audience are looking forward for a performance.
Super.
Fraternity is looking forward for a performance. So can I hand over the show to you now?
Absolutely. Let's do this.
Over to you, Aditya.
All right, guys. Good evening. My name is Aditya Jassi. I am from a band called The Unplugged Project. I sing and I founded the band, The Unplugged Project. And I'm really, like I said, I'm really, really happy and thankful to be here. I can't wait to entertain you guys. So let's start with something fun, all right? इलाही मेरा जिया आए इलाही मेरा जिया सर पे सवार है जीना बेकार है खाना बदोशियों इलाही मेरा जिया आए इलाही मेरा जिया आए
Ivani?
ऐसा अभी अभी हुआ यकीन हुआ है उसमें कहीं हुई सुबह मैं चल गया सूरज को मैं पिघल गया रूबरू रोशनी रूबरू
Ivani?
ना मैं जाना जो भी तुमने मुझसे कहा है सेन्योरिटा मगर फिर भी जाने क्यों तुमसे मिलके अच्छा लगा है सेन्योरिटा मुझसे अब नजर ना फेरो आओ पास तुम मेरे
मुझको बाहों में तुम घेरो, समझी ना सेन्योरिटा, चाहत के दो पल भी मिल जाए, दुनिया में ये भी कम है क्या, दो पल तो खोआ हो जाए, भूले नहीं होता हम है क्या, सेन्योरिटा स्नो सेन्योरिटा कहते हैं हम क्या, what to do, ओ कुड़िए what to do, तू हो गई मुंडे दी, तू ही पलका मारेगी, तू है देवड़ी दी, तू हो गई मुंडे दी, तू मिलाती पड़ती, तू कर दी, मेकअप तू कर दिया, अंग्रेजी पढ़ दी, तू करती चीने क्वीन साथी फिक्स विक्टोरिया, तू कैंटी बिग बैन दी, पूरा लंदन तू मंगदा, हो जगो नच फैल दी, पूरा लंदन तू मंगदा. Alright, so this next one I want to dedicate it to all the health guardians out there. ये दोस्ती हम नहीं तोड़ेंगे, तोड़ेंगे तो मगर तेरा साथ ना छोड़ेंगे, ये दोस्ती हम नहीं तोड़ेंगे, तोड़ेंगे तो मगर तेरा साथ ना छोड़ेंगे. Darling, darling, stand by me. Oh, stand by me. Just as long as you stand by me. Whenever you're in trouble, won't you stand by me? No, stand by me. Just as you stand by me. इलाही मेरा जी आए, इलाही मेरा जी आए. Alright, so that was a small mashup of a few of my favorite songs. I'm actually going to do one more.
Yes.
This is again, this is possibly one of my all-time favorite love songs ever written.
Oh, that will be
I'm sure
amazing.
you guys have heard of it too. And if you know the lyrics, sing along.
Oh,
I would love to have you guys join in.
that's great.
गज़ब का है दिन देखो जरा, ये दीवानापन सोचो जरा, तुम हो अकेले हम भी अकेले, मजा आ रहा है कसम से, कसम से. गज़ब का है दिन देखो जरा, ये दीवानापन सोचो जरा, वो अकेले हम भी अकेले, मजा आ रहा है कसम से, कसम से. देख लो हमको करीब से, आज हम मिले हैं नसीब से. ओ देख लो हमको करीब से, आज हम मिले हैं नसीब से. फिर भी जाने जा तू कहाँ हम कहाँ, ओ गजब का है दिन, देखो जरा ये दीवानापन, सोचो जरा, तुमको अकेले हम भी अकेले, मजा आ रहा है कसम से, कसम से। क्या करूं मेरा जो हाल है, रात दिन तुम्हारा ख्याल है, ओ क्या करूं मेरा जो हाल है, रात दिन तुम्हारा ख्याल है, फिर भी जाने जा तुम कहाँ हम कहाँ, हो गजब का है देखो जरा ये दीवानापन, सोचो जरा, तुमको अकेले हम भी अकेले, मजा आ रहा है कसम से, कसम से, कसम से, कसम से।
Amazing, Aditya, amazing. Lovely performance. I feel like singing with you.
Oh, I love it. I would much rather
Yeah.
everyone sings with me.
Okay. I think audience are really enjoying.
I really
You
hope
also
so. I'm so
enjoying.
sorry I can't see the comments, but I'm sure people are having a good time, and it's awesome if they are.
Definitely, we are receiving. People are having good time.
That's amazing. So I'm going to continue. And I'm going to actually go a little old school now. I'm going to sing a song by one of my favorite artists. This is a song by a legend called Elvis Presley.
Oh.
There's a bit of a twist that I have in it, so hopefully you guys will like it.
Interesting.
I walked through a party in the county jail. The prison band was there, they began to wail. The band was jumping and the joint began to swing. We should have heard it knocked out jail, but sing, let's rock. Everybody, let's rock. Everybody in a hotel bar was dancing to the jailhouse rock. Spider Murphy played the tenor saxophone. Lenny Jones playing on the side trombone. The drummer boy from Illinois, the crash boom bang. The whole rhythm section was a purple gang. Let's rock. Everybody, let's rock. Everybody in a hotel bar was dancing to the jailhouse rock. Oh, it's one for the money, two for the show. We're really getting ready now. Go, God, go. Now won't you step on my blue suede shoe? If you could do anything, lay off of my blue suede shoe. Blue suede shoes, blue suede shoes, blue suede shoes. Blue suede shoes. If you could do anything, lay off of my blue suede shoes. You ain't nothing but a hound dog. You can't go tight. You ain't nothing but a hound dog. You crying all tight. You ain't got no, I bet you ain't no friend of mine. Hey, hound dog. You crying all tight. You ain't nothing but a hound dog. You crying all tight. You ain't got no rabbit, you ain't no friend of mine. Alright, let's get ready for this. अरे गोरा गोरा ये बदन बिजली से बना 440 वोल्ट है छूना है मना इससे तुम टकराओ ना जान के कमाओ ना इससे तुम टकराओ ना जान के कमाओ ना no 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 जैसी खड़ी है लड़की है या छड़ी है शोला है वो झड़ी है कि बच्चा खेती लड़ी है आंखों में गुस्सा है लबों पे गाती है देखो तारा देखो यार उसको समझती है क्या आई है कॉलेज
कॉलेज में बढ़ने के लिए, जब देखो तैयार है बढ़ने के लिए, हमने खाई है कसम तोड़ेंगे इसका गुरूर हम, हमने खाई है कसम तोड़ेंगे इसका गुरूर हम. Ha 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 ha. Alright, so do we have any Shami Kapoor fans?
Wow.
Allah Allah, इनकार तेरा, ओ आजा 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 प्यार तेरा, अल्लाह अल्लाह इनकार तेरा, ओ आजा 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 आजा, ओ तुम पे हजारों की आंखें, चाहिए तुमको सहारा, ओ पलकों पे आओ छुपा लूं, नाजुक तन है तुम्हारा, ओ आजा 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 आजा. All right, one more.
Oh.
आजकल तेरे मेरे प्यार के चर्चे हर ज़बान पर, सबको मालूम है और सबको खबर हो गई. आजकल तेरे मेरे प्यार के चर्चे हर ज़बान पर, सबको मालूम है और सबको खबर हो गई. हमने तो प्यार में ऐसा काम कर लिया, प्यार की राह में अपना नाम कर लिया. हमने तो प्यार में ऐसा काम कर लिया, प्यार की राह में अपना नाम कर लिया, प्यार की राह में अपना नाम कर लिया. आजकल तेरे मेरे प्यार के चर्चे हर ज़बान पर, सबको मालूम है और सबको खबर हो गई. आजकल तेरे मेरे प्यार के चर्चे हर ज़बान पर, सबको मालूम है और सबको खबर हो गई. Number 47 said to number 3, you drove you to jail, but I ever did see. You sure be delighted in your company. Come on and do the jailhouse rock with me. Let's rock. Everybody gets rock. Everybody on top rock. Always answer to the jailhouse rock. Always answer to the jailhouse rock. Yeah. Always answer to the jailhouse rock. Always answer to the jailhouse rock.
Amazing, Jesse, amazing. What a performance. What a performance.
Thank you.
Time of quarantine is time of, people are feeling so, they have a lot of fear inside. I think looking at you, they must be really feeling entertained.
Thank you.
Amazing.
Thank you.
I've never seen such a versatile, performance recently. I'm telling you.
Thank you, Rajiv.
I'm looking at you.
I have a request for all the viewers who are watching this. I think doctors are fighting for our lives during COVID, and even some of them have even sacrificed their lives for saving us. They are the ones who even save life of soldiers, who protect our country. So
right.
I would like to request all the people watching, the government of India, let's just sign a petition to have a gratitude memorial. This to honor and to remember these workers and these guardians of health. There's a link that's actually there on the Facebook page. Please go ahead, please sign that petition. I think we can just I think we can. This is one way of saluting them and for thanking them, because that's the need of the hour, and we really need to appreciate what they have done for all of us.
That's right, Aditya. Thank you very much for this special request. And this is a petition for gratitude memorial. It is not only for us. What exactly we are trying to create something for our next generation to have, see the contribution what on a daily basis this health worker make for us. They're saving lives. And, it is so unfortunate that we are realizing during such pandemic time their contribution. Otherwise, they've been contributing since ages. You see the healthcare entire ecosystem's contribution.
Absolutely.
Medicine is made, any research center is made, any institution is made to protect health, to protect us, we living being on this planet. What I feel, they deserve it. People, we have a lot of legend statues, we have a lot of memorial, but this is something amazing where our next generation, kids, and coming generation can also feel the same way and pay tribute. Just the amazing performance.
And more than anything else, I think, Rajiv, everyone who's also watching, we all have some family member who's a doctor.
Yeah.
Everyone has some family member or a relative who's a doctor. And we have seen the kind of effort and the struggle they are going through at this point in time. They're not meeting their families. They're not meeting their children. They're not meeting their parents. They're self-quarantining themselves while taking care of, the patients. I think they deserve possibly the most amount of credit. Any more? I mean, whatever you say, it's all peanuts. It all seems like peanuts in front of what they've done.
That was a thought behind, and that's why we have initiated this small week. But I don't think so. Week, day, or an hour or 5 minutes is enough for them.
Absolutely.
Have something permanently where people can go and remember people who contributed, and they're still continuing contributing the entire sector. They can pay their tributes. And
I'm super happy. Like I said, every song is dedicated to the health workers today.
Yeah, why not? Dedication will definitely come. What we'll do, you're playing amazing numbers, Jesse. I want you to continue your melodious journey. People are really enjoying it. I don't mind stretching it a bit, because it's really amazing. Can you play some, you're into soft rock also, I can see that. Can you play some Bryan Adams good number?
Yeah, sure.
Oh my God, that's amazing.
I'll tell you what,
I'll
do a couple of numbers, but these are all my style. So what I generally try to do is I try to make mashups and stuff which keeps everyone happy, because I myself grew up on a lot of R.D. Burman and a lot of rock and roll, and so for me it was literally like R.D. Burman, Led Zeppelin, Michael Jackson, Kishore Kumar, everything.
Yeah.
So what I'm going to do is I'm going to, in my own inimitable style, I'm going to try and do something. Hopefully, so since somebody requested for Bryan Adams, who's one of my favorites, let's try something for that.
Great. Yeah? Amazing. Over to you.
Well, I don't look good in no money suits, no good shoes or designer boots. I try the latest lines from A to Z, but there's just one thing that looks good on me. The only thing I want, the only thing I need, the only thing I choose, 'cause the only thing that looks good on me is you. I'm not satisfied with the scientist style, in those pattern leather pants and a circular file. But sometimes I think it might be looking good, but there's only one thing that fits like it should. The only thing I want, the only thing I need, the only thing I choose, 'cause the only thing that looks good on me is you. Yeah, it's you. It could only be you. Nobody else could ever do. No, baby, it's you. Could I stick to wow? Stick like glue. Baby, bye. तुमको मैंने जब देखा था सोचा था लगा कि तुमसे है मिलना तबाही इस दिल को ही समझाने मैंने कहा इस रास्ते न जाना कभी राही ये तेरे लिए है ही नहीं मेरा उल्टा होने दो अब जो भी हो डरना क्या भला बुरा होने दो अब जो भी हो क्या तुम किशोरी तूने क्या राह चुनी तूने इस किशोरी मैंने राह चुनी मैंने We didn't start the fire it was always burning since the world's been turning we didn't start the fire no, we didn't light it, but we tried to fight it. We didn't start the fire. No, we didn't burn it since the world's been turning. We didn't start the fire. No, we didn't light it, but we tried to fight it. आपकी दुआ दिल हार गया उसके रूप में भी वार किया काम का था बेकार हुआ क्या करूं मुझे नया नाम दो पागल कहो उसकी ही धुन में हो मुझे तुम दीवाना कहो The only thing I want the only thing I need the only thing I choose cause the only thing that looks good on me is you the only thing I want the only thing I need the only thing I chose but the only thing that looks good on me is you
Amazing.
Oh,
what a lovely
awesome.
performance.
I'm going to do one more. I'm going to actually be a little selfish and play one of my favorite songs.
Yeah, we would love to listen to your
I absolutely love retro music. And so this is one of my favorites. I hope you guys like it.
Definitely.
बार बार देखो हजार बार देखो ये देखने की चीज है हमारा दिल रुबा डाली हो डाली हो डाली हो बार बार देखो हजार बार देखो ये देखने की चीज है हमारा दिल रुबा डाली हो डाली हो डाली हो हाथ सी हाथ और भी होंगे दिलदार यहाँ लाखों दिलों की बहार यहाँ पर ये बात कहाँ हाथ सी हाथ और भी होंगे दिलदार यहाँ लाखों दिलों की बहार यहाँ पर ये बात कहाँ नया नया ये हुस्न लाजवाब है कहाँ डाली हो डाली हो डाली हो एक मैं और एक तू दोनों मिले इस तरह एक मैं और एक तू दोनों मिले इस तरह और जो तन मन में हो रहा है ये तो होना ही था एक मैं और एक तू दोनों मिले इस तरह एक मैं और एक तू दोनों मिले इस तरह और जो तन मन में हो रहा है ये तो होना ही था दूरियां वक्त आने पे मिटाएंगे एक दिन इतना पास पास आएंगे एक रात कब तलक है ये जान कब तलक बोलो यार कब तक बोलो 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 एक मैं और एक तू दोनों मिले इस तरह एक मैं और एक तू दोनों मिले इस तरह और जो तक मन में हो रहा है ये तो होना ही था अरे जाना ओ मेरी जाना मैं तेरे ख्वाबों का राजा लैला ओ मेरी लैला आजा मेरी बाहों में आजा तेरे जाना ओ मेरी जाना मैं तेरे ख्वाबों का राजा लैला ओ मेरी लैला आजा मेरी बाहों में आजा नाज़नी गुल बदन आगे हमें खाना देख लो प्यार में ऐसा क्या शर्माना अरे नाज़नी गुल बदन आगे हमें खाना देख लो प्यार में ऐसा क्या शर्माना दिल लगी बन गई है दिल की लगी जिंदगी नाम है इसी का जिंदगी आ गए यहाँ पे हम रोकने यही कदम बोलो 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 एक मैं और एक तू दोनों मिले सहा एक मैं और एक तू दोनों मिले सहा और जो तन मन में हो रहा है ये तो होना ही ये तो होना ही ये तो होना ही
Amazing, Jesse, amazing, amazing. What a lovely performance. What a lovely voice you have.
Thank you.
Amazing. You know, it's such a thrilling. Don't tell me this was your last. We are looking for some more numbers, you know. I know it's tough, but, you know, we are really enjoying. I think all the audience watching live, they're having gala time here. We never had such performance before. Honestly, everyone who was performing their incredible performances we have seen. Yours is unique.
Thank you.
So versatile you are, and
Thank you.
everyone is having amazing time.
That's a great compliment. All right, I'll play
so
some more. I'll
effortless.
play a couple more. Yeah, I'll play some more. But I'll do it in my own style then.
Yeah, I think you're enjoying your own style, and I think everyone is liking that.
All right, perfect. So I'm going to do one by Michael Jackson.
Oh wow!
And go back into one of my favorite. Go back into an R.D. Burman from you. Hopefully, so let's see if it works.
What a talent!
Hey, pretty baby with the high heels on, you're giving me fever like I never ever known. You're just a product of loveliness. I like the way you walk, you talk, you dress. Beauty from miles around. I'll pick you up in my car when we paint the town. Kiss me, baby, and tell me twice that you're the one for me. The way you make me feel, you really turn me on. You knock me off my feet now. My lonely days are gone. Woo! I like the way you're kissing me. Just hold me, baby, and I'm in ecstasy. I've been working from 9 to 5 to buy you things and to keep you by my side. Never felt so in love before. Just promise, baby, that you love me forevermore. Kiss me, baby, and tell me twice that you're the one for me. The way you make me feel, you really turn me on. You knock me on my feet now. My lonely days are gone. वो है जरा खफा खफा चैन क्यों चुरायूं के हो वो है जरा खफा खफा चैन क्यों चुरायूं के हो बात बाकी होना है जो हो जाने दो सोचो ना देखो तो देखो हाँ जान जा मुझे प्यार से सोचो ना देखो तो देखो हाँ जान जा मुझे प्यार से रात बाकी बात बाकी होना है जो हो जाने दो तेरा मस्ताना प्यार मेरा दीवाना कोई हमसे ना हो जाए तेरा मस्ताना प्यार मेरा दीवाना कोई हमसे ना हो जाए रात नशीली मस्त समा है आज नशे में सारा जहां है रात नशीली मस्त समा है आज नशे में सारा जहां है शराब मौसम है आओ ना गले लगाओ ना लगी बुझाओ ना ओ साजना ने जो गले से लगाई है लगी जो बुझाई है ओ जाने जा ओ देखो सीने में कैसी हलचल मची है ओ जाने जा ना 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 देखो सीने में कैसी हलचल छुपी है ओ साजना आंखों से आंखें मिलती हो ऐसे बेचैन होकर तूफान में जैसे आंखों से आंखें मिलती हो ऐसे बेचैन होकर तूफान में जैसे पहुंच कोई साहिल से टकराए The way you make me feel, you really turn me on. You knock me on my feet now. My lonely days are gone. The way you make me feel, you really turn me on. You knock me on my feet now. My lonely days are gone.
Wow, amazing, amazing. That's amazing.
Awesome, man.
Melodious, yeah, melodious, right? You're so versatile. Kind of, the pitch and it is changing. Genre, it's very difficult to handle. I think I've seen these things in very, very less artists, very less singers. Like this reminds me of Kishore Kumar and, those kind of singers.
The
What a
crazy
performance. What a performance, Aditya. What a
Thank you,
performance.
Rajiv. Thank you. Thank you
I
so
am
much.
really happy. I think everyone who's watching, they must have had gala time. It was thrilling.
It's been a privilege. It's been a privilege to be a part of this, and I'm really, really, really glad you guys got in touch with me.
I don't mind you perform for another 1 hour and 1.5 hours. I'm telling you, all the doctors will gonna have tough time. I know you'll mind, but you're such an incredible performer.
Oh, thank you. Man.
I've never seen such kind of genre mixed in one guy who's playing single-handedly without
Okay,
even
I'll tell you what. I'll do one more of my favorites. I'll mellow down the mood a little bit. This is the last one I'm going to do, and It'll be awesome if all of you guys at your end can sing it.
Yeah, we'll try, definitely. We can't match your... no.
Everyone knows the song, and it'll be amazing if you guys can do it.
Okay.
Right?
Definitely, we'll try.
We're gonna try and sing this one. कैसी तेरी खुद गर्जी, ना धूप चुने ना छाओ, कैसी तेरी खुद गर्जी, किसी और टिके ना पाओ, कैसी तेरी खुद गर्जी, ना धूप चुने ना छाओ, कैसी तेरी खुद गर्जी, किसी और टिके ना पाओ। मस्त मौला मस्त कलंदर, तू हवा का एक भवंडर, मुझ के यूं अंदर ही अंदर क्यों रह गया एक पीरा, एक फकीरा यूं न जा, आजा तुझको पुकारे तेरी परछाइयां, एक पीरा हार जा, रे फकीरा यूं न जा। कैसा तू है निर्मोही, कैसा हर जाया, अच्छा चलता हूँ दुआओं में याद रखना, तेरे जिक्र का सुबह पे स्वाद रखना, दिल के संदूकों में मेरे अच्छे काम रखना, चिट्ठी तारों में भी तेरा तू सलाम रखना। अंधेरा तेरा मैंने ले लिया, मेरा उजला सितारा तेरे नाम किया, चन्ना मेरे या चन्ना मेरे या चन्ना मेरे या बेबिया, चन्ना मेरे या चन्ना मेरे या चन्ना मेरे या बेबिया, ओ पिया। टूटी चारपाई वही ठंडी पुरवाई रास्ता देखे, दूधों की मलाई वही मिट्टी की सुराही रास्ता देखे, कैसी तेरी खुदगर्जी, अब नमक रहे ना मिस्र, कैसी तेरी खुदगर्जी, तुझे प्रीत पुरानी किसकी, मस्त मौला मस्त कलंदर, तू हवा का एक भवंडर, कुछ के यूं अंदर ही अंदर क्यों रह गया एक पीरा, एक पीरा यूं न जा, आजा तुझको पुकारे तेरी परछाइयां, महफिल तेरी हम ना रहे तो गम तो नहीं है, गम तो नहीं है, किससे हमारे नजदीकियों के गम तो नहीं है, गम तो नहीं है। कितनी दफा सुबह को तेरी मैंने आंगन में बैठे कैसे शाम किया, चन्ना मेरे या चन्ना मेरे या चन्ना मेरे या बेबिया, चन्ना मेरे या चन्ना मेरे या चन्ना मेरे या बेबिया। एक कबीरा 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 एक कबीरा।
Amazing, amazing, Aditya. This is lovely performance. Memorable one. And
thank you so much for having me. Thank you so much for having me.
It is great. It is our pleasure, and I think everyone enjoyed it. All the audience And would you like to say something about change or? I think this is fine, perfectly fine. So thank you, Aditya. Thank you for joining, and
Thank you.
we look forward for your performance next time soon,
Thank you.
very soon.
I look forward to it too.
Yeah. Thank you.
Thank you. Thank you so much for having me, and thank you to all the health workers and all the health guardians. Thank you so much for taking care of us.
You're welcome, Aditya. So this he was Aditya Jassi. Recently, I've seen one of the best performance by Jassi. It was incredible, unstoppable, and wish we can have some more performance by Jassi. I would request my team to play anthem. We have created an anthem, and I would request my team to play anthem for our gratitude week for our warriors.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
And I think it's been very long time. This Delhi-based band, they've been around all over India, performs at so many places, and it is a mixed, band which is Sufi folk they sing, and they have contemporary pop they sing. They also sing rock, and they have amazing collection of different kind of Sufi numbers, and they call themselves a Sufi rock band also. They have a good set of band, and they've been performing live, and they've been performing at, I've seen their performances in many places. Over to you, Shivaya, now.
Oh, thank you so much. This is
People are
Shiva Rai.
waiting for you. Our health
सबसे
workers are
पहले
waiting.
तो हमारे जितने रियल हीरोज हैं उनको नमस्कार एंड सल्यूट है सबको जो हमारे लिए इतने सारे अपनी फैमिलीज को छोड़ के फैमिली से अपने दूर रह के इतना अच्छा काम कर रहे हैं. तो सल्यूट यू गाइस. So first song I dedicated all my heroes. So I hope you like. मेरी आवाज आ रही है आपको?
Yes.
The first song. क्या कभी अंबर से सूर्य बिछड़ता है, क्या कभी बिन बाती दीपक जलता है, क्या कभी अंबर से है सूर्य बिछड़ता है, क्या कभी बिन बाती दीपक जलता है। कैसी है अनहोनी हर आंख हुई नम, छोड़ गया जो तू कैसे जिएंगे हम। तू ही किनारा, तू ही सहारा, तू जग सारा, तू ही हमारा सूरज, तू ही तारा। जय जयकारा, जय जयकारा, स्वामी देना साथ हमारा। जय जयकारा, जय जयकारा, स्वामी देना साथ हमारा। Thank you. So the next song, सबने सुना है। मैं वो सॉन्ग आज गाने की कोशिश करूंगा जिन्होंने सबने सुना है। सूफी, खाली सूफी नहीं गाएंगे ना, रॉक भी गाएंगे एंड बॉलीवुड भी गाएंगे। कुछ पहले सूफी और एक शेर है। तो सो हाउ मेनी पीपल लाइक इन शेर और शायरी, जो अपने घर से दूर है, अपनी फैमिली से दूर है, अपनी फ्रेंड से दूर है, नॉट फॉर ओनली फॉर गर्लफ्रेंड्स एंड बॉयफ्रेंड। शेर है, बहुत अच्छा लिखा है कि तन्हाई में फरियाद तो कर सकता हूँ, तन्हाई में फरियाद तो कर सकता हूँ, वीराने को आबाद तो कर सकता हूँ। तन्हाई में फरियाद तो कर सकता हूँ, वीराने को आबाद तो कर सकता हूँ। जब चाहूँ तुमसे मिल नहीं सकता लेकिन, जब चाहूँ तुमसे मिल नहीं सकता लेकिन, जब चाहूँ तुम्हें याद तो कर सकता हूँ। मेरे है मौला, दिल लगी में दिल गया, दिल लगी में दिल गया, दिल लगाने का नतीजा मिल गया। मैं तो रोता हूं कि मेरा दिल गया, तुम क्यों हंसती हो, तुम्हें क्या मिल गया। तुम्हें दिल लगी भूल जानी पड़ेगी, तुम्हें दिल लगी भूल जानी पड़ेगी। मोहब्बत की राहों में आकर तो देखो, तुम्हें दिल लगी भूल जानी पड़ेगी, तुम्हें दिल लगी भूल जानी पड़ेगी। मोहब्बत की राहों में आकर तो देखो, मोहब्बत की राहों में आकर तो देखो। तड़पने पे मेरे ना फिर तुम हंसोगे, तड़पने पे मेरे ना फिर तुम हंसोगे। कभी दिल किसी से लगा कर तो देखो, कभी दिल किसी से लगा कर तो देखो। थैंक यू। लगता है मेरी आवाज शायद लोगों तक नहीं पहुंच रही है।
सबसे पहुंच रही है। Everyone is really enjoying. You have beautiful
Oh,
voice.
thank you so much.
Such an amazing,
so
such an amazing number.
Thanks a lot.
Mind-boggling, mind-boggling. You're touching the heart. Your voice is so good.
Thanks a lot. कहते हैं ना कि सुनने वाले ज्यादा होने से इन्हीं अच्छा कि शो अच्छा जा रहा है। ज्यादा सारे पब्लिक हो और उसमें से एक दो सुनने वाले अच्छे हो तो बहुत मजा आता है।
हम तो आपके फैन हो गए हैं।
थैंक यू सो मच। ओके, नेक्स्ट सॉन्ग, सच में ये सॉन्ग मुझे बहुत पसंद है और ये जितने हमारे हीरोज हैं उनके लिए डेडिकेट कर रहा हूँ। टूटा टूटा एक परिंदा ऐसे टूटा कि फिर जुड़ ना पाया, ओ लूटा लूटा किसने उसको ऐसे लूटा कि फिर उड़ ना पाया। गिरता हुआ वो आसमां से आकर गिरा जमीन पर, ख्वाबों में फिर भी बादल है थे, वो कहता रहा मगर के अल्लाह के बंदे हंस दे, अल्लाह के बंदे, अल्लाह के बंदे हंस दे, जो भी हो कल फिर आएगा। अल्लाह के बंदे हंस दे, अल्लाह के बंदे, अल्लाह के बंदे हंस दे, जो भी हो कल फिर आएगा। सिंग अलोंग गाइस। होके अपनी पर ही तो होके अपनी पर ही तो उसने था उड़ना सीखा, होके अपनी पर ही तो होके अपनी पर ही तो उसने था उड़ना सीखा। गम को अपने साथ में ले, दर्द भी तेरे काम आएगा। अल्लाह के बंदे हंस दे, अल्लाह के बंदे, अल्लाह के बंदे हंस दे, जो भी हो कल फिर आएगा। थैंक यू सो मच। मैं स्थाई और अंतरा इसलिए कर रहा हूँ स्टैंजा कि ज्यादा से ज्यादा सॉन्ग है ना गा सके।
Yeah, that's amazing. That's good. People have variety also.
Thank you so much. Thank you so much. चलते जरा नौसर साहब की तरफ।
Oh, so nice.
It's a famous number. So old is gold. It's a real Sufi song. नौसर साहब जितने भी सॉन्ग्स गाए वो सच में अमेजिंग है, और उनको गाना तो खैर बहुत दूर की बात है, तो कोशिश करेंगे। जानिया हानिया तू भी सिख कदी दुख सुख बोलना, तेरे बिन नहीं लगदा दिल मेरा ढोलना है, तेरे बिन नहीं लगदा दिल मेरा ढोलना, हो तेरे बिन नहीं लगदा दिल मेरा ढोलना, तेरे बिन नहीं लगदा दिल मेरा ढोलना। जानिया हानिया तू भी सिख कदी दुख सुख बोलना, तेरे बिन नहीं लगदा दिल मेरा ढोलना, तेरे बिन नहीं लगदा दिल मेरा ढोलना, हो तेरे बिन नहीं लगदा दिल मेरा ढोलना, तेरे बिन नहीं लगदा दिल मेरा ढोलना। दिल तेनू दे बैठी खबर तो तेरे से लई करना है बेपरवाह, हो दिल तेनू दे बैठी खबर तो तेरे से लई करना है बेपरवाह, कीते वादे कसमा तेनू याद कभी नहीं आया, अभी जाना सता वास्ता प्यार दा, ये रुता सोने मुड़ के नहीं आनिया, तेरे बिन नहीं लगदा दिल मेरा ढोलना, ओ तेरे बिन नहीं लगदा दिल मेरा ढोलना, हो तेरे बिन नहीं लगदा दिल मेरा ढोलना, तेरे बिन नहीं लगदा दिल मेरा ढोलना। जानिया हानिया तू भी सिख कदी दुख सुख बोलना, तेरे बिन नहीं लगदा दिल मेरा ढोलना, तेरे बिन नहीं लगदा दिल मेरा ढोलना।
Wow, amazing.
Thanks a lot.
Very nice.
So old is gold now, seriously.
Old is gold. Anytime. What is next, Shiva?
So, आप बताइए कैसा चल रहा है आपका टाइम, कैसा बीत रहा है?
Because we are busy paying our gratitudes to the health worker, people who are devoting their time selflessly to protecting us, and we all are touched.
ये पार्ट बहुत अच्छा था। नहीं, बहुत कम लोग मिलते हैं ऐसे। और अच्छे काम के लिए मुझे लगता है कि जितना आप कर सकते हो टाइम निकालो, करना चाहिए, हर किसी को करना चाहिए।
हर किसी को करना चाहिए। Everyone is doing it, and you also contributing. We are so happy for that. That you're performing live for so many people, and so
हम
many people.
थैंक यू सो मच। हम चाहते थे कि हमारा पूरा बैंड के साथ करें, पर आज वो पॉसिबल नहीं हुआ, क्योंकि आपको सबको पता ही है कि किसी की कुछ ना कुछ एरियाज में अगर खुद को प्रॉब्लम नहीं हो तो आप आसपास बहुत सारे प्रॉब्लम है लोगों को, तो इसलिए सेफ रहने के लिए सारे अपने अपने घर है। नेक्स्ट टाइम जब भी थोड़ा सा माहौल सही हो, सब कुछ नॉर्मल हो, तो कंप्लीट बैंड के साथ आएंगे।
We will definitely. We would love to have your band and host it for such occasions or something. We keep coming up with something. I think people are waiting for your next performance. They are eagerly waiting.
Okay. ये भी नुसरत साहब का ही है, और ये सॉन्ग आज से 40 साल पहले आया हुआ, लेकिन हम लोग आज सुन रहे हैं। मतलब पता नहीं दुनिया का क्या रीत है। और शायद हम लोग भी थोड़ा वो सेल्फिश है कि जब तक लोग रहते उनका कदर नहीं होता, उनके जाने के बाद हर कोई अच्छा कहता है।
कुछ ही लोग होते हैं जिनके जाने के बाद भी लोग याद करते हैं।
बिल्कुल बिल्कुल। और कहते हैं कि अच्छी सूरत को संवरने की जरूरत क्या है? अच्छी सूरत को संवरने की जरूरत क्या है? सादगी में भी कयामत की अदा होती है।
वाह वाह।
अच्छी सूरत को संवरने की जरूरत क्या है? सादगी में भी कयामत की अदा होती है। हुस्ने वालों से ये कह दो कि ना निकला करे बाहर। हुस्ने वालों से ये कह दो कि ना निकला करे बाहर, देखने वालों का ईमान चला जाता है।
ओह, क्या बात, क्या बात।
और जितने भी गर्ल्स यहाँ पे सुन रहे, उनके लिए एक शेर है, पर्सनली अपने फादर को सुना सकते हो। ये लड़कियां, खैर आज गर्ल्स आजकल किसी से कम नहीं है, मैं समझता हूँ कि हम लोगों से ज्यादा कदम आ गई है ना। और कहते हैं कि घर की बड़ी है शान बेटी से, घर की बड़ी है शान बेटी से, दिल का जहान महका रहता है बेटी से। घर की बड़ी है शान बेटी से, दिल का जहान महका रहता है बेटी से। जरूरी नहीं नाम रोशन हो बेटे से, ये दुनिया चली आ रही है बेटियों से।
अरे क्या बात, वाह।
सोचता हूँ कि वो कितने मासूम थे, सोचता हूँ कि वो कितने मासूम थे, क्या से क्या हो गए देखते देखते। मैंने पत्थर से जिनको बनाया सनम, मैंने पत्थर से जिनको बनाया सनम, वो खुदा हो गए देखते देखते। और कहते हैं मैंने मोम कितने किए चट्टानों को, और मैंने पिघला दिया चट्टानों को, और एक तेरा दिल है जो पिघलता नहीं है। और क्या संभालोगे मेरे दिल को, क्या संभालोगे मेरे दिल को, जब ये आंचल संभालता नहीं।
अरे
यार की बात तस्लीम क्या कीजिए, यार की बात तस्लीम क्या कीजिए, अब तो खुद पर भी हमको भरोसा नहीं। अपना साया समझते थे जिनको कभी, अपना साया समझते थे जिनको कभी, वो जुदा हो गए देखते देखते। सोचता हूँ कि वो कितने मासूम थे, सोचता हूँ कि वो कितने मासूम थे, क्या से क्या हो गए देखते देखते। माही 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 माही, बिना माही की मैं दिल पर जावा, रातां दी मेरी नींद उड़ गई, रातां दी मेरी नींद उड़ गई। कोई सुनदा नहीं केनू मैं सुनावा कोई सुनदा नहीं केनू मैं सुनावा रातां दी मेरी नींद उड़ गई रातां दी मेरी नींद लुट गई माही 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 बिना माही की मैं दिल पर चावा रातां दी मेरी नींद लुट गई रातां दी मेरी नींद उठ गई मेरे रश के कमर तूने पहली नजर मेरे रश के कमर तूने पहली नजर जब नजर से मिलाई है मजा आ गया मेरे रश के कमर तूने पहली नजर मेरे रश के कमर तूने पहली नजर जब नजर से मिलाई मजा आ गया बरखसी गिर गई काम ही कर गई बरखसी गिर गई काम ही कर गई आगे ऐसी लगाई है मजा आ गया मेरे रश के कमर तूने पहली नजर मेरे रश के कमर तूने पहली नजर जब नजर से मिलाई मजा आ गया
वाह 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 वाह
थैंक यू
अमेजिंग शिवाय
थैंक्स लॉट
सही में मजा आ गया
तो हम लोग बहुत सारे सूफी बैंड है ऑल ओवर इंडिया में जो लोग बोलना नहीं चाहिए दो सूफी वर्ड्स लगाते हैं अपने बैंड के पीछे तो 2-4 लोग सूफी गा के लेकिन हम लोग हमारा कोशिश यही रहता है कि सूफी के साथ वोकल मेरा सूफी और म्यूजिक एंड बिल्कुल ऑपोजिट साइड है मेटल एंड जैज एंड इंडियन एंड वेस्टर्न तो हम लोग कभी भी म्यूजिक को सूफी की तरह नहीं रखते तो शिवाय का हम लोग कोशिश करते हैं कि ये चीज करने की और काफी लोग पसंद भी करते हैं तो दिस इज सूफी ओके नेक्स्ट सॉन्ग ये भी सब नहीं सुना है कैलाश खेर जी ने गाया है और मेरे बहुत पसंदीदा सिंगर है और मेरा आइडल भी कह सकते हैं आप उनको प्रीत की लत मोहे सी लागी हो गई मैं मतवारी बल बल जाऊं अपने पिया को हे मैं जाऊं बारी बारी मोहे सुध बुध नाय रही तन मन की ये तो जाने दिल्ली सारी ये तो जाने दुनिया सारी बेबस और लाचार फिरूं मैं हारी मैं दिल हारी मैं दिल हारी तेरे नाम से जी लूं तेरे नाम से मर जाऊं Come on guys तेरे नाम से जी लूं तेरे नाम से मर जाऊं तेरी जान की सदके में कुछ ऐसा कर जाऊं तूने क्या कर डाला मर गई मैं मिट गई मैं ओ जी हाँ जी हो गई मैं तेरी दीवानी दीवानी तेरी दीवानी दीवानी तूने क्या कर डाला मर गई मैं मिट गई मैं ओ जी हाँ जी हो गई मैं तेरी दीवानी दीवानी इश्क जुनू 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 इश्क जुनू जब हद से बढ़ जाए इश्क जुनू 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 इश्क जुनू जब हद से बढ़ जाए हंसते हंसते आशिक सूली चढ़ जाए जब इश्क का जादू सर चढ़ कर बोले जब इश्क का जादू सर चढ़ कर बोले खूब लगा लो पहरे रस्ते रब खोले, यही इश्क दी मर्जी है, यही रब दी मर्जी है। ओ यही इश्क दी मर्जी है, यही रब दी मर्जी है। तेरे बिन जीना कैसा, हाँ खुद गर्जी है। तूने क्या कर डाला, मर गई मैं, मिट गई मैं, ओ जी हाँ जी, हो गई मैं तेरी दीवानी, दीवानी।
Wow, wow, wow. Amazing, Shiva, amazing.
Thank
You
you
have
so
very
much,
touching
guys. Thanks a lot.
voice. We have very touching voice. And
Thank you.
Sufi
Thanks a lot.
blends, when you actually sing Sufi, when you say Sufi, it is going so well. I can really see that, that Sufism in your voice. And I think when you have a complete band, it will be amazing.
Thank you so much. अभी गाया था मैंने अभी. The next song. Okay. The next song. हाँ, ये सॉन्ग के बारे में क्या बताऊं, ये भी आप लोगों ने सुना है. हम चाहते हैं कि आप ये सॉन्ग भी सुने.
We all are doctors, nurses, healthcare workers. They all are enjoying.
Thanks a lot. This song from movie भाग मिल्खा भाग. बहुत अच्छे सिंगर है. सिंगर क्या बोलूं, बहुत मतलब लेजेंड है वो. It's a very experienced singer. बहुत ही उम्दा गाते हैं और उनका नाम है जावेद बशीर जी, पाकिस्तान से है. और भाग मिल्खा भाग में आप लोगों ने सुना होगा आपने उनका सॉन्ग.
Definitely.
मेरे यार रब वर्गा. और एक सॉन्ग था उनका ओ रंग रेस. Yes.
Yeah.
So,
I think you should
this
play
one
both.
also Sufi.
So we need both the songs.
Yes.
And I think you can play really well. You can sing very well.
तो ये सब सॉन्ग्स बहुत लोग गाते हैं और गाते भी है, तो कुछ लोगों को पेशेंस नहीं है सुनने को.
No, I think Sufi, most of the people like it, and they connect very fast also. And the way you're presenting, I think they connect more. They're connecting more the way you present.
Right. And Sufi song आपको बता दूं कि एक Sufi song 40 minutes 1 hour तक चलता है.
Yeah.
एक सॉन्ग वो रिदम में आने के लिए कम से कम 15 मिनट्स चाहिए.
Yes.
और इतने देर में तो दिल्ली का किसी भी जगह में ऑडियंस मतलब ग्राउंड ही खाली हो जाए. आजकल के वक्त की बात कर रहा हूँ.
ग्राउंड नहीं, अच्छे से बैंकेट में बैठ के तुम्हारा परफॉर्मेंस देखने का मजा ही कुछ.
नहीं, आजकल लोगों की बात कर रहा हूँ. इतना पेशेंस नहीं है वो. मतलब 15 मिनट अगर स्टार्टिंग करने में लग जाए ना, तो लोग कहेंगे यार चलो निकलो. तो असल मायने में सूफी आजकल बहुत कम हो रहा है. तो वो एक टाइम था नुसरत साहब का.
सूफी के भी बड़े जबरदस्त फॉलोअर्स हैं
सर. सूफी एक नाम दिया गया है, लेकिन एक तरीके से इबादत हम भजन करते हैं वही है. थोड़ा सा इसका अंदाज अलग है, थोड़ा सा बोल, थोड़ा सा स्टाइल अलग है.
It reflects the prayer, it's a Sufism.
Right. Okay, the next song. Few lines, guys. तो मेरा यार है रब वर्गा, दिलदार है रब वर्गा. तो मेरा यार है रब वर्गा, दिलदार है रब वर्गा. इश्क करूं या करूं इबादत, इश्क करूं या करूं इबादत, इको ही गल है. अलिफ अल्लाह, 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 अलिफ अल्लाह. तो मेरा यार है रब वर्गा, दिलदार है रब वर्गा. मेरा यार है रब वर्गा, दिलदार है रब वर्गा. ओ इश्क करूं या करूं इबादत, इश्क करूं या करूं इबादत, इको ही गल है. अलिफ अल्लाह, अलिफ अल्लाह, अलिफ अल्लाह, अलिफ अल्लाह, अलिफ अल्लाह, अलिफ अल्लाह. मैं मंदिर क्यों जावा, मेरा यार खुदा है. मैं मस्जिद क्यों जावा, मेरा यार खुदा है. मैं मंदिर क्यों जावा, मेरा यार खुदा है. मैं मस्जिद क्यों जावा, मेरा यार खुदा है. मेरे पैरों में भंगड़ा, सांसों में टप्पे शप्पे, मैं इश्क तराने गाऊं चप्पे शप्पे। ओ इश्क करूं या करूं इबादत, इश्क करूं या करूं इबादत, इक्को ही गलिए। अलिफ अल्लाह, अलिफ अल्लाह, अलिफ अल्लाहू, अलिफ अल्लाह, अलिफ अल्लाह, अलिफ अल्लाहू। वो नूर का झरना है, मैं प्यास पुरानी, वो नूर का झरना है, मैं प्यास पुरानी। मैंने आंखों से गटक लिया उस हुस्न का पानी, मैंने आंखों से गटक लिया उस हुस्न का पानी। उसे तकते है उम्र गुजारूं, वही और ख्याल जो आए झट से उतारूं। ओ इश्क करूं या करूं इबादत, इश्क करूं या करूं इबादत, इक्को ही गल है। अलिफ अल्लाह, अलिफ अल्लाह, अलिफ अल्लाहू, अलिफ अल्लाह, अलिफ अल्लाह, अलिफ अल्लाहू।
वाह वाह वाह, अमेजिंग,
थैंक यू,
so nice.
थैंक यू सो मच। डॉक्टर गा चुके, ओके। एक हमने पहले भी गा चुके, लेकिन दोबारा उसका रिक्वेस्ट आया कि टूटा टूटा एक बार दोबारा हो जाए।
अरे वाह, this is all time favorite.
Yeah, okay, the few lines are again all heroes. सैल्यूट है सबको सीरियसली मेरे पूरा टीम की तरफ से। गॉड ब्लेस यू गाइस, और ऐसे ही आप अपना खुद का भी ध्यान रखें साथ में, और ऐसे ही आप लोग आगे बढ़ते जाए। So the next song, the few lines, this is for all my real heroes. टूटा टूटा एक परिंदा ऐसे टूटा कि फिर जुड़ ना पाया, ओ लूटा लूटा किसने उसको ऐसे लूटा कि फिर उड़ ना पाया। ये गिरता हुआ वो आसमां से आकर गिरा जमीन पर, ख्वाबों में फिर भी बादल थे, वो कहता रहा मगर के अल्लाह के बंदे हंस दे, अल्लाह के बंदे, अल्लाह के बंदे हंस दे, जो भी हो कल फिर आएगा। अल्लाह के बंदे हंस दे, अल्लाह के बंदे, अल्लाह के बंदे हंस दे, जो भी हो कल फिर आएगा। Come on guys, sing along. होके अपनी पर ही तो होके अपनी पर ही तो उसने था उड़ना सीखा, होके अपनी पर ही तो होके अपनी पर ही तो उसने था उड़ना सीखा। गम को अपने साथ में ले ले, दर्द भी तेरे काम आएगा। अल्लाह के बंदे हंस दे, अल्लाह के बंदे, अल्लाह के बंदे हंस दे, जो भी हो कल फिर आएगा।
Wow, wow, wow.
Thank you so much guys. Thanks a lot.
That's amazing. Amazing numbers.
Okay, अब The few lines, this is my favorite song, और जैसे हमारे बैंड का नाम आपको पता है ये शिवा है, तो डेडिकेट a few lines शिवाया। हाथ जोड़ के बोली गवर जा, हाथ जोड़ के बोली गवर जा, तीनों लोग के बसा है वस्ती में, तीनों लोग के बसा है वस्ती में, आप बसे भी रहने में, आप बसे भी रहने में। अरे राम भजो जी, राम भजो, राम भजो जी, राम भजो, शिव का वंदन किया करो, अरे शिव का वंदन किया करो जी। अगर बम 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 लहरी, अगर बम 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 लहरी, अगर बम 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 लहरी। मेरे एक सुनो अंतर्यामी, मेरे एक सुनो भोले स्वामी, मैं तो दासी जन्म जन्म की, मैं तो दासी जन्म जन्म की, बाली उम्र से भक्ति ही करती, बाली उम्र से भक्ति ही करती, तुम्हें छोड़ के कहीं न जाऊं, तुम्हें छोड़ के कहीं न जाऊं, रात दिवस तेरे चरण दबाऊं, रात दिवस तेरे चरण दबाऊं, तुम्हें जो छोड़ूं तो मर जाऊं, तुम्हें जो छोड़ूं तो मर जाऊं। अगर बम बम bum pe bum bum lahari. Ariya kar bum pe bum lahari. Thank you so much, guys. Take care. God bless you. Thanks a lot.
Amazing, amazing, amazing. That's great. Amazing performance, Shiva.
Thank you so much. Thank you so
You
much.
have
Thanks a lot,
another
guys.
request. You have another request, or this was your last dedication? Would you like to say something about the gratitude petition what we have come up? I would like you to sign the petition, because we have come up with a petition to the government of India to make a gratitude memorial for doctors, nurses, healthcare staff, and all the healthcare fraternity, what they have given us, over the periods and stages. The entire ecosystem
I
is
will also.
working for us. So we have come up with a petition with the government of India
Right.
to
ये
create
बहुत
a
अच्छा काम है.
gratitude memorial. So I want you to
सबको जुड़ना
sign
चाहिए
it.
इसके साथ.
Yeah.
Right.
We want you to sign it, and also request your fan, your friends,
Right. And assign it a
go to
petition. Right.
change.com and sign that. More people, I think it will be more impactful, and it will be great. So we request
All
you
the best.
to support this.
And congratulations. और सब बढ़ चढ़ के आए आगे, और मैं भी इसको शेयर करूंगा अपने पेज पे. और thank you so much. And sign up सबको, और सबको आगे बढ़ के आना चाहिए. एक एक इंसान को आगे बढ़ के ये सब काम करना चाहिए. And really बहुत मजा आया आप लोगों के साथ. And thanks a lot, guys, and thank you so much.
We all enjoyed, all healthcare staff and doctors, nurses.
Thank you so much, guys, and take care. और seriously दिल से सैल्यूट है आपको मेरे पूरे टीम की तरफ से. And thank you so much. आप भी अपना ख्याल रखें. And God bless you. Take care, guys. Thanks a lot.
Thank you very much, Shiva, and thank you very much from ISW.
Thank you so much, sir. Thanks a lot.
Thank you. So we had Shiva, we had Aditya Jassi performing for us today. It was really entertaining, and I hope everyone enjoyed. All audience, doctors. This was a small tribute on our international, our entertainment section of ISWC. We have very interesting sessions tomorrow. Day 5th offers a complete guide and interaction and a lot of knowledge about immunity. We have State Minister of Ayush and Defense coming in the opening session. We have immunologists coming tomorrow for another session. We have even Ayurveda section, so you can get complete insight on the immunity, how to boost your immunity, how to take care of your immunity during this pandemic time, and also how to protect yourself. This is the best way people are saying to protect yourself from any kind of disease, and especially with COVID-19 infection. We also have a session on mental stress management. That is also where people are during this time going through a lot of stress. And you can be online. We start in the morning, 11 o'clock, and in the evening it goes on. Very interesting sessions tomorrow. So we had this entertainment session. Now I would invite CEO ISW Council, Mr. Kamal Narayan, to sum up the day. Over to you, Mr. Narayan.
Yes. Very nice.
Yeah, really.